And we're going to move on to discussion item 18, community paramedicine and community health and injury prevention and triage to alternate destination program update. I'm going to turn it over to Supervisor Desmond. Do you want to make your comments now or after? After. Item 18. Why don't we go ahead
and paramedicine? Okay. I can do it later.
Okay, we'll do your presentation and then we'll have public comment and then Supervisor Desmond. Thank you.
Good afternoon, Chairwoman Vargas and members of the board. On May 4th of 2021, the Board of Supervisors took action to explore the feasibility of establishing a community risk reduction medical services program. In 2021, County Fire returned to the board requesting support for a 3-phase plan to implement the community health and injury prevention program and the community paramedicine and triage to alternate destination program. Today's request is for the Board of Supervisors to receive an update on these program developments. These combined initiatives are the product of strong partnerships between County Fire, which includes the Emergency Medical Services Office, and the Health and Human Services Agency. Today, I'm joined by Jeff Collins, Director of County Fire, Dr. Denise Foster, Chief Nursing Officer for Health and Human Services Agency, and Dave Duncan, Medical Services Director for San Diego County Fire and a prior director of the state's Emergency Medical Services Authority, who will provide a more in-depth overview of these promising initiatives. I'll turn it over to Jeff.
Thank you, Holly. Good afternoon, Chairwoman Vargas and members of the board. The state of California sets the standards for paramedics, and paramedics can only operate within these guidelines and under the authorization of a local EMS agency medical director. In San Diego County, the Board of Supervisors designated local EMS agency is the EMS office, which is a division of County Fire. County Fire has 2 specific emergency medical services functions. First, the San Diego County Fire Protection District, in partnership with CAL FIRE, provides paramedic and EMT service as a first responder. And we also provide ambulance transportation in parts of the district. And second, the EMS office leads, organizes, and regulates the region's pre-hospital EMS system in partnership with ambulance operators and the 20 hospitals. Building on the success of the County Fire's efforts throughout the pandemic, in 2021, the board directed the CAO to establish the County Fire Community Health and Injury Prevention Program. County Fire has been working since that time to fully implement the board's direction. Phase 2, which we are implementing this year, involves waiting for the state's Emergency Medical Services Authority to finalize regulations and adopt a community paramedicine and triage to alternate destination program. Those regulations were finalized last November. Lastly, Phase 3 will include innovative approaches in rural communities to bring resources to some of the most vulnerable and underserved residents. However, as I mentioned earlier, the state sets the standards for paramedics. We need to continue to work with the state so we have the authority to implement much needed programs, which we will cover later in the presentation. I'll now turn the presentation over to Dr. Dave Duncan.
Thank you, Jeff. As we see in this slide, the partnership between County Fire and CAL FIRE has already played a major role in promoting healthier communities. We continue to provide trainings to our residents to increase survival rates from emergencies. Hands-only CPR and stop-the-bleed interventions, when applied early, can be critical to supporting patients with improved outcomes until paramedics can arrive. One area we're very proud of but no longer able to support under the law is our role in providing residents COVID-19 and influenza vaccinations and viral testing. When Governor Newsom's executive order expired in late February, paramedics were no longer permitted to administer these life-saving vaccinations and testing. Included in the CAO's recommended operational plan for fiscal year 23-24 is an additional paramedic training captain to increase the rate of hands-only CPR and stop-the-bleed trainings in partnership with schools and service organizations. This leads us to where we currently stand with Phase 2. Community paramedicine and triage to alternate destination are new models that allow specially trained paramedics to treat 911 callers in new and unique ways. The community paramedic model offers EMS agencies opportunities to help support vulnerable residents in parallel to the traditional EMS delivery system, including EMS-based case management for frequent 911 users and public health collaboration for tuberculosis patient management. Triage to alternate destination offers an alternative to paramedic transport to an emergency department, which is currently the sole destination paramedic patients may be transported to. Medically stable patients could be transported to a behavioral health facility or a sobering center, or in-home support could be provided to hospice patients. The EMS office is responsible for a significant amount of preparation to deploy these models, including working with an advisory council and stakeholders from health systems, behavioral health providers, and hospice services, and EMS and hospital partners. Once this process concludes by the fall, local fire departments can apply for participation in the program and train selected staff members. Next, I will turn the presentation over to Dr. Denise Foster, the county's Chief Nursing Officer.
Thank you, Dr. Duncan. The third phase looks to innovation, opportunities, and partnerships. The current community paramedicine regulations provide an impetus to develop collaborative models that can make a difference in reaching hard-to-serve populations and reducing health disparities in our backcountry, where many residents are older, lower income, and often speak a language other than English. Research has demonstrated that patients recently discharged from the hospital with in-home medical support, in concert with their primary care physician, can reduce readmission rates. In March this year, your board authorized a post-hospital discharge follow-up program to serve the Mountain Empire community that will partner a paramedic and a nurse to make those home visits. I'm pleased to report that our pilot program with Sharp Grossmont Hospital and the Grossmont Healthcare District is expected to start next month, and we will be an innovative approach to supporting residents in our rural communities. Through telehealth technology, paramedics could be authorized to connect patients with a virtual medical visit. Paramedics at the patient's side can assist in performing physical assessments. In this care model, the paramedic will be able to provide care that is tailored to the individual's needs and better situated to connect the patient and their family to community resources. In other parts of the country, including California, paramedics and nurse practitioners or physician assistants are being deployed through the fire services to visit low acuity patients who do not need transport to the hospital but still have medical needs. Services may include minor suturing, providing prescriptions, and making referrals to community-based primary care services. Some additional areas where HHSA and County Fire can collaboratively innovate healthcare delivery in the backcountry include authorizing paramedics to deliver vaccinations. For our residents in the County Fire Service area, the long drive from the rural communities to medical complexes in the cities can be a deterrent, and having fire and EMS professionals already available in their community facilitates access to services. This was critical for COVID-19 and flu vaccinations and could support childhood immunization efforts if authorized by the state. We support provisions that authorize transportation of low acuity patients to urgent care clinics attached to a hospital and accepting these patients regardless of insurance status. We remain focused on services that best match patient needs in all of these options. Not only do we seek to reduce unnecessary ambulance transports to the hospital, but we want patients to be connected quickly and appropriately to primary care providers, enabling appropriate levels of care without unnecessary costs that place patients at risk for long-term medical debt. In other parts of the country, paramedics have greater flexibility to deliver services like these. As HHSA's Chief Nursing Officer and a champion for health equity, I support more local options for how paramedics can be utilized when we share a goal of reducing health disparities for our residents. I will now turn the presentation back over to Holly.
Thank you, Dr. Foster. Today's request is simply to accept this report on the Community Health and Injury Prevention Initiative and an update on the implementation of the community paramedicine and triage to alternate destination programs. We're welcome your board's questions.
Thank you. We're going to go to public comment.
Thank you, Chairwoman Vargas. We have 3 requests to speak on this item, all of those by phone. For those that requested to speak on item 18 by phone, please dial into the conference line now using the instructions that were provided to you. Also note for the record that we did not receive any comments on this item. We'll give the callers just a moment to dial in. We'll hear from the first caller.
Hey, it's Truth, and I want an alternate destination for the county. This item says that the Community Health and Injury Prevention Initiative offers training such as hands-only CPR and Stop the Bleed. I have no clue what either of those things even mean. I only know about regular CPR and tourniquets. But now Phase 2 implements AB 1544, the Community Paramedicine and Triage to Alternate Destination Act. AB 1544, Section 1799.2 of the Health and Safety Code reads, quote, the commission shall consist of 19 members appointed as follows. 1 county health officer appointed by the governor, 1 registered nurse appointed by the governor, and 1 full-time paramedic or EMT2 from candidates submitted by the California Labor Federation, end quote. The Federation's executive secretary, treasurer, money collector, is a liar, Lorena Gonzalez Fletcher. So bad things are in store. The triage system is supposed to be a solution for the permanent decline in the number of EMS personnel available over the last 3 years. But why did people leave and never return? That's because people like you supervisors told people that if they don't get that toxic COVID clot shot that's killed a record number of healthy people, then they'd lose their jobs. So they left, and they're never coming back. Heck, a good portion of them even submitted and got the shots, and now they're dead. Those people are really never coming back, and their families should sue every single person involved. Except it wasn't a vaccine. It was an emergency use authorization experiment sold to gullible suckers and to those who chose a worthless job or standing up for their own rights to bodily autonomy and life. And now we're all going to suffer from people not working in critical fields such as fire protection and emergency medical services. Great job, cogs in the murder wheel. Now you know what that means. It makes perfect sense. I didn't even come up with that line myself. But it plays out right in this type of item when you have a...
Thank you, Chairwoman Vargas. That was the only caller in the queue. That would conclude public comment on this item.
All right, Supervisor Desmond.
Thank you, Chair. Appreciate it. I want to say thank you to our fire staff and the public safety staff for bringing this item forward. It's encouraging to see the results from the community paramedicine board letter that my office brought forward in May of 2021, along with District 4. The COVID pandemic brought many challenges to us in the county, and we were able to come up with innovative solutions by having paramedics giving shots and immunizations in the rural areas, and as mentioned, with the post-hospital wellness services. I think this is something we should all continue to work with and expand if we can. It's a great job of bringing our rural communities that are actually receiving a higher level and more access to health services. So this has been great, a good program, and thank you very much. And hopefully we keep it going, and I'll make a motion to approve this item. Thanks.
Thank you. Supervisor Anderson.
Thank you, Madam Chair. I just wanted to thank everybody for their hard work. First of all, I'm very excited about the crisis stabilization unit coming in my district. You all had them in your district, and they've been highly successful. But now with this program with Grossmont Hospital, reaching out, helping people in their communities so that we keep them out of the hospital, great programs. So I'd like to second the motion and keep up the great work.
Okay, thank you. Without any further discussion, I just want to say thank you to all of you for the work on this program. Paramedicine, I think, is so critical to so many of our communities that are in deep need for access to healthcare. So really appreciate all the work and the creativity around it as well. So with that, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
All right, before we move on to the next item and Dr. Foster leaves, I just want to take this moment. Dr. Foster, don't go anywhere yet. I'm going to embarrass you. I'm just kidding. I know this is your last board meeting, so I wanted just to take a minute to say, oh my goodness, we are so grateful for you. The work that you have done in a short amount of time in this county has been, priceless. And your team adores you, the county thanks you, and I am particularly grateful to you because during some of the most challenging times, I had to hit the ground running on day one, and you were there the whole time making sure that our communities were safe. You understand equity like no one else, and you really understand how to implement that work and make sure that you use data and your love for healthcare, but more importantly, your heart in helping people. And so it's sad to see you leave, but I can't wait to continue to watch your Facebook postings with your family and all the trips that you're taking while I'm working. I'm just kidding. But I'm just so grateful to you, and I just wanted to make it public and just say thank you for your hard work. As much as I want you to have a wonderful, wonderful life, I'm sorry you're retiring. But again, thank you on behalf of everyone in the county. We appreciate you. I'm grateful for you for everything that you've done. COVID, Convention Center, our binational community, et cetera. So thank you. Muchas gracias. All right. With that, we're moving to item number 19. This is the reimagining ambulance transportation services for the county's rural communities and Fire Protection District 1, implementing a new ambulance transportation model in the county's rural communities. So I'm going to go ahead and turn it over to our county team for a presentation, then we'll have public comment, and then we'll hear from my colleagues.
Good afternoon again, Chairwoman Vargas and members of the board. In December, your board directed county staff to explore alternative ambulance transportation service models for the county's rural communities that will enhance patient care, reduce health disparities, and promote fiscal sustainability. To complete this review, the board directed County Fire to contract with a consultant to conduct a review and evaluate whether recent legislative changes associated with Assembly Bill 389 would support those objectives. Before the board today are two items for your review. The first is on the Board of Supervisors agenda. The second is on the San Diego County Fire Protection District Board of Directors agenda. Joining me today is County Fire Director Jeff Collins and Emergency Medical Services Administrator Andy Parr. To hear more about the contractor's work and staff recommendations, I'll now turn the presentation over to Andy Parr.
Thank you, Holly. The Unified Service Area was established in 2017 by the County Board of Supervisors to consolidate multiple ambulance exclusive operating areas inside the unincorporated areas we serve into one unified service area. Prior to this action, the County EMS Office oversaw 3 exclusive operating areas and 7 non-exclusive or undesignated operating areas, which resulted in disparate levels of service to rural communities. Under the Unified Service Area, the county was able to contract with one private EMS ambulance contractor to provide services throughout the unincorporated area. A unified service area has led to operational and financial efficiencies which support additional advanced life support ambulances to most of the rural communities, resulting in more equitable service levels for unincorporated area residents. Despite the enhancements that have come with the unifying and expanding service, the remote locations of communities, low transport revenue, and paramedic staffing challenges prevent the current ambulance model in the unified service area from being fully optimized to meet the residents' needs. In October of 2021, the state of California enacted Assembly Bill AB 389 that included provisions for a county board of supervisors to contract with a fire agency for ambulance service and now codified into law. These statutes authorize the Board of Supervisors to contract with a fire agency to manage and/or provide emergency ambulance services where the county has this responsibility. These policies include options for fire agencies to subcontract in whole or in part for private ambulance transportation services and provides protections for private ambulance personnel if those options are elected. Placing ambulance service under the direction of a fire agency truly unifies operational directions and allows ambulances to be deployed to support patient care needs. I'll now turn the presentation over to Jeff Collins.
Thank you, Andy. Last October, the community of Ramona joined the San Diego County Fire Protection District, and in July, Borrego Springs will also be part of the district. Unlike previous consolidations, ambulances in Ramona and Borrego Springs have historically been staffed by firefighter paramedics, not private ambulance providers. In addition to Ramona and Borrego Springs, County Fire staffed ambulances in Potrero and Pine Valley this year. And we also have cross-staffed rescue ambulances at some stations. The significant overlap between the San Diego County Fire Protection District and the Unified Service Area means there are ongoing opportunities to streamline services. As part of the December 2022 direction, County Fire contracted with Citygate Associates to perform an in-depth review and recommend the optimal service model in the Unified Service Area with a focus on reducing health disparities, improving patient care in rural communities, and potentially increasing the presence of firefighter paramedics in some of our most rural and vulnerable population areas. In Citygate's evaluation of a new ambulance model, the study recommends the San Diego County Fire Protection District assume responsibility for ambulance service in the Unified Service Area upon the expiration of the current ambulance agreement. County Fire is planning to own all the ambulances and equipment, including those operated by a private contractor. Emergency ambulance services under the contract will include all services provided by emergency ambulances, including interfacility transfers and other non-emergency situations. This provides a system under the full control of the county, with decisions being made to promote patient outcomes. Under this model, the EMS office, the Board of Supervisors designated local EMS agency, will retain its statutory oversight of the San Diego County Fire Protection District for quality assurance and medical direction. Approval of today's actions will enhance the EMS capability in the Unified Service Area by improving staffing and deployment models to meet real-time needs. CAL FIRE firefighter paramedics on ambulances can respond to a wider range of emergencies, including structural and wildland fires in geographically isolated and hard-to-serve communities. The system will also be strengthened by the inclusion of a private ambulance contractor for a select number of ambulances and additional program support. This could include contracting for a nurse navigation line to better handle low acuity 911 calls, telehealth services, and potentially having nurse practitioners or physician's assistants to support treatment at home or in the community. These are services that the county currently doesn't perform and would benefit from partnering with a private company. Overall, approval of today's actions will provide exceptional patient care and emergency response to even the most remote areas of the county. If today's recommendations are approved, we will implement this new ambulance model quickly. County Fire is working closely with Citygate to complete their full evaluation by the beginning of next month. This includes communication with other fire protection districts in the Unified Service Area and a final determination on the number of county fire and private ambulances. We anticipate an RFP being released by early summer with a contractor in place by early fall. We will return to the board in the fall to provide an update, address startup costs, adjust the CAL FIRE agreement, and add positions within County Fire to provide oversight and monitoring. The additional funding to be added is part of the fiscal realities of starting a new ambulance model. It is not uncommon to experience a wait time of at least 6 months for bills to be paid by private insurance, which means revenue will be coming in after the initial costs. To cover this short-term gap, we will be drawing down on our trust funds to cover expenses until we begin receiving revenue in mid-2024, and then replenish our trust funds. Over the long run, we anticipate the proposed model to be cost neutral to the county. Services will fully transition under the San Diego County Fire Protection District no later than December 31st, 2023. I'll now turn the presentation back to Holly.
Thank you, Jeff. Today, we're asking the board to approve the proposed recommendations to authorize the Chief Administrative Officer to enter into a contract with San Diego County Fire Protection District to provide ambulance transportation services and to approve all necessary actions required for the implementation of emergency ambulance services agreements. And that concludes our presentation. We're available for your questions.
Thank you. We're going to go ahead and turn over to public comment.
Thank you, Chairwoman Vargas. We have 5 requests to speak on this item, 1 in person and 4 requesting to speak by phone. Also note that we received 1 e-comment in favor of this item. Any members of the public that requested to speak on item 19 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speaker. The individual is in opposition to this item. I'd like to invite forward Mark. Not seeing Mark in the chamber, we're going to go ahead and hear from those that requested to speak by phone. We'll start with our first caller.
It's truth. Pats on the backs and claps for county minions, but not for speakers. Reimagining, transforming, progress, divide and conquer. Everything's a synonym, a coded buzz phrase that means control, invert, and destroy. And just the same as item 18, the lockdowns and COVID clotshots that were initiated by and demanded by you supervisors are what have caused such a shortage of necessary paramedic staff that we've come to this point of pathetic desperation to have to practically beg fire agencies for ambulance services. And everywhere this is occurring, fire response times increase as it just drains from those services too. And that's exactly why AB 389 included the allowance of the fire agencies who subcontract services to a private provider, because nobody's got enough staff. Now, City Gate Associates conducted a review for who knows how much money to give the very predictable answer that the San Diego County Fire Protection should take over as the ambulance service manager and provider for the Unified Service Area. Just like this item says, this half-baked and funneled idea is consistent with California and federal authorities and the new California Health and Safety Code. Translation, it's all just garbage funneled down from the state. The world of this reimagined new ambulance transportation model, contracting with a fire agency, is helping burn everything to the ground. It's not a real solution, it's a Band-Aid. And this county and country is in desperate need for a lot more than a measly Band-Aid. I'm actually going to recommend to everyone to become like some of the Orthodox Jewish communities that have volunteer emergency medical services called Hatzalah. They have their own ambulances, radios, medical equipment, and their services tend to be free or low cost because there's no government middlemen in the way. Now that's a real solution that everybody should consider getting in their community. Thank you.
Thank you. And Chairwoman Vargas, not seeing any additional callers in the queue. That concludes public comment on this item.
All right, well, thank you. I just wanted to say thank you to the team for bringing this item forward. I think contracting with County Fire is an important step for bolstering the rural ambulance system, and I think it's extremely important that we're ensuring first-rate service in our rural communities as well. From an equity standpoint, this allows for prudent action for economic underserved communities that are geographically often isolated in some of these urban areas. And all of you at County Fire are already providing services in Ramona, Protero, Pine Valley, and other communities will be soon providing also Borrego Springs. And so I think having County Fire assume responsibility for the entire unified service area provides a long-term stability for us as a region. I'm particularly pleased that County Fire, this is my favorite part, well, not serving our community is number one, but number two is that we get a higher reimbursement rate by doing this for the billing and being able to reinvest those dollars back into our system. So with that, I'm happy to make a motion to support. Thank you. We have a motion and a second and no additional comments, so please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. Right? All right. The next item on our agenda is item 22, preventing suicide in San Diego County. I want to thank Supervisor Desmond for introducing this board letter. I'm going to go ahead and have public comment and then have you do comment.
Well, let me, if I could start it off.
Okay,
real quick
go ahead.
on this one. Thank you. Unfortunately, on this one, suicide prevention, probably everybody knows somebody who's been impacted by suicide. And in San Diego County alone, in 2021, there was 364 deaths by suicide. That's one a day. Last Friday, we lost a 16-year-old off the Coronado Bridge. Because of the stigma surrounding mental health and suicide and those experiencing suicidal thoughts, many have a hard time seeking help. And what really astounded me is based on preliminary findings in the San Diego County Gun Violence Community Needs Assessment that was just recently done, where we looked to see where gun violence existed and what we can do about it. Between 2017 to 2022, 86% of the gun violence deaths in San Diego County, 86% were by suicide, which I thought was just an astounding number. And so you can see that by the chart up here, and then homicides, you know, it's kind of when we think of gun violence, we think of people shooting people or gang violence or things like that. But, and it's still too high, but it just was off the charts there with the number of suicides in San Diego County and how that it has increased. And of that population, it's the greatest at risk, and the ones committing suicides more now are seniors, 65 and older. So being part of that group raised concerns. But seniors were, you know, during the pandemic, seniors were more at risk to COVID and things like that, and they were disproportionately, I think, affected by lockdowns and social distancing. Just recently, the Kaiser Family Foundation conducted a study that showed 47% of seniors reported that their mental health had been negatively affected by the social distancing and the pandemic-related stress. And we're doing a lot of great work here in San Diego County, it's no question. There's work being done, the question, persuade, and refer trainings, and we also have a crisis line. But obviously, with this statistic, more needs to be done. This action will help take stock of what programs already exist, identify certain populations who need additional help, focus at suicide prevention and outreach on efforts of communities that need it. And our goal with this action is to take another step forward in preventing the increasing suicide rates here in San Diego County. So with that, I'll make a motion, if that's okay at this point, to approve this item, to have staff to come back with a study to see what more we can do to prevent suicide. Thank you.
Happy to second it. Go ahead. Public comment?
Thank you, Chairwoman Vargas. We have 9 requests to speak on this item, 2 in person and 7 requesting to speak by phone. Also note that we did not receive any comments on this item. For any members of the public that requested to speak on item 22 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. Both speakers are in opposition to this item. As your name is called, please come forward and stand against the east wall. I'd like to invite forward Alan C. and Mark.
I think Mark's gone.
You'll have 2 minutes to address the board.
Alan C. Yeah, you showed up there, Jim, firearms is how they committed suicide, but where's the chart showing why they're suicidal? We know what it is. It's the Adderall. We're actually treating made-up diseases, attention deficit syndrome, the anxiety pills. I can send you the data. I've got the, I wish it was part of my slideshow, but in there, 79% of shooters are on anxiety pills. Mood swings up, mood swings down. When it goes down the down peak, they become suicidal, they become school shooters. Look at the last 2 incidents. Nashville, that 28-year-old went back to the school that was upset that the school encouraged her to transition. You ruined my life. She was on anxiety pills. That shooter, the other shooter, most recent one, I think it was most recent one, I can't keep count, he was actually sitting in the hospital waiting room to update his anxiety pill prescription. As I said before with the opioids and everything else, if you don't look at the root of the problem, the homeless, whatever, you're not going to resolve it. And we know what the problem is. I mean, Rady Children's Hospital, they do chop surgery transition on 12-year-olds. But before they do that, they put them all these hormone therapy medicines. How do you think that affects the brain? I call it school to scalpel. Our own school is actually encouraging that in Chula Vista. They're separating, go pick the gender you want, we'll encourage you to be that gender. And then Rady's does it to 12-year-olds. 12-year-olds are actually doing that to transition. But people need to realize when you transition, it's lifelong surgery. It's not 1 or 2, it's 30, 40 surgeries to reopen the wound again, to chop off this chunk of the flesh to become the opposite sex. And they're sterilizing our children. People say they're suicidal because they cannot transition, but the truth is once they do transition and realize the consequences, lifelong surgeries, our children, what they're going through. Think about that. Thank you.
Thank Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Hey, it's truth. The root of the problem is in the chambers and also in the mirror. First, there's no such thing as public health. Someone's suicide and self-harm is their business, not mine. Second, we agree, Jim, that the COVID measures are what led to what this item says was over 700 hospitalizations for suicide and self-harm attempts, with over 364 deaths by suicide in 2021. Maybe you supervisors shouldn't have messed things up by locking down the county. Hello.
Hello? Anybody home? Hey, think this
Just like this item says, you supervisors, quote, further intensify these risks by disrupting social and community engagement, limiting access to health care, and exacerbating feelings of loneliness and isolation, end quote. You supervisors caused the problem. There's no way in heck you're going to fix them. Who would even want your help? Now that would be a death wish. I got a real solution for those suffering out there. First, get help. Don't let things fester and build to the point of self-harm. There are plenty of resources out there for help. There's even organizations that will talk to you 24 hours, 365 days a year. I also recommend finding a healthy artistic outlet to let everything out. Second, someone out there would care if you were gone. You just don't know it. But killing yourself wouldn't make them pay attention. They just hurt the way you hurt. Everyone loses. And third, and most importantly, stay as far away from anything government has to offer you. Like I've said before, DIY is the only way to live. Here's a relative lyric from a band called Hanging Judge. Life is war, and it's worth the fight. And as far as the recommendations, Jim, is the county going to put up "Don't Kill Yourself" banners? But this real item motivator reads, additional funding opportunities. Enough said. It's a money grab.
Thank you. We'll now hear from the next caller.
You know who I am. I would like to just say that everything that you guys do in this county perpetuates people's, issues, whether it be mental health, any kinds of issues. And as somebody who has actually taken my own life, and luckily I was given it back by the grace of God, people don't need your help. Like, you guys are the ones causing people to be in a situation where they feel like they have nothing left but to just take their own life because they have had everything taken from them, or they don't fit into the society that you're creating around them. And all the things that you're doing with children. When I was a teenager, I wanted to kill myself. That's the first time that it actually started. And you know what? It didn't matter what gender I was. It was just being a teenager. And we're sitting here manipulating kids into believing that they can be this or that. And you just even present them with the facts of, like, this is how many of them kill themselves. You make them feel like they have to fit into that fucking box and take their own life. And it's very sad because everything you guys do perpetuates all of that, and you act like we want to save people from that. Well, you know what? Nothing you're going to do. When people do it, they don't go to someone and say, hey, I'm going to do it. Those are the people that don't do it, and they need help. Yeah, you can maybe help them, but the people that are actually going to take their life are going to do it silently and not going to say nothing to no one. So you guys need to think about what you're doing, because you're ruining the lives of people, and you are perpetuating the suicide rates that continue to go on in this county, especially since all the pandemic bullshit that you guys tend to push. So what side of hell are you going to be on?
Thank you. Now hear from the next caller.
Good afternoon, Board of Supervisors. Ann Riddle here. I came to support item 22 that will increase the resources the county provides to those centers and services that work to prevent suicide. I unfortunately have a personal experience with a loved one whose ideation regarding suicide has somewhat kept us all hostage for many, many years. It is a very difficult time. but we watched his slow unraveling over the last 20 years, primarily due to his marijuana use. So I'm hoping that as we look at suicide prevention, that we recognize how intrinsic in suicidal ideation is marijuana use. New research suggests that, this research from the National Institutes of Health suggests that 30% of marijuana use that is associated with suicide ideation is a result of marijuana use. There are other researches from the Center of Disease Control that also supports the use of marijuana, which is at a historic high for that particularly vulnerable age of 16 through 25 for suicidal ideation. And we who love our family members who struggle with this welcome as much help as we can receive. But let's remember that extending the marijuana business footprint in this county is not going to help with preventing suicide. Thank you.
Thank you. Now hear from the next caller.
Good afternoon, Chair and Supervisors. My name is Kathleen Lippett, and as a mother, grandmother, and advocate of drug policies that support people in making healthy and safe choices, I do support the county's services that will enhance their ability to be able to reach young people and help prevent suicide. It is well known that heavy marijuana users are at much higher risk of suicide, and it is not unusual for them to become paranoid and psychotic, and their parents often have no idea that that may be the next step that they take. In 2021, it was noted that 43% of the suicides were related to drug use, and 30% of heavy marijuana users are attributable to schizophrenia among 18 to 30-year-olds. That information comes from the NIH. There are suicide marijuana anonymous meetings around San Diego County, at least 3 of them, and we hope that the residents of San Diego whose children or loved ones are involved with marijuana would avail themselves of going to those meetings. It has been noted that Rady's now screens 1,500 children per week just to be sure that they don't miss cases of potential suicide ideation. And hopefully this will help to continue a downward trend in the loss of young lives that will torture the rest of us for all of the remaining years of our lives.
Thank you. Now hear from the next caller.
Hello, this is Kelly McCormick. I'm a public health educator. I would like to thank Supervisor Desmond for bringing forward this very important item. Suicide is preventable, and easy access to guns is undoubtedly a contributing factor. It is also important to go further back to understand why an individual may be driven to attempt to take their own life. There is a strong correlation between the regular use of high-potency marijuana products by youth and both suicidal ideation and suicide attempts. The Psychiatry Journal from JAMA, the Journal of the American Medical Association, reviewed nearly a dozen studies involving more than 23,000 adolescents in 2019. The review found that suicidal ideation and suicide attempts were significantly higher in marijuana users than in non-users. It isn't just theoretical. According to the San Diego County Medical Examiner, of those under 25 who completed suicide, 39% tested positive for THC. We must not ignore the link between marijuana use and suicide. To see some of these studies for yourself, I invite you to visit the website for ISAC, the International Association on the Science and Impact of Cannabis. One of the founders is Dr. Ramit Lev, an addiction and emergency medicine expert from Scripps Mercy Hospital. Thank you for your attention to this important issue.
Thank you. Now hear from the next caller.
Good afternoon, Chair Vargas and Supervisors. My name is Becky Rapp. I'm a parent and a public health educator who works with young people, educating and supporting them regarding drug prevention, as drug use goes hand in hand with the mental health crisis our youth are facing. The entanglement of substance use disorder and mental health illnesses is a major public health crisis, requiring urgent action and support for young people who need it. The data coming forward is undeniable, as well as alarming, as we see the marijuana industry continue to expand across our state, county, and cities. The National Institute of Health has published that as many as 30% of cases of schizophrenia among men aged 21 to 30 might have been prevented by adverting cannabis use disorder. The Wall Street Journal published 2 articles, one titled "Teens Abusing Marijuana Need Our Help" and "Legal Weed Feeds the Teen Mental Health Crisis." This article stated marijuana directly affects key parts of the developing adolescent brain, including those involved in memory, learning, attention, decision-making, coordination, emotion, and reaction time. JAMA Psychiatry stated, cannabis consumption in adolescence is associated with increased risk of developing major depression in young adulthood and suicide ideation. I'd like to emphasize how they describe depression as major. Research shows that marijuana use is correlated with psychosis in adolescents and a propensity for suicide. Please consider the significant impact marijuana use is having on our young people. Parents as well as youth need to be better educated on the negative harms marijuana can have on the developing brain and its correlation to depression, schizophrenia.
Thank you. Chairwoman Vargas, that concludes public comment on this item.
Thank you very much. We have a motion and a second. Any additional discussion? Go ahead.
Yeah, thank you. Thank you to our callers. Thank you to my colleague. This is definitely an important issue. I just wanted to kind of share a couple of thoughts and comments as our staff goes about coming back with a report and analysis on this front. You know, one thing I talked to many of you about is the Surgeon General's report that came out a couple weeks ago on you know, loneliness and isolation and lack of social support as a public health crisis. And I think that is a big, really highlighted here in this letter from my colleague, and I think has to be an important part of what we're looking at. You know, but I'm really interested in not what we can ask individuals to do for themselves, because so much of our mental health messaging is about what people can do for themselves, a phone number they can call, asking people to get help for themselves. They know, like they know. You know, the question is like, what can we do for each other? What can we, as the county, do to support and encourage people being there for each other? To be there more quickly, to be part of a community. You know, I know that there's always an onus on individuals to say, hey, you know, call this crisis line, get help. But what's the onus on us as neighbors and family and friends and people who are in school and people in work to reach out and to identify what we each can do as our own responsibility of being in community and engaging. So that was something I thought the report from the Surgeon General is very interesting. I know it's something that we've been beginning to engage on, but it obviously has to be a really important part of this conversation. It's not just up to government, all right? It's up to us all as people in community with each other. So thank you.
Supervisor Desmond?
Yeah, if I could just add one more thing. Something that's kind of obvious in that in the gun violence report, that 86% of the people that that died of gun violence were committed suicide, is that when staff goes back and looks at this, I'm a protector of the Second Amendment, but I think we also have to look at ways to limit access to guns for people who have suicidal tendencies, and that be part of the solution as well.
The only other, thank you, Supervisor. I think that all of the comments from my colleagues are exactly what we need to be doing. I would only add, as well as we are looking at these programs and initiatives, thinking about resources for access to these programs. So whenever you have, depending on your financial status, you're able to pay for some of these programs that can give you intense help and assistance or availability. And so I think making sure that these programs are also accessible for folks who are in underserved populations is really important as part of the solution, number one. And then number two is how do we make sure that we work with other, we have over 500 Live Well organizations that are our partners in this process. So working with them and being able to provide the information for them. I know staff is going to do the research and bring it back to us, but I just want to make sure that that's included in the actual discussion and conversation, because they are already on the ground and they work well with our school districts, with our senior centers, and all of these other groups. And last but not least, the component of social media. Social media is such a wonderful, wonderful, powerful tool, but it's also a tool that puts a lot of pressure on our youth and many folks in general. And so making sure that that component is part of the discussion would be great to hear. And no need for amendments, just recommendations to your board letter. So, yeah, thank you. So we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. The next item on the agenda is item number 23. It's an update establishing the behavioral health impact. You all have the report. I'm going to open it up for public comment, and then if my colleagues have any questions, we can go ahead and ask Mr. Marchioni any other questions that we may have, and I'm happy to make a motion to support.
Thank you, Chairwoman Vargas. We have 7 requests to speak on this item, 2 in person and 5 requesting to speak by phone. Also note that we received 1 e-comment in opposition of this item. For members of the public that requested to speak on item 23 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. Both speakers are in opposition. I'd like to invite forward, the name on the speaker slip indicates fired employee, followed by Alan C. If I've called your name, please come forward. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
I'm not the fired employee, Alan C. I got to respond, Jim. They're going to take a knife, a Drano. You got to go after the behavioral health of why they're committing suicide. So guys, take away the gun. There's a bottle of Drano in the kitchen cabinet. There's a kitchen knife over there. There's a rope outside. That is so foolish to even say that. Second Amendment is so important. So yeah, concerned behavioral health, as I said before, and I'll keep saying it, and I'll keep vlogging my next presentation, the 6th slide. I do ask you to watch that carefully, because the problem is the drugs, the cannabis. We had a doctor on the phone mention cannabis. Just up the street from our Harborside Elementary School, there's not 1 but 2 cannabis shops 3 blocks away from the school. Who's the biggest cartel? Our own government. So many people spoke that there's cannabis issues, and yet you get 5 times the tax revenue to open a cannabis store versus a mom and pop hairdresser. So who wins? The cannabis shop. It's unfair to the consumer. They pay more for the goods. Unfair to the cannabis owner. They pay more tax. Unfair to society, because you're destroying our kids. You want to really help our society? Outlaw all the mood medicines, fentanyl, all that crap. It starts here. You can actually make a difference and make it not illegal across the border, but illegal in California for the damn hospitals to actually prescribe opioids, which includes fentanyl. Opioids has opium in it. You want to really make a difference? You want to help our children, our future generations? Outlaw all these mood-enhancing medicines, which is not enhancing, it's actually decrypting your minds of our future generations. Look around you why the suicide is so rampant. It's the drug abuse, the cannabis, and you're all making money off it. It's wrong. Because one day you won't be in office, but your great-grandchildren will be suffering what we put forth today. I yield back.
Next speaker, please.
Hi. I guess I put on the slip fired employee because I couldn't read my name that I wrote in there, apparently. The last two issues, suicide and the mental decay of our county, I find all this, there is a linking thing between everything. People don't know the truth anymore. We go ahead and try to tell people what they need to know, how they need to go ahead and do it, and the people with the truth put so many barriers in between to find out the particular answers that I cannot get a straight answer. I know I have to talk through 3 or 4 different people, even though I worked at the County of San Diego Registrar of Voters Office for 20 years. I believe everything is linked down to that because I can go ahead and change over 1,000 ballots in any given election, and I know that to be certain. I've asked multiple times, your office.
Just a reminder to stay to the topic, sir.
This is the topic because we're talking about the mental decay because people do not know the truth. The truth is the fact that I could open up an envelope with a popsicle stick without tearing the seal. I could switch out the ballot in there, put a new ballot inside, put it in there, and bring it back to the Registrar of Voters Office. And then now everyone has to pay attention to what I have to say because I did it more than anyone else around. That is fucked up. And I hope you guys realize that. I know that some of you guys are getting elected because of these issues. You guys are getting elected because you're following with the norm. You're following with the agenda that they have set forward. And the second you go against it, you're gone. They'll find someone else because they can extremely easily.
Thank you. Time's up. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
It's great. Since day one, I've made something out of nothing. This is life, the art of surviving, and this is truth. A Behavioral Health Impact Fund 2.0 was established because the first one was a failure. But everyone knows what these types of items are really about. From the item, quote, the status of awards, number of awards, types of projects, and amount of funds. Today's action ensures funds are available, exploring grant funding opportunities available at the state and federal level, a steadfast commitment to pursue funding opportunities, end quote. Everything's about the money. Money, 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 money. And yet, the county behavioral health piece has yet to identify any federal debt dollars to establish their 2.0 plan. Last year, BHS, as Nathan's little brother and misinformation spewer Sean Alo Rivera would describe it, won over $220 million. But the beast always needs more money. Even recommendation number 2 says shift updates to coincide with significant development. We know those developments are money, debt dollar related, check collectors, funding facilitators, useless replaceable cogs. This is really to support the 19,000 more county workers as part of the ever-growing behavioral health beast, which would more than double the size of county government. Anyone who wants to do that sounds like they're experiencing serious mental illness or emotional disturbance for sure. So I recommend the immediate defunding of the county's Health and Human Services Agency so that we will all have a better chance of life 2.0. And we'll all have more money, too. Wouldn't that be nice? That's my recommendation.
Thank you. We'll now hear from the next caller.
Oh, I love how you guys think that creating a fund is actually going to do something, just like creating all of these, other boards to help you guys pretend to do something. You're like, we're really just spreading out all our tentacles to make sure that we mitigate this, all while you guys sit and cause the problem. So it's like, if you were going to mitigate it, then you would get rid of all of you guys and all the things that you're doing. You wouldn't continue to sit here and be like, we're going to create this. This is actually going to do something. If we create this fund and if we create this entity, it's actually going to do something. And like that program isn't going to really be available for like this long, but it's actually, the idea is that it's going to be so helpful for us. You guys leave everybody behind in your pursuit to help with behavioral health. You're creating all of the issues. You have this anticipated need because you are creating that problem. And so therefore you're like, let's spend more of the people's money so that we can fix the problem that we're creating. None of it makes any sense. You guys sit here and you waste our money that people work hard for and, you know, basically give their lives up for just to give to you so that you waste it to do nothing but ruin stuff. It's ridiculous how much you guys like take and you're like, we're going to virtue signal. Like we really care about people. And like, I mean, we're going to get down to the issue of what it is. But I mean, don't look at us, right? Because we're not the problem. It's like everyone else, and it's COVID and it's the environment and, you know, nothing that we're doing. When are you guys going to take responsibility for all of the, you know, things that you're doing that are causing all the problems that you pretend to mitigate? I don't know, but hopefully one day people will see that they need to stop giving you money to enslave them, put them in, you know.
Chairwoman Vargas, that concludes public comment on this item.
Okay, we have a motion. We need a second. All right, any further discussion? Seeing none, please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. Next item on the agenda is item number 24, approve actions related to the development of homeless prevention program. I'm going to go ahead and turn it over to public comment, and then we'll go ahead and have our comment.
Thank you, Chairwoman Vargas. We have 8 requests to speak on this item, 2 in person and 6 requesting to speak by phone. Also note that we received 2 e-comments, both in favor of this item. For any members of the public that requested to speak on item 24 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. I'd like to invite forward Alan C. and Mark. You'll have 2 minutes to address the board.
Alan C., this is a very important slide. Please take a look, supervisors. This is our neighborhood, Chair Vargas. Health and Human Services Center, that's a county building. Right behind is 1,000 children at Harborside School, elementary school. Harborside Park got closed last year. The swing sets were taken up because of hypodermic needles. On the right side, you got Walmart receiving and Costco right behind that. But let's look at Harborside Park. Look at that fence between Harborside Park and that Harborside School, a short fence about this high. They're homeless, waiting, living in that park because the Health and Human Services is providing wraparound support. Next slide, please. So what happened? We fenced it off, or I didn't, the city did, and they kicked the homeless off that park. The homeless started camping out at the Health and Human Services because that's where the wraparound services were. So what the Health and Human Services did, they hired 5 permanent security guards, kick them out of their parking lot. So here's your small business now being surrounded by all these tents literally across the street from Health and Human Services Center. Let's see what Health and Human Services provide. There's not one thing on that paper that shows a job application. All this for all these benefits, medical marijuana, all that stuff. I don't see one thing in there to help the guy get out of the hole he's in. Next slide, please. As I said before, the biggest problem is fentanyl. It's an opioid. It's got to, if you want to solve it and help the homeless, look at fentanyl. Next slide, please. And this is your answer. Put affordable housing. These people, lower middle class, lived there for 40 years, never expected affordable housing, 5-story unit right behind them. So I asked the developer, how much are the affordable housing units? $800 a month. That guy living in the tent has no money, so that doesn't help him. All it is let the developers pad the pockets along with the politicians. Next slide, I'll put that at the end.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
It's truth, of course. Ellen, thanks for the slides so I can see what you've been talking about this whole time. This item says there's something in existence called a homeless system. News to me. Question, which one's worse, the homeless system or the justice system? The answer is actually the political system. It's the dirtiest. This is another homelessness creation program to incorporate into the county's framework for extending homelessness. This item says that, quote, the elements of this implementation strategy utilize a predictive analytics model to identify households at risk of homelessness, end quote. Over $4.1 million will need to be sought through the old federal funnel to pay for the tracking and maybe the help for a measly 280 households. It's doubtful that anyone will even be told that they're going to be tracked in a predictive minority report on their homes and families, allegedly to see who will end up homeless on the murder wheel of the death system. Add that to homeless people being tracked via the county's by-name homelessness list and the federal government's homelessness management information system. But Nora, please tell me how these types of algorithms won't be racist. Because government-controlled numbers tend to always have a bias, isn't that right? Even this item's phrase, root cause and upstream prevention strategic domain, is incredibly cold, like a computer loaded with military software programs. And everyone knows that when government uses the inverted 1984-style term self-sufficiency, they mean that a person is completely dependent upon government for an undignified sufficiency devoid of self-respect. So I'm going to say stop using homeless people as the guinea pigs for the federal government's human tracking programs that they keep funding and clearly want to extend to all of us one day. Refund our $4.1 million back. We can all have a better chance.
Now hear from the next caller.
Hello, Paul Henkin. I like that financial stability and employment are recognized as problems leading to homelessness, and that the homeless would be directed to mental or behavioral health resources as appropriate. However, I do not like that the plan is short on specific employment or behavioral health programs. And I do not think that placement in existing housing or providing flexible funds would accommodate all of the homeless. So I think that part of the program, at least, is deficient. It is a good start, but I do not think that sustainable funding per recommendation 1 is or can be identified on the basis of the HPP report. So I recommend that you reject the program as presented. Thank you.
Thank you. We'll now hear from the next caller.
I love this one. I really think that this program is going to be the key to success in this county, you guys. Oh my gosh, pats on the back. I do not want to warm hand this one off, you guys. I feel like this one you're really going to use the money wisely. You're going to be very efficient in helping people stay out of being homeless, right? Because, I mean, as long as you collect data and stuff like that, it's going to help. And as long as you just create this program, people are not going to be homeless. And I mean, 280 people that you're helping, like that is so many. I am just really proud of you guys. Pats on the back, gold stars all around today. Yeah, I'm just wondering, it's like, do you think that actually creating programs is going to keep people out of being homeless when everything that you do actually causes them to be homeless? So is the program getting out of the government's hand? I don't know. Is it like helping them to, deassociate with the government? Because I think that will actually help them have more money, not be homeless, be mentally sound, not have to fall into your behavioral health category. Gosh, I don't know. You guys are so good at helping. You know, I just want you to know that. And I'm so sincere right now. Like, I mean it from the bottom of my butthole that you guys are so fantastic at helping stuff. And like, nothing gets worse when you do it. It's so fantastic. I mean, you guys should get a raise. Oh, wait, you probably already gave yourselves one with the budget, right? That's cool. Maybe you should do an extra one. You could probably, you know, change the budget again just to add a little bit more in there for you guys just to do this. And, you know, I just want you to know the gold stars I'm passing out are very expensive. They're the, you know, Trump type of gold stars. So, you know, you're going to want to put those somewhere safe, you know, just for safekeeping.
Thank you. We'll now hear from the next caller.
Hi, yes, my name's Chana. The homeless organizations whose expertise is supposedly with the homeless employ outreach people who are failing 99% of the time. You must do something different that doesn't waste the money. You all need or should look at the state of Georgia's rational new law on homelessness that makes it clear that free and permanent housing cannot be offered without any mandate for rehabilitative treatment and sobriety. Camping on sidewalks won't be tolerated. Nonprofit organizations should only see funding based on their results, real results, not on their public activism. So please check into that new law. I mentioned earlier Reverend Andy Bales in LA should be contacted to hear his ideas. You now have fentanyl and tranq on the streets. That's going to make the situation worse. You'll have more deaths on the streets. The last 5 to 7 years of all the money being thrown at nonprofit organizations who wanted money to provide their quote-unquote services to the homeless and to the developers has not worked. What's in it for them to solve the problem? It's more lucrative to not solve the problem. Finally, earlier, Jerry Hall mentioned the judge offering him jailer treatment. Judges are not allowed to offer that in California anymore after Propositions 47 and 57. That program was working for homeless addicts. Finally, please add another choice on the public comment site, something like informational only. I neither supported or opposed this measure. I just want to give fresh ideas, and I want nonprofits to be held accountable. Thank you.
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
Thank you. I am excited about this work that's taking place. I think it's part of a bigger, part of the bigger component of the framework for ending homelessness in the county, and all of you have been so innovative in thinking about how we address this. And so particularly, I think this particular board letter is important because it really focuses on the root of the cause and prevention, which I think is really critical. And I also appreciate that we're using the predictive analytics model, because I think that's how we're going to be able to move people forward. I think for every 10 people that are housed, there are 13 new people that are experiencing homelessness for the first time, correct? And so I think it's really important that we approve these kinds of initiatives, and I think this one in particular allows us to really create a implementation strategy as we're moving forward. So I'm happy to make a motion to support and have my colleagues. And you want to have comments?
Yes, please. Thank you to staff for bringing that forward. And prevention is certainly key in a lot of different areas, in homelessness especially. And identifying people before they become homeless and connecting them to services is critical. If we can help save on homelessness, then we can also save taxpayer dollars. So, but I want to make sure that we have a way of tracking this success. That you come back, within a year or so, or whatever the interval is, that that lets us know that these funds are being spent well, and the success stories, hopefully you have some, and you can tell us about those. So is there reporting coming back on this annually, or is there any things just put forward to include that?
Thank you, Supervisor Desmond. We have Dr. Basuto, who's helping us with the evaluation.
Okay.
Yes, we're going to, Ricardo Basurto Davila, the Chief Evaluation Officer, we're going to develop an evaluation framework for this, and we'll come back with the success stories, that we're hoping.
Well, I just want to make sure our money is being spent. So how often, annually, or?
We haven't decided, but.
Can we add that to the motion? They come back after a year, that it comes back and we can see progress? Okay.
Sure.
Thank you.
Yeah, and I, probably as we're looking at the ending homelessness framework sort of bigger initiative, we could probably put it as part of our dashboard. So the board gets an actual report, but if we put it as part of the dashboard, the information, if it's appropriate, so I don't know, Nick.
Chairman Vargas, to your very point, we do quarterly updates on our framework, and we're happy, Supervisor, to include that in that quarterly as well.
Okay, make sure my staff gets it.
Yeah,
Okay?
but we'll
Thanks.
also do the year supervisor as well, so when they do the actual report back, it is included, but I want to make sure we don't wait that long and we're actually having the information. All right, we have a.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. The next item on the agenda is item 25, authorizing a memorandum of agreement between the County of San Diego and the San Diego Housing Commission for collaboration efforts to address housing shortage, home key round 3, and reserve funds up to 2 for partnership developments. And so I'm going to turn it over to public comment. Oh, do you have a presentation? Sorry, go ahead.
Good, thank you, Chairwoman Vargas and members of the board. The state's Home Key program is a statewide effort to provide public agencies with funding to quickly expand permanent supportive housing options for people experiencing or at risk of homelessness. Prior Home Key rounds have already been essential to local housing development for our most vulnerable residents. Recently, on March 29th of this year, the state announced availability of the 3rd round of Home Key program funding. The agency's Housing and Community Development Services and our Behavioral Health Services team have partnered with the San Diego Housing Commission and the City of San Diego on proposals to secure and leverage this additional Home Key funding opportunity. Now, this type of permanent affordable housing, coupled with community services, is crucial component of the county's framework for ending homelessness. And I want to make the point, it's services with housing come together. Approving the recommendations today to proceed with up to 4 Home Key developments will ensure valuable state resources are brought home to advance our framework for the most vulnerable residents in our community. These efforts will help more than 325 formerly unhoused San Diego residents have a place to call home with services. Here to present today's item is David Estrella, our Director of Housing and Community Development Services, and joining him is Marco Medved, our Director for General Services, our Deputy Director, Kelly Simmons, from our Housing and Community Development Services, our Executive Finance Director, with Amy Thompson, and Dr. Luke Bergman, our Behavioral Health Services Director. And with that, I'll turn it to David.
Good afternoon, Chairwoman Vargas and members of the board. As Nick mentioned, the state has announced the availability of Home Key Round 3 program funds for the creation of permanent supportive housing for persons experiencing or at risk of homelessness. The Home Key program provides funding opportunities to diversify housing options for individuals experiencing homelessness or at risk of homelessness. The San Diego Housing Commission will be the applicant for the 4 partnership developments, expanding on prior Home Key success in the region. Prior Home Key Round 1 and 2 efforts include 2 developments in Round 1, awarded $37.7 million in Home Key funding, and provided 332 permanent supportive housing units for individuals experiencing homelessness. The San Diego Housing Commission was the applicant for the Round 1 developments. The county, through Behavioral Health Services, provided funding for supportive services. In Round 2, the Board of Supervisors authorized an application in partnership with the San Diego Housing Commission, Path Ventures, and the City of San Diego. The applicant team was awarded $11.8 million in Home Key funding to support the 41-unit development that is currently under construction. In addition to Home Key funding, the county contributed $10 million for construction and services. The city contributed $2 million for construction, and the San Diego Housing Commission contributed 40 project-based vouchers at a value of over $7.6 million that will provide rental assistance to the future residents. The over-the-counter application for Round 3 funding opened on April 24, 2023, and will close July 28, 2023, or sooner if all funds are awarded. We're here to request your approval to reserve funding for capital and supportive services in up to 4 Homekey Round 3 partnership developments, as well as to authorize the county to negotiate a memorandum of agreement with the San Diego Housing Commission. The reservation of funds is contingent upon county staff completion of a due diligence review, including appraisal review and financial feasibility review, and receipt of Homekey awards. The Homekey program is truly designed with rapid implementation in mind, as evidenced by the state's quick expenditure requirements. All state funds must be spent within 8 months of the state awarding of funding. Construction must be complete within 12 months of the award, and full occupancy must be achieved 90 days after construction completion. The state has made available just over $34 million for the San Diego region in Homekey Round 3. As seen in other efforts by your board, the Homekey program provides the county an opportunity to leverage other public funds like the Innovative Housing Trust Fund and diversify available housing types. To expand on our prior collaborative efforts, the San Diego Housing Commission, county, and city are focusing on 4 Homekey partnership developments for Round 3. Homekey funding will be leveraged with local capital from the city, capital and supportive services from the county, and project-based vouchers from the San Diego Housing Commission, supporting the future homes in the 4 partnership developments. Contingent upon the county completing due diligence review, the county will provide up to $32 million in capital and $4.6 million annually in supportive services, funding to contribute to the Homekey Round 3 efforts. County supportive services will be provided for a minimum of 5 years and include outreach, engagement with tenants, case management, and clinical case management to serve individuals experiencing chronic homelessness and who have behavioral health conditions. The San Diego Housing Commission will provide 320 project-based vouchers valued at $68 million for the term of the Housing Assistance Payments contract to support ongoing operations of the properties. The City of San Diego will provide $32 million in capital to support the acquisition and renovations at the properties. These efforts will ensure between 325 and 500 formerly unhoused San Diego residents have a place to call home once fully occupied. The recommendations before the board today include waiving of CEQA, authorizing the agency director to enter into a memorandum of agreement with the San Diego Housing Commission, authorization to reserve $32 million in capital funding for the acquisition and rehabilitation of Homekey developments, authorizing the agency director to execute all county loan documents for developments successful in securing an award of Homekey funding from the state, and authorizing the director, Department of Purchasing and Contracting, to issue competitive solicitations for behavioral health services, supportive services, including $4.6 million in funding of the initial 1-year term and 4 1-year option years. All recommendations before your board today benefit regional efforts to increase affordable housing for the most vulnerable. Approval of the actions today will allow staff to expand on prior efforts to align with the Homekey program and continue to work with the City of San Diego and San Diego Housing Commission to ensure Homekey funding is secured. This concludes our presentation, and we're available to answer any questions you may have. Thank you.
Thank you, Chairwoman Vargas. We have 7 requests to speak on this item, 3 in person and 4 requesting to speak by phone. Also note that we received 1 e-comment in opposition of this item. For any members of the public that requested to speak on item 25 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with the individual in favor of this item, followed by the individuals in opposition. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'd like to invite forward Dion Akers, followed by Alan C. and Mark. You'll have 2 minutes to address the board.
Good afternoon, Chair Vargas, supervisors, staff. Thank you for the opportunity to speak on this important issue. My name is Dion Akers, Government Relations Manager for San Diego Mayor Todd Gloria. I'm here today on behalf of Mayor Gloria to express our strong support for item 25 and respectfully ask for you to support this MOA. By approving this action, you are making it possible for our region to compete for desperately needed funding from the state's Homekey Round 3 funding opportunity. In every corner of our region and all across America, the crisis of homelessness and housing shortages continues to grow. As leaders of our communities, it's our duty to do all we can to address this problem at every level, develop and implement all possible solutions, and fight to bring in resources to create as much housing as possible to help those in San Diego. The actions you are considering today would build on the city and the county's successful partnership on HomeKey, which has secured funding for nearly 400 homes for the San Diego region. By authorizing funding from the American Rescue Plan Act and Behavioral Health Impact Fund and providing behavioral health supportive services, the city and the county are positioning our region to leverage this important opportunity to deliver over 300 new homes to the San Diego region for folks who need it most, who are currently experiencing homelessness. Despite the challenges we face, we are continually inspired by and grateful for the unique collaboration and dedication shared between the city, the county, the Housing Commission, and so many critical partner agencies throughout San Diego County. Thank you for the opportunity to speak. We respectfully request that you approve this item, and we can do more for San Diegans. Thank you.
Thank you. Next speaker, please.
Hi, LNC. I just want to say thank you to the clerk. They've been so helpful moving these things along. And yeah, the previous slide, sir. You're ready. The previous slide. Yeah, just a continuance. I want to actually share some good news. Here's what Chula Vista is doing. Instead of this HomeKey nonsense, what we're actually doing to rehabilitate these people, because they're our neighbors. They're my fellow neighbors, and here's what they're doing. Pallet homes, 90-day limit. And then I told Mayor McCann, and he said there will be no drug use, no alcohol use. It's a real bit, actually a step up. I told him, hey, let's take it a step further. So you got a 90-day window, and then you boot them out? No, so let's make it 60-day, and they're going to look into it. At 60-day, you will have a job. Whatever it takes, with the wraparound support that they have in there, they serve them food, they do all this, but to actually give them a job. And I'll show a follow-up on the next homeless item. Next slide, please. But what about all the people still on drugs? Here's a solution that was happening at Golden Hall had they enforced to get them off drugs. I lived in one of them coffin racks for 20 years, and we just lovingly call it coffin rack, but it actually is my home when I was in the Navy for 20 years. Anybody in the military recognize that when they're served the Navy. It gives them a place to lock up their stuff, gives them a place to sleep, but more importantly, because it's open bay berthing, similar to what Golden Hall had, they could be monitored. But the difference is the 550-bed shelter at Golden Hall, they were not monitored. But if we did that next to that Health and Human Services to actually give them treatment, give them support, and monitor them, maybe we can get out of this rut. Put that at Harborside Park instead of letting the Chula Vista turn into a park to bring in the needles again. I yield back. Thank you.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
This is Truth. Here we have more blatant County of San Diego and City of San Diego entanglement. And I can't think of a worse entity to do it with than the San Diego Housing Commission. Even Catherine Rhodes has called out their corruption. The city's Housing Commission CEO, Jeff Davis, said on April 25th that they purchased units for over $800,000. There's no way that could sell affordably for the average person. It's the state enabling these entanglements with their HomeKey program, where people like these supervisors accept their debt dollars. And that's why there's a housing crisis. And that causes another crisis of creation, homelessness. Both of those crises have been exacerbated with every wrong decision, and yet they're both actually manageable. All government needs to do is get out of the way, stop enabling substance abuse, and start requiring accountability measures, including employment requirements for those who need housing help, and stop demanding financially restrictive and imposing rules upon landlords and property managers. Hoops don't help. And all other permits and license fees also add unnecessary financial burdens upon people, which deters or prevents them from doing things like owning and operating businesses or purchasing homes that build real generational wealth. There's also more city government and county government entanglement, with an over $110,000 grant for a city-county reinvestment task force. Two corporations playing Monopoly is what that sounds like. But it's never enough, because today's item is another over $34.3 million in state debt dollars, plus $32 million in loan documents from the American Destruction Plan Act and the Behavioral Health Beast Negative Impact Fund. Leftover COVID money redirected, and everything contingent on round 3 HomeKey funny money funneling from the state. The HomeKey program is yet another inefficient, false promise key for homes. And all this debt and inflation creation will only result in us all being equitably bankrupt and homeless in the future. And sequel having no even.
Thank you. Now hear from the next caller.
Oh my gosh, you guys, I love how you're going after our fair share of the money. You guys always go after our fair share of the money, and that's what I love about you guys. You're so good at doing that, and like you're going to work with the city again to ensure housing gets put into place. So you guys are so intelligent. It is like, oh man, it's off the charts today. But it's like, oh, beep, 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 beep. Oh, whoa, weird. We're back in 2008. Oh, weird. Oh, you're going to lose your home. Oh, why? Well, the government told me that they were going to help me, and now I thought that I was going to be able to keep my home. Unfortunately, no, we're going to have to take it from you. Yes, we're the government. We were the ones that were there to help, and now we're here to take your home because you can't pay for it. How come you can't pay for it? What are you going to do about that? Okay, well, if you can't pay for it, then we're going to take it back. Oh, and you're going to be homeless? Well, that's okay. Well, we'll just, provide a program that's going to help you later on, maybe eventually get a home. We're going to spend millions of dollars to do it. Don't worry. We're here to help you guys, okay? We're here. We're here. If you need a shoulder to cry on, it's all right. If you need sewer water to drink, we will give it to you, okay? If you have behavioral health issues that you don't think you have, we will tell you have them. And we will medicate you, okay? And we want to get everybody off of drugs. And so you know what we're going to do? We're going to give everybody drugs. It's going to be good, you guys. It's so fantastic what's happening. I'm just really proud of you guys for always doing the best for the county. You're really on the way to hell. I mean heaven, right? Or hell, wait, which you don't even know which, right? Yeah, because you don't even know where you're going. But it smells like sulfur in there. You guys are getting super close. Turn around and you can go up the other way. Okay? There's always a choice, right? Like you guys tell us, you always have a choice. So you have a choice is to continue to go down this path.
Thank you. Chairwoman Vargas, that concludes public comment on this item.
Thank you so much. So I'm happy to make, sir, this is your first warning. We are actively, I just want to say thank you to the team for all the work around this. I know that round one and round two, we've done well. I mean, I think for us as a county, our top priority is to make sure that people have a good quality of life. And part of that is making sure that they have access to a home. And the fact that we're really thinking about how we partner up with other cities. And this is open to any other city who is willing to partner up with us. And I know that we've done a lot of work around that. So seeking additional funding to address our housing shortage, I think, is really what we need to be doing as we're thinking about this from a comprehensive perspective of addressing the unsheltered population. And what's really important for me on this is that this is the creation of permanent affordable housing. And I think that that's where it's important that it's really going to help our most vulnerable populations. And so each one of these initiatives that we're voting on today really make a difference long-term for our communities. And it's about 600 units. 300 units, I'm sorry. 600 is what I wish they were. It's 300 units that we're competing for. And I want to say thank you to the City of San Diego, Mayor Todd Gloria, and the Housing Commission for all of the work. And I know, and the team, David, has been just really exceptional in doing all of this work. I know there's a lot of work to be done, but I think this is an example of the successful partnerships that we can build together to really move forward and address this issue. And so with that, I'm happy to make a motion. Supervisor Tara Lawson-Reyman.
Happy to second. And I just wanted to say, it would be so silly for us to leave money on the table, right? I mean, there's a big pot of money in Sacramento, and if we're willing to put skin in the game and match it, then we can be competitive and we can bring $34 million home to our region. For far too long, this county just didn't step forward. And I think that's one of the things I'm most excited about is just putting our hat in the ring and saying we deserve the same treatment as LA and San Francisco and the rest of the state. And we're going to put aside our money so that we can be competitive and we can hopefully bring home $34 million to invest in our region. So good luck with the application.
Yeah, thank you, Mr. Chair. And I appreciate the presentation and all the hard work that's gone on by the county staff. But I think, as you know, as a county entity, I think we should really be focusing our money on treatment and services, not on taxpayer hotels as homeless housing that do not require treatment. And I know you mentioned this would be housing and treatment, but that treatment is not mandatory. And any effort, I think, to reduce homelessness must require treatment and care. State home key funds require the housing first model. I looked it up, found it's housing first. And the approach of so state home key funds require housing first approach to the homelessness at these hotels. And so the state has spent billions of dollars on homelessness, requiring the housing first model, and our homeless numbers just keep continuing to rise. And I think it's a formula for failure. Housing first requires accepting applicants into housing regardless of their sobriety or use of substances. Housing first requires you cannot reject someone into housing based on any criminal convictions or behaviors that indicate a lack of housing readiness. Housing first says you cannot require participation in service or treatments. Housing first requires that you cannot use drugs or alcohol use as a sole reason for eviction. You know, it's no wonder that after spending billions of dollars, taxpayer dollars on homelessness in the state of California, we haven't fixed or solved this yet. And I want to get people all the help they need. And I think any effort to reduce homelessness must require treatment and care. Taxpayers deserve accountability. For the billions of dollars spent, they're tired of seeing the homeless problem persist. It's time to reclaim our parks, our sidewalks, our on-ramps, our business frontages with treatment. And I know you're offering treatment, and you're offering treatment is one thing, but you know, as I said earlier, you can bring a horse to water, but you can't make him drink. And so the fact that it's not required, and these are taxpayer paid for housing. If the state, and as a compromise, if the state wants to keep housing first that allows drug and alcohol use, maybe let that be for the first 14 days of housing. But if you're going to live in taxpayer-funded housing, you should have to be in a clean and sober program and getting services. We just voted for a work plan for the alternatives to incarceration, which I supported. That the goals there are to avoid jail by getting people into treatment and services. The only way, I think, for alternatives to homelessness is mandated treatment and services. So I can no longer support this failed housing program. And the mandated treatment in taxpayer housing, I think, is the most compassionate and realistic solution for us out of homelessness. Thank you.
Can you please, this is your first warning. Can you please clarify or demystify some of this information? Dr. Bergman, please.
Sure. So, Supervisor Desmond is referencing the housing first model, which does, as a model, emphasize giving people access to space to live as a primary consideration, with the expectation and the knowledge that you know has been thoroughly studied, of course, and that's why there is so much to read about this. That people do better in treatment, considerably better in treatment, when they have a stable place to live. If people are homeless, if they are street homeless, and again, these are services that are specifically targeting the HUD categories of literal and chronically homeless, the likelihood of them having success in treatment is much higher. And so I think that is a point that merits some clarification, that the idea here behind the Home Key Initiative, of course, isn't to ignore the significance or consequences of behavioral health conditions. It's to provide a space that optimizes the likelihood that people will actually engage in care and then be successful in care. That's part of why the services that are offered here include an expectation that 100% of people coming in will be screened for behavioral health needs, and that efforts will be made to connect people to care based upon those screening criteria. So there will be light touch case management, clinical case management, and then an array of supportive services that when we think about the likelihood of people doing better, getting off the street for longer periods of time when they've got access to that kind of service, as opposed to when they are living on the street, I think it makes for a compelling argument.
I think that's a compelling argument, but we've been following this practice for years, and our homeless numbers continue to rise. So I think we have to require treatment. You can't make someone take the treatment. And it's great that it's offered, but you can't require people not to use drugs or alcohol. They can still be doing that in the taxpayer-funded. So I think if it's taxpayer-funded facilities, the taxpayers should get some bang for their buck and say, these people have to be in treatment. And to say that they can just refuse the treatment, to me, I get it, there's a greater probability of them getting it. I get that, but it hasn't worked. And so I'm tired of it.
So,
I'm ready to, I'm not going to be supporting it.
So that's probably your experience. I will say I want to put it on the record that my experience has been with Project Home Key, that it does work. I've actually have visited our shelters. I have visited the transitional shelters. I was just at one 2 weeks ago. I sat there with a gentleman who told me, I did really well in life, and then I didn't, and it was because of addiction. Addiction is a sickness. He was able to get temporary housing. This gentleman is a former veteran and is now in our housing program and has been free of drugs and alcohol for over a year. And so we maybe have different experiences, but I will tell you this, when people don't have access to housing and comprehensive resources and the ability to be able to have the continuum of care, they have a harder time being able to address some of the health concerns that they have. So we're going to agree to disagree, but with that, we have a motion and a second, sir.
Is there a way that we could add an amended component in, just to benchmark it a year from now to see? Because I've had mixed reviews in my district. We've had great success. I'm going to vote for it today. But I'd like to have, so how could we do that as far as tracking the program? I'm looking at all of you, so.
Could we?
Yeah, I was going to say, where's Ricardo?
Where's our Office of Performance
What we could do, if it's okay with you, Supervisor Anderson, is that what we can do is we can move forward with approving the motion, and then the staff can make a recommendation and work with Ricardo to make sure that it's something that we are able to track. But we will make sure that in this motion, we are very clear that the amendment includes accountability and to be able to come back. And as a matter of fact, we could probably do it for the other programs as well.
Madam Chair, I thought our colleague made some good points. And Jim, would that work for you today to have a benchmark to come back to with solid science?
You can bring it back. And I want the chair to know, I agree with you. But it's time we start requiring the services and people participate in them if they're going to live in government housing. So that's fine. I'm still not going to support the item, though.
Okay. Well, we tried.
Chairwoman Vargas, that motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
Next item is item 26. This is the update on the opioid settlement. We're going to have a presentation from the team. Okay, I'm going to go into the restroom.
Chairwoman Vargas and members of the board, our county has certainly not been exempt from our nation's ongoing overdose crisis that has impacted too many in our region. With your support, our Health and Human Service Agency, in partnership with the County Sheriff's Department, the Office of Emergency Services, is committed to continuing our efforts to reduce mortality and harms among our residents. Last October, your board took a significant step in adopting the San Diego County Opioid Settlement Framework. Today, we're proud to return with an update on the adoption of that framework, as well as the campaigns for enhancing fentanyl education and strengthening harm reduction efforts for young people. With me today are Dr. Luke Bergman, our Director for Behavioral Health Services, Dr. Nicole Esposito, our Chief Population Health Officer for Behavioral Health Services, and Dr. Liz Hernandez, our Director for Public Health Services, and Amy Thompson, our Executive Finance Director for the agency. And starting us off will be Dr. Bergman.
Thanks, Nick. Opioid remediation funds for the county were made available as a result of lawsuits brought against opioid pharmaceutical companies, manufacturers, and illegal distributors. In order to optimize the utility of settlement funds, a series of community engagement forums were convened where experts and stakeholders were able to offer recommendations and guidance which informed the opioid settlement framework approved by your board. Since your board approved this framework, we have received more guidance on allowable activities for the settlement funds from the Department of Healthcare Services and have an opportunity to align with evidence-based practices as recommended therein. Today's update will include some of the major progress we've made under the framework's 3 components, which are healthcare integration, social supports and services, and harm reduction and prevention, as well as an update on the harm reduction, public outreach, education, and messaging efforts. I'll now hand it off to Dr. Nicole Esposito.
We are working along several fronts to equip mainstream healthcare systems to provide care for people at risk of harms from substance use. For example, we are developing and implementing the San Diego Relay Program, a 24/7 overdose response delivered by peers in select emergency departments. Relay focuses on providing immediate, peer-led support and connection to services for people who have had a non-fatal opioid overdose. Peers will help clients navigate to resources aimed at reducing future overdose risk, and most importantly, will remain connected to clients for 90 days to provide continued support after emergency department discharge. In early March, Behavioral Health Services posted a request for information and facilitated a virtual meeting to gather input to inform the program's design and identify potential challenges. The feedback will be used to inform the next planning steps. In addition to emergency departments, we have worked to fortify overdose and substance use disorder care integration with primary care as well through 2 contract programs. The first is a behavioral health consultation service, which will support primary care providers and behavioral health providers who serve youth and youth clients with behavioral health needs and their caregivers. The second will serve clients in rural regions of San Diego County by building capacity in rural primary care clinics to treat behavioral health conditions. As part of the county's efforts to increase access, engagement, and retention among people seeking medication-assisted treatment services, also known as MAT, San Diego County's Emergency Medical Services is developing a pilot program authorizing paramedics to administer MAT in the field to treat patients in opioid withdrawal. A significant milestone of this program's development was the endorsement by the EMS Medical Director's Scope of Practice Committee and subsequent approval from the State of California's EMS Authority of a local optional scope of practice authorizing paramedics to administer MAT in the field. We are currently in the planning stages to ensure warm handoffs are available for patients after they receive MAT from paramedics. This has 2 components: connection via California Bridge navigators for those transported to the emergency departments, and connections to community-based supports for those who decline. We are also exploring the use of digital therapeutics to aid in treating substance use disorders, which can improve the effectiveness of behavioral health interventions and outpatient treatment modalities. Digital therapeutics use evidence-based, clinically evaluated software and technology accessible through web-connected handheld devices. Additionally, to strengthen our coordinated response, the county is establishing a cross-departmental county overdose response unit with behavioral health services and public health services to ensure effective implementation and management of a cross-sector, real-time surveillance and overdose response. Our efforts to help those affected by opioid crisis will not be enough without ensuring they have social supports along their recovery journey. This requires investing in our community networks to provide education on substances and connections to treatment. Thus, in partnership with our rural communities and tribal nations, we are continuing to engage, foster, and inform our most vulnerable groups through public health messaging, outreach campaigns, and targeted naloxone distribution events. We have further integrated peers into programming, such as in the San Diego Relay model, leveraging the valuable perspectives and input of those with lived experience to better serve and meet the needs of people who use drugs. Also, the 22-bed community harm reduction team designated Safe Haven opened its doors last December and provides transitional housing and linkages to services. Lastly, the rollout of recovery residence funding to additional opioid treatment programs will allow these programs to provide direct access to shelter and supportive living environments to their clients. I'll now hand it over to Dr. Liz Hernandez.
Thank you, Dr. Esposito. To reduce and prevent harm, meeting people where they are is critical. Research has shown that community distribution of naloxone can reduce overdose deaths. A total of 6 naloxone vending machines have been placed in the South, Central, and North Inland regions, with 6 more machines to be placed by June 30th. Planning is also underway for the placement of 4 additional vending machines within county jails. The county's emergency medical services and sheriff's department implemented the Leave Behind Naloxone program, enabling 18 sheriff stations, substations, and storefronts countywide, as well as deputies in the field to provide people at risk of an overdose, their family, and friends with free naloxone. As of May 2nd, the Sheriff's Department has distributed more than 800 naloxone kits since this program's initiation. 15 EMS agencies have also been approved to participate in the program to provide naloxone to patients, family, and friends at the scene of an emergency. Through the leadership of Public Health Services, the implementation of county-operated, county-wide harm reduction services is currently in development. In addition to clean syringe access, the services will be comprehensive, providing health education, testing, referrals to substance use and mental health treatments, and connections to housing and other supports. A community readiness assessment was conducted to receive input from community stakeholders and the public, which informed program development. Staff has engaged the 4 municipalities to be served by the program for input regarding community engagement, program design, and the data used for program development. Based on need, these municipalities initially have included San Diego, Chula Vista, Escondido, and Oceanside. Services are estimated to launch by September 2023. Drug checking is another type of harm reduction intervention aimed at providing people who use drugs with services to help them better understand what is in their substances. Access to drug checking supports more informed decision-making, such as safety planning, and reduces the likelihood of fatal overdose. Additionally, drug checking can provide information on community-level trends regarding the unregulated drug supply, offering opportunities to better inform the county response. The 2 types of drug checking tools being employed by the county will include fentanyl test strips and the Fourier transform infrared spectroscopy, abbreviated as FTIR. While fentanyl test strips only test for the presence of fentanyl, FTIR is an innovative technology that can detect multiple substances and chemicals and provide results on purity and potency. It is estimated that the county's naloxone distribution program will begin distribution of fentanyl test strips this spring. FTIR is already being used within the region. We are also seeking opportunities to expand and include other available drug checking test strips to support our harm reduction strategy. In alignment with the October 2022 Opioid Settlement Framework Board Letter authorizing the procurement of drug checking services, Behavioral Health Services issued a request for information but held a forum on October 13th. The feedback received will help inform the next stage in planning. Dr. Bergman will now review some of the public messaging campaigns that are underway to educate and inform the community about the dangers of illicit fentanyl.
Thank you, Dr. Hernandez. The first phase of the illicit fentanyl awareness campaign focuses on youth and teens, as well as parents, caregivers, and other adults who may be influential in a teen's life. Last August, nearly 60 students aged 14 to 24 provided their feedback on the campaign. Their responses contributed to the development of initial creative images, which launched in December of 2022 and will run through this spring. Youth and teen communication channels for the first phase include social media, streaming, audio, gaming, radio, and printed posters and banners that have been displayed in 9 middle schools and 36 high schools across the county. There will be future input sessions with youth to inform the next phase. Since campaign launch, we have seen substantial exploration across all media platforms, mainly through web page visits and video views on Facebook and Snapchat, in addition to active engagement with our audience through post shares and comments. For adults, communication channels include social media, streaming, audio, web ads, billboards and banners, and print and radio advertisements. 71 billboards have been placed around the county in English and Spanish, spanning 36 communities. The campaign for broader outreach to support the county's comprehensive harm reduction strategy is currently in development. Behavioral Health Services is working with stakeholders and subject matter experts to collect input for new materials. The harm reduction campaign will have 2 areas of focus: harm reduction for people who use drugs or who are at higher risk of an opioid overdose due to high drug use, and a more general campaign to educate community members on what naloxone is, where they can get it, and how to administer it. These materials will be developed to complement past and existing public education efforts by the Sheriff's Department and Public Health Services. In the wake of the opioid crisis and the COVID-19 pandemic, we've seen an immense increase in the need for highly tailored educational materials on various issues, programs, and services. To reach our communities, we must expand our capacity in order to be responsive and agile in county public messaging, outreach, and education. Your board's authorization of the competitive solicitations requested today will enable us to nimbly respond to ongoing community messaging and education needs. In conclusion, the updates presented to you today represent just a portion of the work we've done and will continue to do through your board's investments in access to care, support, outreach, and education for those impacted by the opioid crisis. Updates on other activities and key performance indicators included in the framework but not mentioned today will be reported in future as significant updates occur. I also want to note that this work is happening alongside our continued stewardship of the Drug Medi-Cal Organized Delivery System, which is the most significant investment, having the most sizable impact in the county on the health of people at risk of harms from substance use. Looking ahead, Behavioral Health Services is exploring the possibility of engaging in academic partnerships to conduct evaluation activities for San Diego Relay and drug checking efforts. All evaluation efforts will be coordinated with the Office of Evaluation, Performance, and Analytics to ensure alignment with the county's commitment to utilize data and performance measures to inform and improve our programs and services. In summary, today's actions request your receipt of these updates and your authorization of competitive solicitations for county public messaging, outreach, and education, as well as a return to the board to present any recommended changes to the opioid settlement framework to ensure alignment with the settlement agreement and new state guidance. Thank you, and we'll take any questions now.
Thank you. I'll open up for the public comment.
Thank you, Chairwoman Vargas. We have 8 requests to speak on this item, 2 in person and 6 requesting to speak by phone. Also note that we did not receive any e-comments on this item. Any members of the public that requested to speak on item 26 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those, both speakers are in opposition of this item. As your name is called, please come forward. I'd like to invite Ellen C. and Justin Castro. You'll have 2 minutes to address the board. I'll ask you to please state your name for the audio record.
Thank you, Mr. Potter. Alan C., just a one-picture reminder, the fentanyl. As I mentioned several times already, you're putting a Band-Aid on the problem when I saw this vending machine. It actually says, well, let's prevent the guy from dying because he took fentanyl. But why don't you outlaw it? It's actually a legal prescription in all the hospitals, but yet you won't outlaw it. And I couldn't believe Joel would actually vote to not force treatment onto people because you ran on housing. So what's your cut, sir? What's your cut, Tara? You smiled when you said that. If you want to really solve this, as I mentioned before, fentanyl, opioids, all that, go to the root. Do you want to Band-Aid it, or do you want to actually solve the problem? It starts here. Chair, you can take the lead. Get every supervisor throughout the state, pressure the state to outlaw fentanyl in the hospitals. It's a bold move. If you really care about these people, over 2,000 in our streets down here in San Diego County, I don't know how many I got in Chula Vista, but you saw what they're doing in Chula Vista. No drugs, no alcohol to live here. And my idea with the open bay birthing that Golden Hall failed on, you can really help these people. Because these people, and I'll point one out, Brandon down in Chula Vista, he came in and Chula Vista City Council listened to him every day, and finally he got forklift certified. He's a certified forklift driver, and he got out of it. What did it take? It took people to listen, to care, and actually give him support that way. And he got out of his drug abuse. He's now forklift certified. He still comes to our city council meetings, and he says, yeah, he thinks that pallet home's a great idea, because he lived it through that. But putting this homes, you're not helping anybody, sir. All you're doing is pocketing part of money. We know it. It's wrong. It's wrong. Help our society, sir. Thank you.
Next speaker, please.
Hi, my name is Justin Castro. I see that we just want to go ahead and focus our attentions on the effect. I don't really have necessarily a comment regarding this. I'm just really curious. What was so funny, Nora, during the talk about, you know, this opioid, all this stuff going on? What was so funny about this conversation that these guys were talking about that I had to get your attention and stop you from laughing while they were talking about basically people dying? Can you answer that question? Or are you just going to ignore it? Pretend I'm not even here? Okay, that's what I thought.
Now hear from the individuals that requested to speak by phone. Start with our first caller.
Of course, Nora is not going to answer you. You guys, so it's so funny. It's like such a good plan to get people hooked on the pharmaceuticals, like through the doctors, right? And then, because I used to be on fentanyl back when I was paralyzed and was dealing with many health issues. And I remember the doctor coming, and, they made it to a point where you had to sign a piece of paper saying, you're not going to sell it, right? It's like your way of mitigating the issue, and then you have somebody sitting in the waiting room going I'm about to get my prescription. I'll meet you in 5 minutes outside. So it's that program really worked to help keep people, just make sure who's using it. But then as soon as the doctors take it away, it's where do the people go, right? Do they go to the streets? Probably, right? And who puts the drugs on the streets? I don't know. Is it the government? Because it's where do these pharmaceuticals come from? Big pharma, and then they end up on the streets, right? And then we have a problem, and then we have to mitigate it by giving people more drugs, right? It's the way to combat drugs is with drugs. It's, the most intelligent route to take and the only one, right? Because when you guys want to basically get rid of everybody and make sure that, you guys are just, man, it's you're so good. I feel like I'm high on fentanyl right now. Great.
Thank you. We'll now hear from the next caller. Next caller is Kathleen Lippett. Your device might be muted. We can hear you. Please go ahead.
Thank you. Thank you again for letting me speak this afternoon. I just wanted to focus on preventing a narrow focus on harm reduction. That seems to be the phrase that is continued to be used over and over. But narrowly focusing on one reactive strategy is not going to help the behaviors that contribute to the need to do reactive and far more expensive interventions later on. And it's true, you do need to meet them where they are, but also meeting individuals who are on that road of that continuum of drug use is critically important. The opioid settlement is going to be used to fill budget holes, and right now that should not be addressed to homelessness. It should be addressed further upstream with prevention strategies. So I hope that there will be consideration for addressing these issues, because you are not going to end up reducing the increasing numbers of all of these behavioral health problems by focusing on harm reduction. So it is very, very expensive, and trying to provide treatment after the fact rather than identifying these individuals earlier on is going to be far more cost effective. Thank you for letting me speak.
Thank you. Now hear from the next caller.
Olympus just called you guys reactionaries. This is truth. Actually, Tara, you're a fool for accepting the mafia's money on the table and selling out the county. This 1980s war on opioid drugs rehash version fentanyl. Something to note is that these supervisors have deemed illicit fentanyl a problem, but the toxic fentanyl supplied by doctors is totally okay, like Alan C. said. 1 year ago, we had D.A. Summers saying she talked to the federal government's drug control policy advisor, Gupta, about the open border issue. But then all she pushed was anti-fentanyl propaganda to copy the DARE-era program. Perhaps somebody's brain is working like fried eggs, because things have been getting worse with open floodgate borders and despite all these propaganda programs. So far, all we've had is Japanese company Daiichi Sankyo's patented drug naloxone, paid for with $0.5 million from opioid settlement funds. And there's some random Narcan naloxone vending machines where no ID is required, and now children have access to more drugs. No one even considered that Narcan addicts may break into the vending machines. But no one stopped the flow of the professional poison of fentanyl, which is the only thing that will make a difference in how many more people are going to die, whether that's dealing with the issues of smuggling at the border, or if it's the CIA repeating the 1980s with their secret shipping in of cocaine to military bases that ended up being the crack that just happened to end up in predominantly Black American neighborhoods. People are dying on the streets, and all this item will do is pay for more state-approved public messaging propaganda. So just say no to these fraudulent and illicit items that do nothing but collect on checks from frivolous lawsuits.
Thank you. Now hear from the next caller.
Hi, this is Kelly McCormick. I'm a public health educator, and I'll be brief, but I want to support this measure, and I want to especially ask for an emphasis on prevention, particularly among young people. If you can stop them from using drugs in the first place, that's the best tool that we have. I'd like to dispel the myth that people use Narcan to get high. It is absolutely not a drug that produces a high and is not addictive and is not in any way a drug of abuse. And in fact, it will not hurt a person to take it even if they are not experiencing a fentanyl crisis. Lastly, I'd like to remind the supervisors, as acknowledged, fentanyl is not usually an overdose. The better term for many of the cases that we see is a poisoning. In other words, the people were taking another drug that they did not know had fentanyl in the drug, and it could be fake Xanax, a counterfeit cocaine, or it could be cocaine, another type of counterfeit pill. But the point is, these are counterfeit drugs that are laced with fentanyl, or in fact contain fentanyl in fillers and none of the drug that it is said to have, according to the drug dealers. So please, the more we can get that point across, the better off we'll be. And of course, the gold standard is prevention and preventing that drug use in the first place. Thank you.
Thank you. Chairwoman Vargas, we have one more caller that just dialed into the queue.
Good afternoon, Board of Supervisors. Ann Riddle here. This morning, many of us in the public health community received this message from the California Helpline. Its title was, California's Fentanyl Problem is Only Getting Worse. It displayed billboards that are out on I-10 trying to help our young people and their families understand the danger to them when they use other drugs that may be contaminated or poisoned by fentanyl. And it's to this issue I'd like to speak. We understand that some older people use fentanyl purposely. They know that they're going to experience some sort of positive experience and they just seek it out. But for our young people, it tends to be the use of Xanax or Adderall that turns out to be contaminated. So the real question we need to ask ourselves on behalf of our young people is, why do they choose Xanax and Adderall? Why do they choose it? What do they think they're going to get from it? How could we show them that there are better ways to accomplish stress reduction? And make sure that our messaging starts early and comprehensively, certainly before our young people leave elementary school, so that if they begin that sort of trajectory that's part of adolescence, they're not seeking out some false illusion regarding the difficulties that come our way in just this journey through life. Thank you.
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
Thank you. I'm happy to make a motion. I think that I want to say thank you for all the work that you've done on this. I particularly appreciate the fact that when this item first came up, we talked about making sure that school districts and students were part of the component for the actual soliciting the input as well. So I'm pleased to hear that naloxone distribution continues to be expanded throughout the vending machines and the Leave Behind Naloxone programs as well. And hearing about the efforts that are around, that we have underway in the different parts of the region. So I really, really appreciate that, and that you're using data to ensure that that it's in the right place. And so harm reduction services, messaging, outreach efforts on mental health, substance abuse, other strategies. I think the county is making strides in trying to make sure, look at this from a bigger picture and partnering with all folks on it as well. So with that, like I said, I'm happy to make a motion. Supervisor Desmond?
I'll second the motion, and I just want to say thank you very much to staff for, you'll be identifying these funds where they're going to be used best. We look forward to that coming back to the board. My 2 cents is for these dollars to go towards their early education. I really think we should continue to build on the prevention curriculum that's going to be taught in schools. I understand this fall in many of the school districts here in San Diego County. And I understand it's only going to be right now to 7th and 8th graders. If we could expand that, that would be very nice. If that went to like the 5th and 12th graders, and maybe even parents on parent night or something like that. If there's ways we can get more early education out there. And, I really appreciate your work on this, and thank you again for all the hard work on it. Thanks.
And before I provide it to Supervisor Lashley, Vice Chair, I also want to say thank you to Supervisor Anderson for being the person introducing this as well. So thank you.
I just wanted to say how much I appreciate continuing to drive forward this work. It's a big crisis that we're facing in our community, and it is so important that we as the county are leaning in to education and being engaged with our young people and being in our schools, being on social media and all the different places that we can talk to and engage with young people or in education, but also all the harm reduction strategies that we've talked about in terms of the treatment strips and the naloxone and all the various other interventions that we're looking at. So thank you, and I think we will continue to to move this work forward. And I'm glad this is centered in terms of what we're focused on. And thank you as well to my colleague who initially brought this framework forward. So thanks.
Okay. With that, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. Thank you, everyone, for the great work. The next item on the agenda is item 27, to approve the ordinance amending and repealing provisions in the San Diego County Administrative Code related to the Child and Family Strengthening Advisory Board of San Diego County, Polinski Children's Center Advisory Board, and the San Diego County Foster Care Service Committee. We have a presentation, but I think what we're going to do is go ahead and have public comment. But before we do that, I just want to first and foremost thank Kim Jardina and her team for bringing these proposed changes forward to the Child and Family Strengthening Advisory Board. I have served on that advisory board for about 2 years, and I really believe that these changes reflect the county's commitment to prevention and supporting our foster youth. Having all 3 advisory boards align into one is going to help the county expand community engagement and provide equitable access to our community. And additionally, I'm excited that the work groups give us an opportunity to continue making ongoing improvements to our child and family well-being system. So I want to thank all of the members of the Child and Family Strengthening Advisory Board for their ongoing commitment to improving the lives of children and families in San Diego. Having served on that board, as I mentioned, in the last 2 years, I got to see firsthand the dedication and commitment of each and every one of the advisory board members to improve the well-being of children in our county. And so before we put it on public comment, I want to make a motion to support this item with a friendly, making a motion to approve the recommendation, but also including a friendly amendment to propose an ordinance in the membership selection section under section 84.702G12 to add with a preference for representation from Promises to Kids to read as follows: A, B, and Jesse Polinski Children's Center with a preference for a representative from Promises to Kids. I want to make sure that I emphasize the why on this because, as many of you know, back in the 90s, Promises to Kids played an integral role in raising funding to help build Polinski Children's Center, a place that provides not only shelter but also offers protection and support for abused and neglected children in our county. Throughout the years, Promises to Kids has been a true partner in serving our current and former foster youth population by providing them with the necessary support and opportunities to help them grow into healthy, happy, and successful adults. Additionally, under the Polinski Children's Center Advisory Board, Promises to Kids currently is represented and has offered their guidance on matters related to the Polinski Children's Center as well. Because of these reasons mentioned and the fact that the PCC Advisory Board duties are now being integrated into the Child and Family Strengthening Advisory Board, I believe it's fitting that preference is given to a Promises to Kids representative to serve under the A, B, and Jesse Polinski Children's Center membership category for this advisory board. And just to make sure it's clear, I did have a conversation with the team on this, with our county staff, and so with that, I'm happy to make a motion with that friendly amendment and support the staff's recommendations. Thank you, and we're going to go ahead and go to public comment.
Thank you, Chairwoman Vargas. We have 4 requests to speak on this item, 1 in person and 3 requesting to speak by phone. Also note that we received 1 e-comment in opposition of this item. For the members of the public that requested to speak on item 27 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speaker. The speaker is in favor of this item. I'd like to invite forward Tanya Torosian. You'll have 2 minutes to address the board.
Okay, thank you very much, and I appreciate the words of support, and I appreciate the partnership of the Board of Supervisors and HHSA over the years. I am in support of this motion as well, to fold the Polinski Children's Center Advisory Board under the Child and Family Strengthening Board. I think that aligning them does make a great deal of sense in support of our foster youth. I am still requesting that we do look at transferring the current designated seats from the Polinski Children's Center Advisory Board that are currently designated for Promises to Kids and as a Promises to Kids designee, So transferring, instead of 2 of those, 1 as designated promises to kids on the motion here. The reason for that is the history that was brought up. We did raise the $13 million and joined in a public-private partnership with the county 30 years ago to build the Polinsky Children's Center. Since that time, we have dedicated over $2 million in additional support to Polinsky Children's Center, renovations as well as support. And annually, we continue to provide roughly $250,000 in support to Child Welfare Services recipients as part of our agreement and part of our staying on site at the center. We've worked collaboratively together on many projects, too many probably to list, but we're always there together to support the youth. I value the partnership that we have, and I look forward to continuing that. That board, the advisory board, was established at the time of the center opening, specifically to include Promises to Kids, with 2 seats for Promises to Kids, 1 for District 4, 1 for District 1, and 1 for the presiding juvenile court. That purpose was to solidify that initial partnership. So I'm looking to continue that. Thank you.
Thank you. We'll now hear from the individuals that requested to speak by phone.
We always escape stakeholders' mouths. It's the truth. As the item says, that the county's Child and Family Strengthening Advisory Board has served as a conduit for reducing silos amongst stakeholders. All business language, not terms people would associate with taking care of children in the foster system. Reducing silos means to implement ACO's unified vision by opening channels of communication in order to reduce costs for the business and increase productivity amongst the worker bees. So now the Polinsky Children's Center Advisory Board and the San Diego Foster Care Services Committee will be absorbed into the county's child board. Everything entangled for minimum input and maximum output. And perhaps all at the expense of children, because from a May 2nd, 2022 ABC 10 News article, quote, state social workers say the Polinsky Children's Center violated state licensing guidelines. County employee Rachel Randolph was asked about inadequate staffing. You're not able to supervise the kids properly, she said. Reporter Adam Raskin asked Randolph if the staff thinks the County of San Diego is doing enough to protect them and the kids. No, they don't, she said. Former staff members say the county allowed teenage boys and girls to live in the same housing unit. They claim there are drugs and alcohol on campus and an increasing number of kids who go AWOL. According to the San Diego Police Department, in the past 3 years, there were more than 2,000 calls to the Polinsky Center, end quote. And from a May 30th, 2021 San Diego Union Tribune article, there have been, quote, nearly 3 dozen wrongful deaths, negligence, and civil rights complaints brought against San Diego County's Child Welfare Office. The county has paid more than $11.7 million to settle 15 of those cases, many of which accuse the county of taking children away from parents without good reason or even a warrant. In many cases, the family's encounters with the child welfare system led to disastrous ends, end quote. Looks like I found the worst system of them all. Somebody please think of the children. Think of the children.
Thank you. Now hear from the next caller.
Nora, you're so smart for not taking, the report before public comment. That is so intelligent. And I love that you guys think that combining all these entities into one is actually going to prevent and respond to child abuse and neglect and ensure well-being of children and families. You guys realize what you're doing to the children, right? And making them suicidal by making them think that they are transgender and that they can be anything that they want to be. Oh, man, you guys are so good at that. But it's like, see, your way of, like, getting everybody into, like, one data area is so nice because you offer it up like it's like we're going to help the children. And so as long as we have all this data in one place, it's going to help prevent that. Or is it going to help perpetuate child abuse, neglect, and all of those things, even trafficking, right? Man, you guys, I'm just, like, really impressed with, like, your level of expertise and, like, really making things in the county better. It's like, no matter how much money you get, you guys continually make it better. Nothing gets worse. Like, I mean, you guys, no wonder you're getting UN awards, right? Because you're like totally in the line of the sustainability goal, the climate action plan. You guys are the World Economic, I mean, you don't even need Nathan there to push the World Economic Forum's whole agenda. You guys are doing so good at it. I just really want to give you a round of applause. And I have some aged sewer water that I'm going to be bringing into you momentarily that you guys can all taste. It's been quite a few days. It's looking quite chunky, and I think you're really going to like it, especially because the city is sitting there talking about all this sewer water they're going to give to people. I think this is going to be a good taste test for you guys to know that what you're doing is so on target, and you are just like, God is so proud of you. He has a very, very special place for you guys when you're done with your agenda. So it's being kept very...
And Chairwoman Vargas, that concludes public comment on this item.
Okay, we have a motion and a second. Please vote. Supervisor Desmond?
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. The next item is item number 28. And this is amend AT&T and Wi-Fi services and accept and appropriate grant funds for emergency connectivity fund. Happy to make a motion. Is there a second? Second. Okay, let's go ahead and go for public comment.
Thank you, Chairwoman Vargas. We have 5 requests to speak on this item, 2 in person and 3 requesting to speak by phone. Also note we did not receive any e-comments on this item. We'll begin with the in-person speakers. Both speakers are in opposition. I'd like to invite forward Mark and Alan C. I've called your name. Please come forward. You'll have 2 minutes to address the board.
Alan C., $4.3 million for 7,000 Google Book laptops to allow the patron to check it out for a year, 7,000 hotspots. Again, this $4.3 million. Don't we have more important things like the 2,000 people living in the street? Something to point out, possibly while we're in here, all the people on your cell phones right now, maybe you can take a few moments of patience to put that aside and listen to the public speakers and get involved. Correlation. We do that for these children. Aren't we kind of going against the grain for the trying to prevent suicide prevention? I motion, of course I can't, but you can, that you remove social media from these laptops, i.e. some of the more horrible ones that we know of. I do not believe in censorship, but if we're using tax money to giving out 7,000 laptops for these kids to have for a year, minimal, you know, the point of the laptop is so they can get their diploma, research. Maybe they should lock out the social media, TikTok, for example. So looking at that, because I mean, look at you right now. You're on your cell phones, keying away, distracted. Our kids can't even play baseball because you're actually encouraging them to just go on social media. So consider that as well, please. I will yield back.
Thank you. Now hear from the individuals that requested to speak by phone.
Oh man, you guys, and your whole Wi-Fi thing and AT&T, it's such a good plan, right? Because this has to do with all the vaccines and all of the, you know, transhuman agenda. And you want to make it like, we're going to be giving people access to the internet and like, we're going to provide them with these things, right? It's just like giving people phones. It's such a good way to track people, you guys. And so, you know, as long as we can control people with the 5G and all these things, and as long as it makes them feel like they're sick, right, because of like COVID, it's like COVID doesn't exist, but as long as we have 5G everywhere, then people are going to be getting sick, and then we can create all these pandemics and pretend like, oh my gosh, we better mitigate this, all while you're like perpetuating it and making sure that, you know, because it's radiation, you guys, it's so good. It's like, you know, radiation makes it like you have the flu, then you can sit there and PCR test people and be like, oh my gosh, I know you don't think you're sick, but you are. I just wanted to let you know that you're sick and you're going to have to take this vaccine and it's going to make you better. It's going to make you transhuman and it's going to make us be able to tell you what to do. So like when you come into these meetings, we don't have to say, stop it, you're not on topic. You'll just be on topic because you're going to mimic and say whatever we want you to say. And so then you're just going to push the agenda. You guys are so smart. It's so great. I can't wait to see you in a couple of minutes. Love you guys. Bye.
We'll now hear from the next caller.
Hey, it's Truth. What if I'm coming there in a few minutes, too? I don't know. I'm thinking about it. Through the FCC's Emergency Connectivity Fund program, the county library system was given $4.3 million in federal debt dollars to buy 7,000 AT&T Wi-Fi hotspot and data devices with data services and 7,000 Google Chromebooks. The county library bundled those into Tech Connect kits available to people with a library card at checkout for free for up to 1 year. Why for 1 year? No one knows. False hopes that people would be able to keep them, I guess. But no surprise to read that a whole bunch of people suddenly became library card holders and checked out 92% of the Tech Connect kits as of last year. Free talk, especially free unlimited data on Chromebooks or Wi-Fi hotspots, with no censorship on what children can watch, like Alan was talking about. Now the county scooped up another over $1.3 million from the FCC to buy 2,000 more Wi-Fi hotspots provided by AT&T through a National Association of State Procurement Officials contract between AT&T and the state of Utah. Two problems there. One, the National Association of State Procurement Officials is an organization in Illinois that was founded by a few people looking to get their hands on surplus property the federal government had collected during World War II. And two, California doesn't need to be entangled with the states of Utah or Illinois. But the library will buy these Wi-Fi devices and then file for reimbursement from the FCC's Universal Service Administration Company. Total program cost will be $6 million by the end of the year, so it sounds like AT&T is making a killing. Maybe with radiation, too. I will inform the public that everyone should go buy used books from their local library because they're only 50 cents to $1. Best deal around without constant censorship and way better than reading a stupid screen with LEDs that damage your eyes. Accurate knowledge is power. Remember that. Read a book.
And Chairwoman Vargas, that concludes public comment on this item.
All right, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors who are present voting aye.
Thank you so much. Thank you for all the work. The next item on the agenda is a resolution to call a special election to fill the vacancy on the 4th District County of San Diego Board of Supervisors, item 29. I'm going to turn it over to our
Chairwoman,
county team. I'm sorry.
I'll go ahead and start the.
I'm sorry?
I'll start the presentation.
Oh, okay. Just give me 1 second. You are county staff. I was going to turn it over to you. Give me a second. But before I turn it over to the county team, I just want to say thank you again. I want to say, as I mentioned again, on May 2nd, that for us as a county board, we are, for myself, it's a priority that this board, and for this board, that we provide the process for District 4 residents the ability to select the representatives. It was very important to all of us, and as you know, we voted unanimously on this item. I want to say that I really appreciate the staff that have confirmed the engagement and education for the upcoming process for the election for the candidates on the voters of District 4. I appreciate Vice Chair Tara Lawson-Remer bringing this item up as well, and for us to be able to take a deeper dive and to really understand where the resources are going. And so I thank the registrar again for really looking into this and really sharing that information and ensuring that each of the board offices had that. And so I am going to turn it over to Michael so that he can go ahead and present some information. But I think it's important that folks really think about, really get a chance to look at some of the things that we asked is current voter registration, how many voter centers that we're going to have, how many options, ballot drop boxes, all of that is going to be part of the presentation, and including how much we're going to be spending on outreach. So I'll turn it over to Michael.
Thanks so much, Chairwoman. Members of the board, let me tee up today's item related to calling for the special election. Should you take action today to call for the special election as recommended, the registrar of voters will have a narrow window to pull the election together than what is generally provided, and it would start in earnest tomorrow as interested District 4 residents can step into the Registrar of Voters to officially express interest in becoming a candidate. It is vitally important that the Registrar of Voters keeps their eye on the fundamentals which keeps the integrity, security, accuracy, and transparency of the election top of mind at all times. Our registrar, Cynthia, will describe these fundamentals today, but I do want to recognize the importance of what was conveyed at our last board meeting, voter education and outreach. I want to turn the time over to our county counsel, who will start with what is legally required. Cynthia will describe how her office meets these requirements, it goes beyond these requirements, and how we as a county can enhance what we are doing going into the special election to ensure all eligible voters are well informed and equipped to vote and have their vote counted. Claudia?
Thank you, Michael. Chairwoman and members of the board. The county's voter education outreach plan is designed and implemented pursuant to Elections Code Section 4005. The Elections Code specifically requires the Registrar of Voters to create a plan to educate and inform voters about the upcoming election. The plan includes how the county will address significant disparities in voter accessibility and participation. The county's outreach to voters, its primary purpose is to educate and inform about the election. Where to vote, how to vote by mail, where to call for more assistance, provide upcoming election information via media announcements that serve non-English and English-speaking voters, and informing our voters with disabilities about accessible voting. The county's voter education outreach plan describes the various means of communication, such as direct mailers, community engagement events, and various types of media, all with the purpose of informing voters of the upcoming election. The county adopted its plan, which was then approved by the Secretary of State in 2022. I'll now turn it over to the Registrar of Voters, Cynthia Pays, who will go through what they will be doing to inform voters about the election, consistent with and compliant with Elections Code Section 4005, and how they exceed the requirements of their own voter education outreach plan.
Thank you. Good afternoon, Chairwoman Vargas and members of the board. The item before you today is to adopt the resolution calling a special election to fill the vacancy in the county's 4th district. The overall administration of the election is most critical, as Michael mentioned, as we consider the compressed timeline. My office must turn our care and attention to every facet of the election cycle, ensuring smooth operations and service delivery. If adopted, candidate filing activities will start at 8 a.m. tomorrow. We must create the fundamental structure of the election, address in-office and vote center staffing needs, prepare and proof official ballot and voter information pamphlet, work with our print and mailing vendors to meet mandatory mailing deadlines, secure vote centers and ballot drop box locations, translate all voter material, and more. Next slide. With today's action to call the special election, my office will immediately populate our website with information about the election. I will cover a few key dates that are fast approaching. The signatures in lieu process will begin at 8 a.m. tomorrow. This is the period where candidates may obtain forms from our office to secure signatures in lieu of all or part of their filing fee. The first of our mailers to registered voters in District 4 will go out on May 30th. The candidate nomination period will start May 30th and end at 5 p.m. on June 6th. Our second mailer, the voter information pamphlet and sample ballot, will go out in the mail on July 6th. Next slide. All active registered voters in District 4 will receive their official ballot packet in the mail the week of July 16th. And our official ballot drop boxes will open on July 18th through Election Day, August 15th. We will have a minimum of 27 ballot drop boxes located conveniently around the district. The final election mailer goes out on July 31st, just prior to the vote center's opening on August 5th. So we will have our 11-day vote centers. There will be 7 11-day vote centers that will open August 5th through August 15th, 2 full weekends to come out and vote early. Then on Election Day, we will have a total of 14 vote centers open across the district. Election results must be certified by September 14th. However, with special elections, the full 30 days will not be needed. So we will work with speed and accuracy to certify the election and bring the final official election results to your board as soon as possible. During the May 2nd board meeting, a discussion took place related to the importance of informing all voters in District 4 of the upcoming election. This discussion was informative to my office, and I would like to briefly lay out our approach, starting with state and federal requirements, our current efforts, and how we plan to work with the County Communications Office to take advantage of the county enterprise. This is something new we are adding to our outreach efforts moving forward. Next slide. Under Section 203 of the Federal Voting Rights Act, election-related information and materials are available to San Diego County voters in English, Spanish, Filipino, Vietnamese, and Chinese. This includes the official ballot packet, voter information pamphlets, all mailings and communications, including postcards, news stories, advertisements, educational workshops and demonstrations, official postings and notices at our vote centers and on our ballot drop boxes, and the provision of bilingual poll workers are just a few of the services and materials we provide. Next slide. In addition to the Federal Voting Rights Act, the requirements for language assistance are also provided under California Elections Code, which requires counties to provide translated facsimile ballots and related instruction to precincts where 3% or more voting age citizens are members of a single language minority and lack sufficient skills in English to vote without assistance. We also add additional languages under county policy. Next slide. Under the Voters' Choice Act, my office developed the county's election administration plan, which includes a comprehensive voter education and outreach strategy. This was done in collaboration with the community and our voter access advisory committees. My office hosted 19 public meetings and hearings, both virtually and in person, across the county leading up to the finalization and adoption of this plan. The county's plan was approved by the Secretary of State's office in March of last year. The plan describes how the Registrar's Office administers elections under the Voters' Choice Act, including the description of voting options, voter services, voting technology, security, outreach and education, as well as the process of selecting vote centers and ballot drop boxes. This plan is publicly available on our website, as well as on the Secretary of State site. Next slide. Our voter education and outreach program focuses on 5 key areas, and we often go far beyond what is required by law. Our voter education and outreach strategy guides our efforts year-round. We have full-time voter outreach coordinators, a process for translation of election materials, including the management of 5 complete websites in our federally covered languages. We work with our voter access advisory committees, and we provide bilingual staff in our office, on our call centers, and at vote centers. Next slide. The Registrar's Office has a robust voter education and outreach program with 5 full-time staff, along with hiring an additional 8 to 10 seasonal staff for the upcoming election. Our outreach coordinators have strong and well-established partnerships within the community and with our voter access committees. These partnerships help advise our office as it relates to voter outreach, service delivery, and translations. Our outreach coordinators attend well over 300 community events and meetings each year. We already have several on our community calendar in the coming months to target District 4. In addition, we are scheduling voter education workshops throughout the district. I now want to touch on some of the new outreach efforts we are adding to our program. Next slide. The county's communication office will tap into existing county channels to target District 4 voters. The county's new digital outreach engagement platform, Engage San Diego County, and the Engagement Center will be used to further promote election information and make it easy for District 4 voters to access information at their convenience. We will be able to reach over 1 million county residents and community-based organizations through Gov Delivery, and another 35,000 subscribers through the County News Center and County TV. Beyond these tactics, more than 40 social media accounts across 22 departments will provide opportunities for residents to get information
Excuse
through
me,
their
Ms. Weiss,
preferred
give me a second.
channels.
For those that are chit-chatting in the, excuse me, sir, if you want to have a conversation, please feel free to have it outside. I want to make sure we're respectful of Ms. Bias's time. Go ahead.
Thank you. We will also take advantage of dozens of newsletters and events coming up in the next few months across our various county departments. Next slide. Our overall outreach strategy is to inform District 4 voters of the upcoming election, the importance of voting in local elections, key dates not to miss, our hassle-free voting guide, voting options, and how to vote. This will be accomplished through a creative approach to reach as many voters as possible through a variety of activities and partnerships. I will touch on a few of these. Next slide. Here are some examples of what District 4 voters will see during the upcoming election. The registrar's office will send 4 direct mailers. We will host voter educational workshops throughout the district to increase access and participation of eligible voters. We will continue to actively participate in community events around the county while targeting upcoming events in the district. The 4th District's diverse communities receive news updates from a variety of sources, and with community newspapers being one of the leading sources of information. We will place advertisements in general and in-language community newspapers throughout the district. Some of the community newspapers are not limited to these, but San Diego Union Tribune, College Time Courier, La Mesa Courier, San Diego Downtown News, San Diego Uptown News, San Diego Voice and Viewpoint, El Latino, Epcot Times, Filipino Press, and the San Diego Asian Journal. We are still targeting other community newspapers. And when it comes to media coverage, the registrar's office is fortunate as local television and radio news outlets frequently come to us to cover relevant information throughout the election cycle. We will now use the county's social media channels to attract new voters and provide information including critical deadlines, voting options and tips, as well as vote center and mail ballot drop box locations. We will create social media toolkits with eye-catching graphics, sample social media posts, flyers, and links to the registrar's website. These will be available on our website and will be distributed to community partners to help amplify the message. We will place outdoor posters and flyers at locations such as libraries, convenience stores, grocery stores, liquor stores, restaurants, bodegas, and more, targeting neighborhoods within the 4th District. Our public service announcements will be shared with our community partners, and will run on the county's social media channels targeting the district's general population and communities of interest. Next slide. I will leave you today with today's recommended action. Subject to any questions, this concludes my presentation. Thank you.
Thank you. I'm going to go ahead and turn it over to public comment.
Thank you, Chairwoman Vargas. We have 50 requests to speak on this item, 21 in person and 29 requesting to speak by phone. Also note that we received 82 e-comments, 70 in favor and 1 in opposition, as well as 2 neutral comments. Any members of the public that requested to speak on item 29 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'll be calling you in groups of 5, so I'll ask you to please listen for your name. I'd like to invite forward the following individuals: Ann Elliott, Mark Stutzman, Robert Contreras, Sarah Huck, and Simon Guzman. If I've called your name, please come forward. You'll have 2 minutes to address the board. I'll ask you to please state your name for the audio record.
Hello. Thank you for allowing us to speak, and also I want to thank you, board, for your service to the community very much. My name is Ann Elliott. I live in District 4. District 4 is probably the most diverse district in the county. I would like to see a representative elected who values that diversity and listens to our citizens. A special election generally experiences poor voter turnout. I came wanting to ask for a big effort on your part to make sure that people get out to vote, and it sounds to me like you are going to make that, and I appreciate that very much. I would like to say, beyond what I was going to say about getting out people to vote, honestly, I think a lot of people don't really know what you do. I don't think a lot of people in the county really understand how what you do affects them. And I would encourage you to try not only to tell people where and how they can vote, but also why it matters to them. And additionally, I hope that the election pamphlet will include information about each candidate so that the choices that they make will be clarified. Thank you.
Thank you. Next speaker, please.
Good afternoon, Board of Supervisors. I thank you for the opportunity to speak. My name is Mark Stutzman, he, him, his, and I live in District 5. I'm an ACLU volunteer, and I speak in favor of item number 29. I bring you a quote from Aristotle as a centering thought when you consider and deliberate on item 29. If liberty and equality, as is thought by some, are chiefly to be found in democracy, they will be best attained when all persons alike share in the government to the utmost. One of my first ACLU volunteer experiences was tabling in favor of Measure D in 2018. Measure D passed 63 to 37 and now requires elective office elections in the county be held during the general elections. While tabling, I ran into a well-heeled man who asked me why I supported Measure D, to which I said, because it makes us more democratic. His retort was to ask what makes voting in a general election more democratic than voting in a primary election, because people who really care vote in primaries, so it doesn't matter that it's less people. When it dawned on me that this person didn't really understand the meaning of the word democracy, I disengaged and pivoted to another passerby. And I mention this unforgettable exchange in hope that you, my county supervisors, also recognize how misguided this conception of democracy was, and to underscore the need in our county to make the vote accessible to all eligible voters equally, and raise the public's awareness of how important and open and fair elections are to societal stability. I see that under the plan, we're funding the District 4 special election in a meaningful way. I appreciate that. So now we have, hopefully we'll have not only a record number of voters, but also educating them in a way that reflects an understanding of what Aristotle meant when he described democracy as, quote unquote, best attained when all persons alike share in the government to the utmost. And so that 70% number voting against a more democratic process.
Thank you. Time is up. Next speaker, please.
Good afternoon, supervisors. My name is Sarah Huck, and I use she, her pronouns, and I'm happy to call District 4 my home. Voter turnout is a vital part of the democratic process, and I'm here today to urge the board to do everything that you can to encourage robust voter participation in the upcoming District 4 special election. It is well known that special elections often have low voter turnout, particularly among historically excluded communities. Across the country, we are seeing the ramifications of voter suppression and gerrymandering. While 75% of people support the right to legal abortion, 18 states, almost half the union, have restricted or severely limited access to abortion. This is what happens when our government does not accurately represent the values of the electorate. Here in San Diego, we need to ensure that our next supervisor represents and advocates for the needs of all of us, not just those who speak English, have a car, have historically been included in voter outreach, own property, have the luxury of time, and more. I urge the board to invest in robust voter participation in the special election to ensure an equitable and accessible voting process. I urge you to work with community partners to ensure the 14 vote centers are accessible, and I encourage you to explore the idea of keeping more of them open for numerous days. Finally, I ask that you invest in multi-language ads, ad placements, and ethnic media, as well as streaming, video banners, Google Ads, Facebook, Instagram, YouTube, and other social media outlets. Democracy is priceless. Thank you for your time and consideration.
Thank you. As the next speaker is coming forward, I'd like to invite 5 additional speakers in favor. Sinky Chapman, Stephanie Malin, Taylor Davey, David Trujillo, and Michelle Guittard. If I've called your name, please come forward.
Good afternoon, Chair Vargas and County Board of Supervisors. My name is Simon Guzman. I use he, him pronouns. I'm a resident of District 3, and I'm very happy to be someone that's grown up in North County for most of my life. I'm here in support of this agenda item with my family in my heart and families who look like mine in my mind. I feel a lot of pride to say that I'm the first in my family to be able to vote, and it's a big honor. And I was also the first one to learn how to vote, right, if I'm frank. And every year, I wrangle up my younger family members and my loved ones, and I ask them, did you get your ballot? Do you have everything you need to make an informed vote? Did you make a plan to vote? No, but did you really make a plan to vote? And then I text them afterwards and make sure that they actually turn in their ballot. I think every older sibling can kind of relate to that vibe, right? But I know that not every family has that luxury and has that privilege. And a lot of our community members rely on the radio, on trusted messengers, and also the registrar's office to provide the information that we need to know what we're voting on in the language that we speak. That's why I'm here today to urge you to fully fund nonpartisan voter education and robust voter participation processes that will ensure there's equity centered in the special election, right? Voting centers and drop-off boxes that are mindfully placed so that it's accessible to working families who right now are working multiple jobs just to raise their kiddos. So again, I said in the beginning, and I say that now, knowing that a lot of my immigrant and working families can't be here right now to voice their voice in this moment, but so many of them are going to be impacted, right, as residents and households of District 4 by who their supervisor is and the decisions that they make alongside each of you. So please keep that in mind. Democracy is priceless. Thank you so much for your time.
Thank you. Next speaker, please.
Good afternoon. I'm Stephanie Malin. I use she, her pronouns, and I'm here as a board member for Run Women Run and a resident of District 4. I stand here today to emphasize the crucial role of voter turnout in our democratic process. On behalf of Run Women Run, I urge the board to actively support and promote robust voter participation in the upcoming District 4 special election. Run Women Run is a nonpartisan organization dedicated to empowering and training candidates for public office. We strive to address historical exclusion and ensure equal participation in decision-making processes. We challenge our leaders to deconstruct frameworks of oppression while building opportunities for equity, learning, and accountability. We hold these values not only for ourselves, but for the candidates and elected leaders we endorse. To uphold these values, it is essential that this board prioritizes voting access.
Voting access is key to an equitable special election in a district of nearly 700,000 constituents, the most diverse district in our region. We must overcome common barriers such as lack of awareness, transportation limitations, and limited access to polling stations. By strategically placing voting centers and drop boxes in areas that are traditionally underserved, we can have an election that strives to represent and serve the people. I urge the board to invest in and encourage robust voter participation in the upcoming special election. Let us ensure an equitable and accessible voting process. Thank you for your time.
Thank you. As the next speaker is coming forward, I'd like to invite the remaining speakers in favor: Ashley Gwynn, Esther Hines, Robert Cotton, Lana Cotton, Mercedes Limon, and Jasmine Young. If I've called your name, please come forward.
Good afternoon, Chair Vargas, Supervisors. My name is David Trujillo. My pronouns are he, him, él. I am the Chief Program Strategy Officer for ACLU San Diego and Imperial Counties. We are here to urge you to vote aye on the agenda item before you to ensure a fair and equitable election process to fill the District 4 vacancy. Like you, we are committed to upholding our democratic principles, and we understand that democracy only works when the voice of the people is heard. I would like to thank you for choosing to hold a special election to fill this seat. By doing so, you're allowing District 4 voters to exercise their democratic right to choose a representative to this board. Based on state and county data for similar elections, turnout for this election we know is likely to be low, especially among historically disenfranchised communities. For example, Los Angeles had a special election to fill a city council vacancy earlier this year. Turnout for that election was under 10%. Here in San Diego County, we must do better. We must uphold the democratic process and ensure District 4 voters' voices are heard. As such, strategic outreach to inform and educate voters about the special election must take place. We urge the Board of Supervisors to invest in a robust, nonpartisan voter education program to increase voter turnout for the August special election and, if necessary, a November runoff, by sending mailers to all voters in District 4 that adhere to their language preferences, diversifying advertising to include multi-language print, broadcast, digital, streaming, and social media platforms, and placing vote centers and ballot drop boxes at strategic locations convenient to all District 4 voters. The San Diego County Board of Supervisors has an obligation to uphold our democratic values by voting aye on this item before you, because indeed, democracy is priceless. Thank you.
Thank you. Next speaker, please.
Hello, Chairman Vargas and the Board of Supervisors. Good afternoon. My name is Ashley Wynn. My pronouns are she, her. I'm a college student. I'm a resident of District 2, and I'm an ACLU volunteer. I'm here today because I'm concerned about voter turnout in the upcoming special election. I want to urge you to support voter education and promote this special election in the media, not just on the TV or on the radio or in newspapers, but also on social media, Instagram, YouTube, Google Ads. Social media is a powerful tool you have at your disposal to educate voters that would otherwise be marginalized in our community. And failure to utilize this powerful tool is failing your constituents. The young people who share ideas on social media, the marginalized voices that gain a platform on social media, the immigrant communities that preserve tradition on social media. These people are entitled to your best efforts at mobilizing them to vote. So I encourage you to do it. I want to know that my Board of Supervisors cares enough about my friends and family in District 4 to encourage them to vote, to tell them that their voice matters. I urge you to fund and promote comprehensive and inclusive voter education in languages that my friends and family can understand. I thank you so much for your time and careful consideration.
Next speaker, please.
Good afternoon. My name is Mercedes Limon, and I am a current student at UC San Diego on behalf of the ACLU as a volunteer today, and I currently reside in District 3. I'm here today to state that voter turnout is a crucial process to the democratic process, and I stand here today to urge the board to encourage robust voter participation in the upcoming District 4 special election. But in order to do this board must invest in election promotion via diverse media outlets. High voter turnout in special elections strengthens the democratic process, and as the board, you have an obligation towards your constituents to promote and encourage their voter participation in the upcoming August special election. In addition to promoting the election in traditional media outlets, such as the radio, newspaper, and television, the board must also invest in multi-language advertisements, ad placements in the ethnic media, as well as through other platforms such as streaming video, banners, Google Ads, Facebook, Instagram, YouTube, and other social media outlets. In consideration that a portion of San Diego County is located so closely to Mexico and could even be applied to the overall county, San Diego is home to a variety of diverse individuals, and there must be a significant push to not only uplift, but encourage voices that have been historically oppressed with specific indication to Black and Brown communities. True democracy in this upcoming special election not only means listening to those that voice their opinion, but first assuring that every individual in every diverse community and of every identity has the opportunity to voice their opinion, as the vote of those that have consistently been oppressed have the ability to influence policy that will directly assist them and the issues that they face. Additionally, these individuals have firsthand experiences to a variety of issues that Black and Brown and other marginalized folks face, and therefore should be encouraged to have a say in who represents them. I conclude my statement with urging the board to invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time and consideration.
Thank you. Next speaker, please.
Lana Cotton. Wake up, America. It's time for all patriots to get off the couch and fight for our constitutional republic before we lose it. We must elect representatives who are committed to fighting for America and the will of the people. However, we have a huge problem. We are using election systems that have poor controls and no ability to audit. Our representatives are being selected instead of elected by we the people. Watch selectioncode.com. Is there a solution to our flawed election processes? Dr. Frank, world-renowned physicist and Nobel Peace Prize nominee, says, yes. The following are his words. Vote Amish. 60,000 Amish people voted in the 2020 election for the first time. They voted in person on election day on paper. Voting Amish means voting in person, all paper, no machines, with an auditable paper trail. 1, in-person verification for everyone listed in the voter rolls. 2, paper poll books printed in advance of Election Day. 3, in-person voting with photo ID and poll book signatures on Election Day. 4, manual counting of every ballot with fully transparent and auditable processes. 5, accommodations made for the military and those with valid excuses. It's how we did it for hundreds of years. And it's how Europe conducts their elections today. Only recently have we become enamored with using computers for everything. But instead of making our elections more secure, our state legislatures are making our elections less transparent and increasingly easier to cheat. Incidentally, an Arizona state senator just informed all counties that machines cannot be used in the upcoming presidential election. A movement to return to simple and secure voting in America is beginning to build across the country. We can pilot Amish voting in the special election for District 4 supervisors. It will be cheaper and we'll have results that night instead of weeks later. Remember, watch selectioncode.com.
Next speaker, please. As the next speaker is coming forward, I'd like to invite the speakers in opposition: Mark, Justin Castro, Alan C., Audra, and Consuelo.
Chair Vargas, I'm Bob Cotton, and I want to give you a big congratulations for your actions during the previous Board of Supervisors meeting earlier this month. I want to give you a big thank you for your responsible and deliberative approach to Tara's very long-winded and very last-second attempt to push through an additional cost of $750,000 for the District 4 election for outreach. I'm just an old white guy, much like that guy in the White House, but I can still do basic arithmetic. The county has estimated the cost of our election at 2.1 to 2.6 million. Let's average that out at 2.35 million. $750,000 is equal to 32% of that 2.35 million. For outreach, it appears, it sounds like our county registrar of voters has everything under control. Every registered voter will receive a ballot in the mail, and in addition to their 4 notices. There's no shortage of NGOs and community groups to spread the word. Our registrar of voters has been given all the money she asked for. Tara, how is this $250,000 to be distributed? What did you have in mind? Was it to go to your special groups, your pet groups? $1 million for security for our previous board chair. Let's stop spending money that we don't have to. Thank you.
Okay. Next speaker, please.
Pay attention to the people who are talking.
You're being disruptive to the meeting. I am telling you that this is your first warning because you're being disruptive. This is your second warning. Please stop being disruptive, otherwise you're going to be asked to leave the chambers.
Next speaker, please.
Can you turn the numbers on? Mark, first of all, as the woman was stating, if you don't have identification and paper voting, then mail ballots without identification are so fraudulent. It's so easy to have a skewed vote. Also, I completely don't trust the council to even be in charge of this, or you supervisors are totally corrupt. As many people stated before, if you see this video on YouTube, I don't have time to describe everything, but this video, title on YouTube, will show people in the first minute and a half, Klaus Schwab, the head of the World Economic Forum, stating that he's penetrated governments, including half of Canada, Justin Trudeau, France, the president there, and Argentina. And Nathan Fletcher, if you Google this, this is Nathan Fletcher's membership page. Also Google Nathan Fletcher UCSD, and they'll say right on his professor page that he's part of the World Economic Forum. This is total treason, as you were notified of many, many times. And the fact that you've ignored this, even you, Jim, and never said or did anything about that, which is real, actual treason. And I wasn't even requested that he be jailed or hung or anything. I just want him to be removed from office. So the corruption here is absolutely profound. Oh, by the way, here's Nathan's statement from a photo back around 2016, I believe, on his Facebook page. It says, January 19th, 2016, Davos, Platz, Switzerland. Excited to be in Davos for the annual meeting of the World Economic Forum. It is cold but sunny. The fact that he was on the board for years, heading the board, and you guys didn't do anything when many people showed you. And the video, this video shows Klaus saying he's penetrated governments. You guys are treasonous. You shouldn't be in charge of anything. And all of you people should stop.
Thank you. Next speaker, please.
Hello, my name is Justin Castro, a former County of San Diego employee, which helped this wonderful young lady do the poll worker allocation because that job was way too difficult for her to do. It's amazing the fact that she became registrar. Now, speaking of the election and how secure it is, an envelope just like this, I went down there and grabbed one from someone, can be opened up with anything, hell, a card. I will attempt to do this as I go ahead and ask a question that I've asked multiple times for an answer for. I want to know how many ballots for the Newsom election came back with the wrong ballot type. Because I don't understand how this would happen if you mail them out ballot type number 4, and they mail you back ballot type number 52. That shouldn't happen because no one will go ahead and try to attempt to open up an envelope without tearing the seal. Because, you know, there's no CIA, CIA organizations that teach people how to do that. Hell, I swear to God, I read one that told me use a tongue dispenser or a key from a piano. That's how old that process is. So, if it is not possible to open up the envelope without tearing the seal, I don't know how I just did that. And if I could just throw a little bit of glue on that, I could seal that back up. If I wanted to switch out a ballot, I could do that. And matter of fact, we're not even checking. You want to increase people going there? Go to any polling location, find a sample ballot, use that as your identification, and you can vote. You don't need to live in the district to do that.
Thank you. Next speaker, please.
There's nothing to stop you from doing that. Tell me how it's legal. It's not legal.
Hello, Alan C. Thank you, Registrar. If you could look at me. She won't, but maybe you can relay this to her because she's on her cell phone. I think it's phenomenal. You're actually doing multiple mail-outs to every registered voter, 700,000 voters, ma'am. That is phenomenal. But I do want to point this out, that Myra at the register actually said you can do this, and it's actually confirmed with reference sdvote.com that you can use your mail ballot as an in-person paper ballot. Michael Vu, please let her know that later because you know that too, that's actually the best way to vote. Yes, you can use your mail ballot as an in-person paper ballot if you keep the envelope, fill it out at home, show up to any vote center, which has a database, every registered voter in the county, and say, I'd like to vote in person. You sign the tablet. The tablet actually verifies if you voted yet or not. Then they'll normally direct you to the touchscreen. You say, no, I'd like to use my mail ballot as an in-person paper ballot. That has happened 4 cycles ago. So I asked the registrar, because she's not looking at me, to actually put what I just put out that is put out by Myra over there, that they can use what I just described. That needs to be in every voter because you're disenfranchising voters like me that only trust in-person paper ballot. And that is legit to do that. Keep the envelope and just show up to vote in person. Now, I do question the reach out program, outreach program. Again, I say it's phenomenal, doing multiple mail-outs. But where do you put these booths? Do you put it in a Democrat stronghold? Do you let this person know, that person know, but you don't tell that person? That's wrong. You got to reach every 700,000 voter equally, or you cannot do an outreach program. Am I correct, sir? Because that's the only fair way, is by informing every voter in that district equally. What she tried to do and actually use funding, not a dime, let the registrar control it, and registrar asks you, please be fair and notify every 700,000 person equally. That is the only way to do it. Thank you.
Thank you. Next speaker, please.
This is on topic. Don't throw me out. It's all about voting. Consuelo, oh, the illusion of choice. I am campaigning for the people, all people, to start taking responsibility for themselves and stop living in fear. At this point in the game, because it's all just a game, you must know that this truth, it's the lowest of the low, the weakest of the weak, the most easily manipulated who are their puppets running the show. The elite know exactly the type to look for, those hungry for power and who could care less about the people. So stop perpetuating the system. Stop voting, stop contributing to the genocide, pedophilia, senseless wars, big pharma, UN Agenda 21. You contribute to the same system, you vote, you contribute to all of that too. Let it crash and burn. We know that this government is not a government for the people. They're a corporation, therefore they will never listen to us. We are merely collateral to them, stayed as slaves. You better start paying attention and question what in fact is going on. The future generations will pay dearly for your lack of interest in their corruption. Agenda 21 is all they care about. Again, let their system die, let it crash and burn. Reminder, we are born with everything we needed until we were duped, became indoctrinated, and sold ourselves out to fear and doubt. You are so powerful. There's more of us than them. They fear us all waking up. They fear us holding them accountable for all the evil they've done. We are more than capable. Trust in yourself. Go within. You are so powerful. So powerful. The children are counting on us. Wake up, humanity.
Next speaker, please.
What's up, friends? Right? What's up? It's good. Jim, I know you're so excited to hear people speak. You were like, oh my gosh, there's how many people? It sucks. You guys miss me, you know it. Man, when we talk about voting, it's like, gosh, and the registrar won't even look. You know how secure your system is? I went and voted. I'm not registered. I didn't show an ID, and I voted for someone else. Oh my gosh. How cool is that, right? But that means it's secure. That doesn't mean anybody could come in and vote for anybody else, right? Or you guys can manipulate the system. It's funny because it's like to have somebody that works on something so important and won't even be like, I'm gonna look you in the eye and say, you know what, I'm doing this right. I have every confidence in that. Look at that. And it's just like all of you guys. You sit there with all this confidence, like, we're doing what's right, and it's secure, just believe us. Believe us. But instead of going like, hey, let's try a different way, it's like, we're gonna spend millions of dollars to use these machines that are totally hackable, right? Right. And that way you can ensure you put in whoever you want. But what you should be doing is going and getting rid of the machines like all of these other counties have done. Because if you say that our vote counts, then you better well damn ensure that it does. So why can't we hand count paper ballots? Is that like the people aren't, we don't have anybody to do that. That's so weird. It would take too much money. Let's use something that we can go and manipulate. Well, you know what? The city council is sitting there dictating and putting proposals for the 2024 March 5th ballots. And the citizens can go in and say what proposal they want. So I suggest the citizens go in, if you guys are gonna say that we have a say in these elections, then get rid of the fucking machines. And prove it to the people that you care what they say. Otherwise, shut the fuck up.
Do a final call for the in-person speakers. Esther Hines, Jasmine Young, Robert Contreras, Sinky Chapman, Taylor Davey, Michelle Giffard. We'll now hear from those that requested to speak by phone. When it is your turn to speak, you'll be unmuted and you will hear a recording that will tell you to begin your comments after the beep. I'd remind the callers they should mute their TV or live video stream before they begin speaking. We'll start with our first caller.
Hi, my name is Vic Chu. I am a resident of District 4. I use they, them pronouns. Voter turnout is a vital part of the democratic process. I'm here today to urge the board to encourage robust voter participation in the upcoming District 4 special election. To do this, this board must embrace democracy. The Board of Supervisors has the opportunity to truly embrace that. The Board of Supervisors must invest in awareness campaigns and voter education and outreach. This will help ensure a robust and inclusive democratic process. This investment can extend beyond the election itself, fostering civic engagement, strengthening public trust, and building a more resilient community for our future. I urge the board to invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time and consideration.
Thank you. We'll now hear from the next caller.
Paul Henkin. As I said on May 2nd, District 4 needs representation now. You heard one of the speakers tell you no new committee members that they can't do their jobs. hard to get road work done or community development grants. It is nice that you established a special website to help out District 4 residents, but that is not the real solution. Only that's sort of like a busted tire. An election in 4 more months is great, but until then, any tax you pass is, in the words of Thomas Paine, 1776, taxation without representation. Appointments to county boards would be improper without District 4 people determining who best represents their values. Going through another supervisor's office is a nice offer, but another office may be unfamiliar with the priorities and day-to-day issues of District 4, and surely will have less time to help. Not a good situation. Ballot boxes open for 2 months from June 18th on. Looks like a vote early, vote often thing. Sort of reminds me of like Chicago or something. I am looking for a moderate who can work with all parties, but most of all, I suspect that the continued lack of representation in District 4 will simply add to this cost of.
Thank you. We'll now hear from the next caller.
Hi, everyone. Thank you for having me. I just want to say it's really great to be able to give my public comment virtually. So my name is Ashley Suarez. I use she, her, ella pronouns, and I'm a proud member of District 3. As I hope you all would agree, voter turnout is a vital part of the democratic process. So I'm here today to urge this board to encourage robust voter participation in the upcoming District 4 special elections. To do this board must invest in voter engagement strategies and promotion to ensure voting access. Investing in these strategies is crucial for maintaining a representative democracy. We know that special elections often have a low voter turnout, particularly among historically disenfranchised communities and others that are disengaged from the electoral process. To prevent common barriers to voter turnout, such as lack of awareness, transportation, and limited access to polling stations, the Board of Supervisors must invest in the Registrar of Voters' deployment of proven strategies and technologies that include expansive in-person voting and vote-by-mail opportunities. By strategically placing voting centers and ensuring ballot drop-off boxes are made available, the election can truly be of the people and for the people. These efforts will not only increase overall voter turnout, they also ensure that historically disenfranchised communities have a voice in shaping the communities that they are rightfully a part of. In a district of nearly 700,000 constituents, voting accessibility must be a priority for the Board of Supervisors because, as I'm sure you all would agree, democracy is priceless. This issue matters to me because I strongly believe that a democracy is only a true democracy when every single voice is given a fair opportunity to be heard. As we've seen for too long, our rights and livelihood are under constant attack. So it is imperative that everyone in our community has an equal opportunity to determine who they want at the helm to represent them, fight back, and protect their rights. I urge the board to invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time and consideration.
Thank you. Now hear from the next caller.
Hello, Board of Supervisors. My name is Anthony Avalos. I live in District 3, but make no mistake, me and my family have spent the better part of the last 70 years in District 4. Before I make my comment, I do want to say thank you to Chairwoman Vargas, Vice Chair Tara Lawson-Raymer, as well as the gentleman from the other side of the aisle, but still who do such a diligent job, Supervisor Desmond, and Anderson. Now, I'm here today to urge the board to encourage robust voter participation in the upcoming District 4 special election. But I also want to remind the board to spend time taking care of their own mental health. I can't tell you how exhausting it is to sit through one Board of Supervisors meeting. And so Just make sure you guys are taking care of yourselves as well. Now, in order to increase voter participation, we must ensure a representative democracy. A representative democracy only works when the voices of the people are heard. Special interests and powerful influencers in special elections often mute the voices of the people affected by system inequities. The Board of Supervisors must invest in an election outreach promotion campaign to increase civic engagement and voter turnout. This issue matters to me because historically San Diego has not been a good neighbor to Black, Brown, and Indigenous residents. Recent equitable efforts are noticed and they are commendable. For that, County Board, we thank you. I urge the board to both invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time. Thank you for your consideration.
Thank you. Now hear from the next caller.
Thank you.
Hi, good afternoon. My name is Judith Boggs, and I'm the Public Affairs Manager at Planned Parenthood of the Pacific Southwest. I'm also a resident of District 4 and deeply frustrated by the lack of representation myself and my neighbors have experienced for the past few months. I'm calling on the board to fully fund a comprehensive, nonpartisan voter education and engagement process that can create a robust voter turnout. Our communities deserve a fair timeline at electing a representative who will reflect our values, our needs, and challenges. District 4 residents deserve full communication in multiple languages for the special election, and we urge your support in funding the resources required to reach the diverse communities. Thank you.
Thank you. Now hear from the next caller.
Hi, my name is Stacy. My pronouns are she, her, and I live in District 4. I first want to thank the Board of Supervisors for their service. I especially want to shout out the chair and vice chair for how they handle everything that comes their way, including listening to the folks who clearly have nothing better to do on a Tuesday than attacking you and attacking our democratic process. So thank you. I also want to thank the previous speakers and e-commentators who have turned out today in support of item 29. I am joining these folks in urging the board to encourage robust voter participation in the upcoming District 4 special election. To do this, the board must allocate sufficient funds for voting promotion. Promoting the August special election is a catalyst for civic engagement, a vital component in the democratic process. By allocating funds to promote this election, the county supervisors can foster an informed and engaged electorate, ensuring a diverse range of voices and perspectives are involved in this great process. I urge the board to invest in whatever it takes to encourage robust voter participation in the upcoming special election. We need voting promotion and outreach that is diverse, multilingual, and multi-platform. Equitable and accessible voting is worth our energy and our money, and it is the just and moral thing to do. Democracy is priceless, and I appreciate your time. Thank you.
Thank you. Now hear from the next caller.
Greetings, esteemed board members. My name is Rick Arlo Yalita. I use he and him pronouns, and I stand before you today or on the phone with a deep passion for democracy and a strong belief in the power of the people. As a proud constituent of District 4, I am here to implore the Board of Supervisors to take action and prioritize voter turnout for the upcoming District 4 special election. I believe that the true heart of democracy is the power of every individual to vote and have their voices heard. However, it is a common knowledge that special elections often experience low voter turnout, particularly among historically disenfranchised communities and those who feel disconnected from the electoral process. That's why I urge the Board of Supervisors to invest in proven voter engagement strategies, such as expansive in-person voting and vote-by-mail opportunities. Let us work together to ensure that every eligible voter in our community has a chance to participate in this crucial election. Furthermore, let us not forget the importance of equitable access to voting. As someone who has experienced firsthand the challenges of trying to access polling stations on Election Day, I understand the importance of ensuring that every individual in our community has the opportunity to cast their vote. Therefore, I respectfully request the Board of Supervisors to prioritize accessibility by strategically placing voting centers and providing ballot drop boxes throughout the district. In conclusion, the success of our democracy relies upon the active participation of every member of our community. Together, let us work hand in hand to build a culture that promotes civic engagement and upholds the ideals of democracy. Thank you for your time and consideration.
Thank you. Now hear from the next caller.
Good afternoon, Chair Vargas, Co-Chair Lawson Reamer, and Supervisors Anderson and Desmond. My name is Rosette Garcia. I am the president of the League of Women Voters of North County, San Diego. On behalf of my league and the League of San Diego, I would like to applaud your decision to allow voters in District 4 to elect their supervisor in a special election on August 15th. We are concerned, however, about low voter turnout, which is typical in special elections, particularly among historically disenfranchised communities and other eligible voters who are disengaged from the electoral process. We are, though, encouraged by the Registrar of Voters' proposed plan for voter outreach. We urge you to ensure robust voter participation by fully funding a comprehensive, nonpartisan voter outreach, education, and communications effort to ensure maximum voter participation and especially to assure equitable access for all communities to the voting process. The League of Women Voters has always stood for voter empowerment and for expanding voter access. We'd like you to know that we're here to help the Registrar of Voters with that outreach, and we are also available to facilitate candidate forums if requested. Thank you very much.
Thank you. Now hear from the next caller.
Hello to the County Board of Supervisors. My name is Max, and I'm a lifelong resident of District 4. I want to start by thanking the board for continuing to allow remote options for public comments, as it's acceptability measures like this that help strengthen democracy. But on that note, I would like to pivot to the upcoming special election to be held in my district on August 15th. As I'm sure the board knows, off-season snap elections have record low turnout, often as low as 10% of that of general elections. This is usually of no fault of constituents, many of whom are not even aware that elections are taking place. Democracy requires broad participation, and that's why I would like to offer my support to 29 and implore the board to devote resources to spread awareness and increase the accessibility of this upcoming election, so that me and my peers have a better shot of being represented by someone who truly reflects our values. Thank you.
Thank you. Now hear from the next caller. Next caller is Armando Teles. Your device might be muted. Come back.
Hi, this is...
Sorry about that. We'll bring that caller back. Armando, please go ahead.
Hi, my name is Armando Teles, and my family lives in District 5, which is in unincorporated North County, San Diego. And although I am calling in favor of this proposal, I want to first apologize as a man to the women in the room and our elected representatives for the misogyny that you experience every day as we witnessed during this hearing today. It's very upsetting. And for Ms. Pease, I know you're doing an outstanding job, and I trust and believe that you will continue to do so, and I apologize for the continual attacks for people who have no idea what you all do as our representatives. Nonetheless, it's for the voter turnout that is a vital part of the democratic process. And I'm here to urge the board to encourage robust voter participation in the upcoming District 4 special election in August. To do this, this board must ensure an equitable special election. It is because that democracy is at risk when voters do not participate that it is also personal to me when considering that these matters to me, as voters nationally, are deliberately alienated and excluded from our democratic processes of voting, particularly when it comes to special elections. And that will result in not only a low turnout, but we want to ensure representation for the 4th supervisory district. Voters warrant and deserve proper notice, as well as to have the San Diego Board of Supervisors be vested in moving forward with strategic solutions to ensure all voters have a chance to vote, in person and by mail. While residents may have the benefit of receiving varying communications about the August special election, please also consider San Diego's military families and including strategies which accommodate service members who may be voting from afar. As San Diego County is considered home for many veterans' military families, every voter warrants the opportunity to cast an informed vote. Not only do I urge the board to invest and encourage robust voter participation in the upcoming District 4 special election, to not only ensure an equitable and accessible voting process for all, it is also to go back to the beginning and also reprimand that comment about referencing hanging anybody. This is kind of example of what democracy.
Now hear from the next caller.
Good afternoon, Chair Vargas and County Board of Supervisors. My name is Gianna Giacalone, and my pronouns are she, her, hers. I'm a resident of District 4 and a volunteer at the ACLU. I'm here in support of item 29 to urge the board to encourage robust voter participation in the upcoming District 4 special election. To do this board must invest in election promotion via diverse media outlets. High voter turnout in special elections strengthens the democratic process. The Board of Supervisors has an obligation to its constituents to promote and encourage voter participation in the upcoming August special election. In addition to promoting the election in traditional media outlets, such as radio, newspapers, and television, the board must also invest in multi-language ads, ad placements in ethnic media, as well as streaming video, banners, Google Ads, Facebook, Instagram, YouTube, and other social media outlets. I know how important this would be to my community if they only knew this was happening and what it means. I've tried personally to tell all my friends and family in the community about the upcoming special election and its importance. But I, as an individual person, can only reach so many people. It is within this board's power to get the word out to residents of District 4 and ensure the election is representative of the people. The outreach needs to be comprehensive and creative, meaning we reach people through all different kinds of media in different languages and ensure that people from all backgrounds have access to the needed information. We want to see just how much you value democracy and voter participation in your actions today. I urge the board to invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time and consideration.
Thank you. Now hear from the next caller.
Hello, can you hear me?
Yes, please go ahead.
Testing. Thank you. Dr. Cyrus Barucha, resident of that District 3. I'm very concerned about the upcoming special election for the District 4 supervisor. The reason I'm concerned is that I'm an American, not a Soviet, not a Russian. I believe in true and fair elections, not sham elections with low voter turnout or other inequities. Elections pretending to reflect the will of the voters are not real. We need real elections in our country and in our county. To make this a real election, the board is obligated, we are obligated to invest in voter engagement efforts. Our constituents need to be aware and informed so that they can voice their views and participate with their votes. I urge the board to encourage and invest in robust voter participation for the upcoming District 4 special election. Let's ensure an equitable and accessible voting process, one that is worthy of our flag, our nation, and our values.
Thank you. Now hear from the next caller.
Sarah, what are you laughing at?
Hi, good afternoon, Chairwoman Vargas and County Board of Supervisors. My name is Maya Soto Gonzalez Hayden. My pronouns are she, her, ella. I am a District 2 resident and a member of the ACLU. I'm here today to express my support of item number 29 and urge the board to pass this because the position of power that you hold is so important. Listening to some of the agenda items today really shows me how much this elected Board of Supervisors cares and has the opportunity to invest in shaping the lives of every San Diegan. Myself, an immigrant, and an American citizen. I was able to vote for the first time and set that example for the rest of my family. Some of my family born here, some in Mexico. The power that we have to use in our votes really shows me how much it matters. And I ask that you please fund a comprehensive, nonpartisan voter education and engagement process. Listening to a bit of the presentation that was earlier provided, it does look like we have plans already to diversify our messaging, and would encourage the Office of Registrar also to transition some of your seasonal employees that provide these more diverse language opportunities that are reflective of the San Diego that we live in, to have full long-term positions. So we might need to look into providing future funding to secure their positions in the Office of Registrar, because their right to vote matters not only for this special election, but for all of our elections. These efforts will not only increase overall voter turnout, but also ensure that historically marginalized communities have a voice in shaping these communities that are our communities. Democracy is priceless. I urge the board to invest in...
Now hear from the next caller.
This is Truth, and I want to thank the people in the chamber who have to put up with the minions who call in. And I also want to apologize for the ignorance of those other callers. So for all the misguided, uneducated minions and people, this is a constitutional republic, not a democracy. Read Article 4, Section 4 of the Constitution of the United States of America. Quote, the United States shall guarantee to every state in this union a Republican form of government. End quote. Get educated, you idiots. I'm actually sick and tired of talking about disgraced narcissist Nathan Fletcher. He probably enjoys hearing people talk about him like he's actually important, when he was always nothing but a groom since birth by the lying Clintons and World Economic Forum minion. He's just another replaceable cog. I do, however, look forward to seeing which Spanish crap ends up hitting next after his fake rehab stunt is done being played out. Once a liar, always a liar. And that's for a perfect politician anywhere on earth. And that's also why, despite being an admitted cheater, Lorena ain't going nowhere, because criminals should be jailbirds flock together. So on May 2nd, Tara exposed her usual bias when she wanted racist, targeted voter outreach. And because of that discriminatory and illegal practice, as well as the use of the fraudulent vote center model that mails every registered voter a ballot to be used by anybody, and the fact that the register of voters engages in digital funny business, which is the complete opposite of the lies in this item's equity statement, Nora, and that black belt in voter fraud Michael Vu is well aware of. And after everything I continue to hear today, I still have no confidence in any supervisor or any special election. So hopefully we can hurry and end this useless $5.2 million discussion. Just input the numbers for Goldbeck and let's say we didn't. Lastly, I'll just say that if there's such a thing as microaggressions, then Nathan was a living example of macroaggression. He subjected everyone to his abuse in these chambers. None of you supervisors did it.
Thank you. And now hear from the final caller.
Hi, my name is John Monreal, and I live in District 4. Voter turnout is a vital part of the democratic process. I'm here today to urge the board to encourage robust voter participation in the upcoming District 4 special election. To do this, this board must invest in voting promotion. By investing in comprehensive promotional strategies, the county can reach historically underserved communities and provide election education to increase civic engagement. These efforts will not only increase overall voter turnout, they also ensure that historically marginalized communities have a voice in shaping our communities. And I do believe that voter education is very vital. Having neighbors that don't understand that they live in District 4 is very sad and unfortunate. So this is why we need to promote voter education. I urge the board to invest and encourage robust voter participation in the upcoming District 4 special election to ensure an equitable and accessible voting process. Thank you for your time and consideration. Thank you.
Thank you. And now hear from the next caller.
Good afternoon, Chairwoman Vargas and board members. My name's Rob Francis, and I live in District 2. I'm speaking to urge the board to ensure robust voter participation in the upcoming District 4 special election. To ensure voter turnout, the voter base needs to be engaged, as we've heard, and made aware of the special election. Now, given the nature of special elections, low voter turnout can occur, and this can be especially true for those who are most impacted by results. However, the board is being presented with an excellent opportunity to flip that narrative by investing in strategies such as nonpartisan voter education, utilizing diverse media outlets, and communication networks to get the word out. And I think we'd all be pleased with headlines praising a high voter turnout, and I think we know how to go about it. Investing in election outreach and promotion campaigns to increase civic engagement are a start. Beyond that, voter education and outreach are necessary to ensure all the community is part of the election. Strategically placed voting centers and ballot drop boxes can help with this as well. And so why does this matter to me? I'm out in the foothills of East County. Well, I'm a former high school civics and history teacher, and I mostly taught in lower socioeconomic urban areas. I went on to facilitate adult education programs such as ESL and American citizenship classes. And I know for certain that there are many folks who want to participate in this special election. I also know that sometimes language, chosen media, and general knowledge of the who, when, where, and how can prevent folks from doing so. It's a disservice to them, their families, as well as the broader community. We can make sure that doesn't play out in District 4 with your help. Thank you.
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
With that, I want to say again, thank you to our registrar, to all of our team for all this work, and for all of the participants today and all of the public comments that we received as well. Extremely, extremely important. So we have a motion. I'm happy to make a motion to support the special election. Is there a second? Second. We have a motion and a second. Supervisor Desmond?
Thank you, Chair. Cynthia, I had a question for you. You said there, I didn't catch what it was. You said there was something new being offered at this election, that it was going to be carried out from here on out. What was that? Do you remember?
Using all of our partners in the county. So our various county departments utilize numerous digital as well as paper newsletters, as well as social media, their separate social media accounts, where we could just amplify the message.
So that's new, and you're going to carry that out for every election going forward?
Yes.
Okay. Thank you.
Okay. We have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Okay. Thank you very much. We're going to go ahead and take a 5-minute break, a recess, and we'll be back. All right. The next item on the agenda is item 30th. It's the California Association of Counties at-Home Plan to Reduce Homelessness. I'm really happy to bring this item forward, but before I make my comments, I'm going to open it up for public comment first.
Thank you, Chairwoman Vargas. We have 6 requests to speak on this item, 3 in person and 3 requesting to speak by phone. I'll also note for the record that we received 3 e-comments, 2 in favor and 1 in opposition. Any members of the public that requested to speak by phone on item 30, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. All speakers are in opposition to this item. I'd like to invite forward Mark, Alan C., and Audra. If I've called your name, please come forward.
Alan C., yeah, just again, please look at what I sent out about the pallet homes, because that actually offered, Joe, that actually enforced you cannot do drugs, you cannot do alcohol, 90-day turnaround, and I'm pushing the Mayor McCann down in Chula Vista, let's make it 60-day, get a job, so it gives a sense of self-worth. Because Joe, again, that woman who came last week, she had 3 kids in tow, and she basically in and out 60, 90 days, she was in vouchers, and then she said, well, my time's in a voucher, and all you didn't help her, all you did is give her another voucher. That is not helping her. What about the 3 kids? We talked earlier about the teens and the crime and all that. What about the 3 kids? I reminded that earlier. So let's start looking at how we can actually turn it around. And again, that fentanyl, I'll keep saying it every time. You want to help? You can start right here and hit every supervisor throughout the state to push Gavin Newsom to outlaw fentanyl prescription drugs. And while you're at it, hit up Adderall, hit all the anxiety pills, because the last 2 shooters, they're on anxiety pills. 79% of shooters are on anxiety pills. What are we going to do to help our society? Your great-grandchildren, when they take over, what are we going to do for them? I yield back.
Next speaker, please.
Mark, first of all, they have no intention of helping homelessness. They're the ones causing homelessness. The cause of homelessness, the main cause, is inflation from the Federal Reserve and the bankers, just as the Founding Fathers stated would occur. And Andrew Jackson, that was his entire campaign, was to not let the bankers control interest and loans to our government. So if your kid, 5th grader, or you, happened to see this video, this YouTube title, from 6 minutes and 40 seconds for 17 minutes till 24 minutes, you will actually understand the Federal Reserve and how they're completely ripping you off. So they can't help homelessness. They admit that it's more people are becoming homeless than they can handle, but they won't tell you why or even come near stopping it. Also, you need to see this, the Corporation Nation. We're a subsidiary corporation here in San Diego. Every city and state is. There's a comprehensive annual financial report. They may have as much as 40 times as much money as the entire budget. So while these criminals up here are demanding more taxes from you and fees and permits, they have more money that they're keeping from you than you could possibly imagine. This is money that you've invested in. You, your parents, your grandparents. Technically, we the people own it. And if it were to be divided between all the American citizens, there would be no homeless. There would be no poor. There would be a really thriving society of people who own the means of production. But they have no intention of sharing it with you or even telling you about it. It's a total scam. All this is part of Agenda 21. They keep changing the name. Agenda 2030, sustainability, the Green New Deal. See this Rosa Corey video to understand that. And I'll see if I can find the big sheet, if I have time to hold it up here, and I don't. You guys need to see these videos. This is all a scam.
Next speaker, please.
What's he talking about, a scam? That's so crazy. Oh, man. A scam. You guys aren't engaged in scams. You never would do that. I think it's a little bit confusing because I think people are thinking that you're trying to help people not be homeless. But when you're saying like help homelessness, you mean help people become homeless, right? I just want to clarify. because I think it's a little confusing in there. And you know, you got your state initiative, and you want to do the whole federal, state, and local, right? Where we like play the same games, right? Because if we don't, then we don't get the money. And we have to have the money, Jim. You love money. I've been offering you 10 cents before and you didn't even take it. That's a waste of money, Jim. And I'm pretty sure it's like you guys love to have money in your buckets, right? Where does that money come from? I told you that before. Where does it come from, Jim? Where? The people, right? And so it's like, if you're really going to help people, right? It was like, you wouldn't just be creating just like something to, like, I'm gonna create a program to see if I can fix homelessness. I'm gonna create a program to see if I can figure out how to go to the bathroom. Like, that's where I feel like we're at. It's like, if I get this program, eventually I'm gonna know how to go to the bathroom, and eventually I'm gonna go use the bathroom. But until then, I'll just drink my sewer water and pretend I'm going to the bathroom. You know, it's just sad because, like, you guys think that, like, expanding data and, like, doing all of these things, like, just, like, pushing homeless people down the street helps. You waste our money, and it's very sad because people have faith in you. And they shouldn't, because all you guys do is make it worse. All while you pretend to say, we want to help you. You are helping. You're helping everything get worse. Thank you so much.
Thank you. We'll now hear from the individual that requested to speak by phone. Start with our first caller.
You mean one caller? It's truth. Hey, look, Paul Bonana's in the chambers. Okay, I will clarify. It's the county's framework to extend homelessness. The item says that California lacks a comprehensive plan to address homelessness effectively and equitably. But that's not true. Dancing San Diego Mayor Todd always sticks to his plan of sweeps right before Padres games. I do agree, though, when the item says, quote, current federal, state, and county-funded efforts create a patchwork of programs and responses that often do not work well together, end quote. One could argue they're actually working as planned, though, making things worse while sucking the people's money dry. But despite that admission, now the California State Association of Counties has proposed the at-home plan, which encourages counties to keep working with the federal and state government. Please tell me how that will help. The California State Association of Counties website says that at-home is in full throttle, as the state's constitutional deadline to pass the budget is on June 15th. Translation, act now or lose the opportunity for funding. Of course, CSAC is an unelected regional governance group who has partnered with NACO, who gave Nora her leadership training. And Nora is on CSAC's board of directors. So that's yet another conflict of interest today. This item does admit that this plan will expand data. As usual, homeless people keep having their personal information collected by government. Much like how all the stupid smart streetlight spy cameras are in East Village, homeless people are being used as government guinea pigs. At Home sounds like yet another program that will avoid accountability, transparency, real housing, outreach to communities affected, end up requiring mitigation, and destroy economic opportunity for all of us equitably. We don't want those stupid stack and packs. That's what I'm saying. Housing units across the spectrum, please. Everybody knows what that means, and we don't want it. It looks like prison block housing. Can't you figure that out? It's hideous. It should be a sardine and a...
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
Thank you. And so wanted to just share with folks that this is a really important initiative that we've been working on at CSAC. I am the delegate for the California State Association of Counties on behalf of the Board of Supervisors. So just to be clear, there's no conflict of interest. It's actually my job to serve on this committee and to represent as well. And Supervisor Anderson is my alternate. And so I wanted to share with all of you that I've taken this role very seriously and working together with our colleagues across the state, all 58 counties, and really being part of the homeless action team that was created at CSAC to really identify, how do we create a plan that's going to really address how we work together as cities and counties and unincorporated areas to bring additional funding from the federal, state, and local government to really partner up and implement a comprehensive plan to address our unsheltered population. This is something that we have been working on through rural, urban, and communities throughout the state, in suburban areas throughout the state. And At Home stands for accountability, transparency, housing, outreach, mitigation, and economic opportunity. This initiative really sends a clear message and a responsibility to the authority, resources, and flexibility for all levels of government as we're doing our work around this issue. And it really plans to integrate and expand data to improve programs' effectiveness, as well as strengthen safety net programs and ensuring that counties have resources to help families and individuals to really thrive. So the other component of it is that it really does focus on needed employment to address this issue, as well as opportunities for educational pathways for our unsheltered population. So I really would ask my colleagues to support this statewide initiative that could additionally bring resources to our county. With that, I'm happy to make a motion.
Second.
Thank you. Any additional comments? All right, please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors who are present voting aye.
All right, the next item is item 31, protecting children from cannabis poisoning. I'm going to turn it over to Supervisor Desmond, or would you like me? Yeah.
Thank you, Chair. Appreciate it. We brought this item forward primarily because the rates of children accidentally ingesting cannabis have skyrocketed in the recent years. In 2017, there were about 200 cases. In 2021, that number shot up to over 3,000 cases. Children as young as 2 years old have been hospitalized. It's not hard to see why children are attracted to this. This is a little packaging here of marijuana. It looks like kids font and lettering. But some more here as well. I bought these in Vista. I didn't, my staff did. But in Vista just recently, it's the packaging is bright. It imitates popular candy and includes Disney characters. So when marijuana was legalized in California, promises were made that products would not be marketed to children. AB 1207 holds cannabis manufacturers accountable to the promises that they made. AB 1207 is authored by Assemblywoman Irwin. She's a Democrat representing the California 42nd District, and it would prohibit cannabis or cannabis products that are attractive to children and advertising and marketing that is attractive to children. So I appreciate your support in supporting AB 1207 as it makes its way through the state process. So that's a motion. I'll move to approve item 31.
Second.
All right, public comment, please.
Thank you, Chairwoman Vargas. We have 13 requests to speak on this item, 3 in person and 10 requesting to speak by phone. Also note for the record that we received 14 e-comments, 12 of those in support. Any members of the public that requested to speak on item 31 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. All speakers are in opposition to this item. As a name is called, please come forward. I'd like to invite Alan C., Audra, and Mark. Ask you to please state your name for the audio record. You'll have 2 minutes to address the board.
Alan C. Yeah, I'm doing a little history correlation here, if you can bear with me. My mother died of cancer from cigarettes. Back in the 80s, the government actually did a settlement. She didn't get a dime. They did this huge settlement. The government got billions and billions of dollars. But you know what they didn't do? They didn't take out the nicotine. Fast forward to just today, you guys have this thing on opioids, the fentanyl settlement with all the Walgreens that went out of business in Frisco, which is actually the fault of the hospitals, not the Walgreens. Yet you didn't outlaw fentanyl. And now I'm looking at this one here, protect children from cannabis poisoning. Okay, that's a start. So we pretty much shut down the cigarettes because you can't smoke anywhere, but you're allowing people to smoke cannabis everywhere. And again, who's the biggest drug cartel? It's our own government. You get 5 times tax revenue. You see our society is being destroyed. So this is, actually, this should have been a green slip for me to actually say, yes, let's start now, but we need to take it all the way. Because you know what's happening to our society. You know how we're being destroyed. Again, 2,000 homeless people in the street right now. That's where the focus needs to be. Because it's not only them 2,000 people, but all the people living in the neighborhoods, the danger of the children walking across trying to get to school. Please consider, I yield back.
Next speaker, please.
Mark, of course, it's not good to advertise any kind of drug to children. However, that's kind of a moot point at this juncture because what these people, these supervisors are not telling you, and the Biden administration is not telling you, is that if you see this YouTube title, Goodbye American Sovereignty, Hello USMCA, the United States-Mexico-Canada agreement that replaced NAFTA, the trade agreement that Trump signed in 2018, Biden did not rescind, and neither side told you that Chapter 30, which you can see at 3 minutes, they'll tell you in this video, it's a short video, how to see Chapter 30, which hands over control of trade and immigration to a foreign unelected council with only one American member that is not elected. This is the beginning of you being the North American Union. That's the real reason Biden is bringing people into the country legally. It doesn't matter if they come in illegally or legally, that they just want to get rid of the border to make us all the one North American Union where there are no rights. And we are going bankrupt if you don't look at the other video I had on what this would tell you how they're going to make us go bankrupt. And we will. A mathematical certainty your fourth grader could figure out seeing this video in 15 minutes from 6 minutes and 40 seconds. Well, 17 minutes if you go all the way to 24 minutes, which would be preferable. So it's all a scam. They also did this, by the way, right after the Vietnam War. What most people can't remember now or don't know about is people were getting really, really smart back then. And colleges were saying, we don't want war. And they did understand that it was a business scam and that poor people from the southern states were winding up in the military being killed to make money for the elites. And that war was intentional to make money. And they were starting to retaliate, but they dumb down people with drugs. An influx of drugs is common every time they want to make a big change and take all your rights away, like right now.
Thank you. Next speaker, please.
You kicked me out. Don't make me start my time, Andrew. You can start my time before I get to the podium. It's not fair. It's very discriminatory. Just because I'm handicapped. Thanks. Would like to state for the record, what's so funny? Is that funny? You were abused by the sheriff. Funny, it's funny. I'd like to state for the record, Jim, that you bought drugs with our money. Can I have those? You didn't. Whose money did you use? Your money? So you didn't use the people's money to buy those. Whose was it? Yours? No. We're never gonna know, but Jim bought drugs. It's good. To, help the war on drugs. See, it's so weird because it's like 2-year-olds getting cannabis. Are they going into the stores and going, here's my ID, I'd like to buy some of that looks like Disney candy? Or are they getting it from their parents? Are their parents not responsible enough? And they're leaving that candy out? So then you want to punish everybody else who, I'm not saying kids need to be poisoned, but it's like, let's take responsibility for why that's happening. I mean, if you left a cup open and it's got alcohol in it and your kid drank it, are you going to be like, I cannot believe that liquor store sold that alcohol and it's got a fruity label on it and kids are drinking it? I mean, when are we going to take our own responsibility and be like, why are we leaving it up to you to make sure that the children don't put it in their hands? But then you guys want to sit here and you want to tax these companies. You can't have the best of both worlds. It's just like with the fentanyl. As long as we tell the kids it's out there, they won't use it. What? Or are you making sure that they do, that they find out where it is? Come on, Jim.
You make too much sense.
It's like, I mean, you're even buying drugs. So it's like, just to show us though, right? I mean, no one's gonna take those. Like, those are gonna be thrown in the trash. Are those going to go on exhibit somewhere? Like, I'm just curious.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Just drop it in my purse. I won't jump outside.
Good afternoon, Board of Supervisors and staff. My name is Casey Strang. I'm the Executive Director with the San Marcos Prevention Coalition. We wanted to thank Supervisor Desmond for his leadership in bringing forward this action to support AB 1207, known as the Cannabis Candy Child Safety Act. Supporters of legalizing marijuana promise voters a lot. Supporters told voters that if we legalize marijuana, marijuana products would not be marketed to our youth, and that if we legalize it and create a new legal market, we would keep marijuana products out of the hands of our youth. The reality of what we are seeing in our neighborhoods and our communities is that both these promises have not been kept. The marijuana industry has created turbocharged, high-potency candies, sodas, chips, and gum with bright colors and sweet flavors extremely appealing to our youth. These products can be delivered right to your doorstep, and no one is checking to see if the delivery drivers are verifying the ages of the customers. These kid-friendly products with high levels of THC are extremely harmful. There is clear science connecting high-potency THC pot products with psychosis. The Journal of American Medicine concluded that high-potency THC products were associated with a significant increase in addiction and mental health disorders. Our coalition wants you all to know that these kid-friendly marijuana products are in our middle and high schools. You may consider, at some point in time, asking the campus SROs or assistant principals in your district to see their box of confiscated items or photos they have taken. I think that you will find it very eye-opening. Thank you for your time and your leadership.
Thank you. Now hear from the next caller.
Good afternoon, Council, Board. Kathleen Lipatier. First, I want to thank Supervisor Desmond for bringing this discussion item forward. I hope the Board will unanimously support AB 1207, the Cannabis Candy Child Safety Act, to protect children from the accidental ingestion of marijuana products that appear like candy. These products were intentionally designed to mimic their favorite commercially sold candies. Research recognizes that adolescent exposure to marijuana primes the brain for addiction. Addiction specialist Dr. Ronit Lev, board-certified emergency and addiction medicine expert with over 25 years' experience treating addiction, reports that nearly every patient she's treated for fentanyl reported starting their drug journey with marijuana. 5 years of legal sales have failed to ensure Prop 64 voter promises be kept. The industry has opposed every reasonable piece of legislation designed to protect public health and safety by successfully lobbying state and local public electeds to support their industry and ignore the harms. I hope the Board will join Supervisor Desmond and the California chapter of American College of Emergency Physicians, the American Academy of Pediatrics, getting it right from the start, and over 40 substance abuse and public health organizations in supporting AB 1207. Thank you very much for letting me speak.
Thank you. We'll now hear from the next caller.
Good evening, Board of Supervisors. This is Peggy Walker. I'm a public health educator. I want to thank you, Superintendent Desmond, for bringing this forward. AB 1207 is extremely important to the welfare of children. And I think it's important to tell and share with you that California is another step closer today to passing a different but similar bill, AB 418, that would ban simple, popular candies such as Skittles and processed foods and drinks that contain chemicals linked to health issues. Likewise, there should be no reluctance to protecting innocent children from dangerous, kid-friendly, psychotropic marijuana products that can poison, cause seizures, cause heart failure, hospitalization, need for ventilation, and even death of small children. It's our moral and ethical responsibility to protect children from psychotropic products with far more devastating health risks and lethal harms than processed candies like normal Skittles. Anyone who says they want a credible marketplace must and should support AB 1207. The tobacco and alcohol industries are prohibited from manufacturing and selling products with child appeal or advertising and marketing specifically to kids. It should be no different with marijuana. Prop 64 promised to keep marijuana out of the hands of children, but this promise has failed. In fact, they entice children with kid-friendly products. We have a moral and ethical responsibility to put the well-being of our children first. I urge you to support this bill. Thank you.
Thank you. Now hear from the next caller.
Good evening, Chair Vargas and Supervisors. My name is Becky Rapp. I'm a concerned parent and public health educator. I'd like to thank Supervisor Desmond for placing this item on the agenda tonight, as it's crucial the county recognize and take action against the blatant disregard the marijuana industry has shown towards Prop 64 when promises were broken. Promises that the industry would not market and advertise their products to children. We're now seeing the devastating statistics that point to the harm these products are having on our children. The numbers are staggering. Many edibles come in the form of candies, cookies, brownies, and chocolate, products that all have a strong toddler appeal. Research has found that the packaging of some edible products can look identical to the real things such as Doritos, Nerds Rope, and Gushers candy. In 2020 alone, young child accidental exposure to marijuana accounted for more than 40% of all human poison exposure calls. According to Rady Children's Hospital, high THC products have serious consequences. They can become very sick and have problems walking, sitting, or breathing. According to the CDC, a large number of cases led to a significant increase in intensive care admissions. AB 1207 clarifies and prohibits all marijuana products that are attractive to young people. This will include not only colorful and sugary candy, but also flavored inhaled products such as vapes and waxes, popular among our teens. AB 1207 will create consistency with Proposition 31, which prohibited all flavored tobacco products. Please support AB 1207, sending a message that you support the original promises and intent of Prop 64.
Thank you. Now hear from the next caller.
Good evening, Board of Supervisors. Ann Riddle here. I came to show my support for AB 1207 and to thank Supervisor Desmond for bringing it forward. Several of our cities and several of our school boards have already sent in letters of support to Assemblyperson Jackie Irwin, and we ask this County Board of Supervisors to do likewise. I work with teens, and I know full well that flavored candy-like packaging that comes with e-cigs and edibles is attractive to them, and that it's done on purpose. The pot industry is as predatory as the tobacco industry. This has been a very difficult, hard bill to pass because the pot industry recognizes that young people are a profitable part of their customers and they don't want to lose them. The state PTA has taken a position of support because they too recognize the threat of these products to our young people and to their enticement. Prop 64 promised us that these products would not be designed to appeal to children or to our teens. I was sort of surprised when I looked at a product found on our campus that was called McFlurries. In a foil container, it looked like a Capri Sun, and on the bottom of the package was an M that was mysteriously identical to McDonald's. No one could tell us that that wasn't meant to be attractive to children and teens. This is our opportunity to show that we put our children first, and this Board of Supervisors recognize how valuable our young people are and support AB 1207. Thank you.
Thank you. Now hear from the next caller.
The truth My friend, Misinformation Minister Nora, I appreciate you. You even provided me the correct pronunciation of CSAC. Sack of crap you were not elected to, Nora. Now let me start again. Hello, this is Truth, and I'm calling on behalf of 360,000 members of the parent community. We would like to see $100 million invested in the Freedom Warriors Conservation Fund for underserved communities. But seriously, I knew this item would have your name on it, Jim, and even major staff by pot props. Wow. Just make sure, Jim, that you hold an audience raffle for those cannabis candies after this circus show's over. And Jim, you haven't spoken up to protect children from the increasing pot shops for the last 3 years. But now since Nathan's left the picture, all of a sudden, a couple of things the constituents want matters. Why is that? But I hope you and everyone else have been enjoying the hardcore dedicated marijuana callers. They're by far the most creative commenters. Only one topic to work from. That's very tough. So the item says that nearly 1/4 of children who eat marijuana edibles are admitted to the hospital. So it sounds like not that many children end up harmed, which is good. But it's clear that there are a lot of immature and irresponsible adults out there who are failing at being parents. Is it really that hard to keep the stupid pot brownies away from the children? And to further elaborate on immaturity of the modern adult, these cannabis ads that imitate Disney Plus commercials filled with cookies, candies, and fruity flavors aren't for children. No, they're really for childish adults, truth be told. And that's okay. I like all colors of desserts too. But Disney is evil and has always sucked because of its lack of creativity. But the point is that controlling and censoring billboards won't stop children from maybe trying cannabis edibles one day, especially if their parents enable the possibility. We don't need to repeat the anti-smoking propaganda campaigns. So thank you for allowing yourselves to...
Thank you. Chairwoman Vargas, that concludes public comment on this item.
If there's no additional comments, please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Okay, go ahead.
Chairwoman Vargas, before we move on to the next item, my apologies. I wanted to note that the previous item, item 28, included one recommendation that required 4 votes. I knew Supervisor Desmond stepped out briefly when the vote was called, but was present for the motion. So I want to give Supervisor Desmond an opportunity to record his vote on item 28.
And this is the Wi-Fi? You want me verbally, or you want to push a button?
Verbally is fine.
Aye, on item 28.
Thank you, thank you.
Thank you.
The record will reflect a unanimous vote for item 28. Thank you, Chairwoman Vargas.
You're welcome. Thank you. The next item is the adopting a resolution to support the addition of unincorporated area representation to the San Diego Association of Government Board of Directors. I want to thank Supervisor Anderson for leading the efforts to and asking me to co-sponsor this board letter. Before I turn it over for comments, I'm going to ask the public for comments first.
Thank you, Chairwoman Vargas. We have 8 requests to speak on this item, 5 in person and 3 requesting to speak by phone. I'll also note for the record that we received 13 e-comments, all of those in favor. Any members of the public that requested to speak on item 32 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item, followed by those in opposition. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'd like to invite forward Eileen Delaney and Robin Joy Maxon. I'll ask you to please state your name for the audio record. You'll have 2 minutes to address the board.
Thank you. Chair Vargas, she left, and supervisors. It's been a long day, so I will try to cut this as short as possible. I'm Eileen Delaney. I'm chair of the Fallbrook Planning Group. I'm here today representing them. 500,000 plus, residents call the unincorporated areas, rural communities, in San Diego County home. We need a SANDAG representative who knows firsthand the rural unincorporated areas' way of life and our lifestyle, and understands that planning for the future in these unincorporated areas should be different from that in urban cities, as well as they need to be sensitive to our rural lifestyle and community character. So I hope that you will pass the resolution today, and I hope that's short enough for you. Thank you.
Thank you. Next speaker, please.
I had to write a note.
I'm Robin Joy Maxson. I'm an elected official on the Remote and Community Planning Group, and I'm also an appointed member of the Social Services Advisory Board. The unincorporated community is grateful to the county for developing this resolution and for supporting unincorporated representation at Sandag on the Board of Directors. For too long, the wealth of cultures present in the unincorporated area have been invisible in the regional planning down at Sandag. Today's vote allows the 513,000 residents, effectively 1/6 of the population, to participate in the planning and funding of their community's future. Thank you, and I look forward to a positive outcome.
Thank you. I'd like to invite forward the speakers in opposition of this item, Mark, Audra, and Consuelo. If I've called your name, please come forward.
Mark, it's so ridiculous that these supervisors haven't even pointed out an extremely important thing about this measure, this resolution, which is that the representative of the unincorporated area won't even have a voting right. They're just trying to say that they've got someone there to listen to the concerns before they ignore them entirely, like everyone here that's not paid, that they ignore constantly, doing their Agenda 21 agenda, which Rosa Corey, who has incredible credentials. She's literally an expert court witness accepted by the Court of California in land use and property valuation. And everyone should see this YouTube video title to understand what these people are doing. They're going to do this no matter what. It's also a weighted vote. Most of you out there don't know this, but there's been a big concern anyway, because the whole thing is weighted toward the city and the rural areas that are mostly Republican. And by the way, I'm not for either side. Both sides are corrupt. But these people here are promoting Agenda 21 by the World Economic Forum and the United Nations as quickly as they possibly can. And none of you are paying attention as they take your sovereign rights away. They don't care at all about your sovereignty. And this video by Klaus Schwab, which I held up before, it's this YouTube title here. In a minute and a half of watching this, you can clearly see him saying that he's penetrated governments, including Justin Trudeau, half of the Canadian cabinet, the President Macron of France, Argentina, and now Nathan Fletcher here, and many hundreds, if not thousands, of other people in our government. This is treason. You're not paying attention, and this won't do any good. They're not going to listen to this.
Thank you. Next speaker, please.
Consuelo donated her time to me, so I just would like to let you guys know that. Oh, Andrew, you're so serious, you guys. We got to do business here. It's so serious. We're spending your guys' money here. Sandag. Joel, are you not on Sandag? Right? Is that not? Are you not unincorporated? Are you? No? So you don't count. Is it because you don't pay attention at the meetings? Probably, that makes sense. But yeah, it's like the whole Sandag thing. I mean, the way it's already been dictated, who's on that board is not representative of the people. It was like, we need to put this person in because they're going to push this agenda. They're not going to stand up for the people in the town where they're at and say that we don't want this 15-minute city or these, vehicle miles traveled tax. Right, so do you need somebody to represent the unincorporated that's going to push that and be like, yes, we need that. So if you want to go to San Diego, it's going to cost you $500 just one way. And if you can't afford that, then I'm sorry, you're just going to have to stay in your town, right? So whoever you're going to pick is going to be doing that. That's why, Nora, you're like, it's my job to be on all these boards. Of course, you guys have to incestually be in all of them. Otherwise, you wouldn't be able to do your whole plan, right? Because if you were on every board and being able to say all of these things need to go like this, then you guys wouldn't be able to, ruin everybody's lives so quickly, right? But it's good. It's good. Like you guys talk about you wanting to represent the unincorporated. Oh, Joel, why are you on that board then? I don't really understand. Can you not represent the unincorporated area on your own? Are you not sufficient? So we need to have somebody else come in? It's good. It's so ridiculous what you guys are doing, especially with this whole vehicle miles traveled tax. This is going to go in line with that. And we're just going to pay your miles traveled tax. It's going to be in the budget.
Thank you. Next speaker, please.
I'm speaking for Consuelo. Do you want me to?
You cannot. Thank you. Consuelo, final call. Okay. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Is this non-agenda public comment?
This is item 32.
Oh, yes. I'm sorry. Yes, I do wish to speak. Thank you. I will. Am I unmuted?
Yes, please go ahead.
Thank you. Good afternoon again, Board. I just want to say thank you for recognizing the need for representation of the unincorporated residents. I think that's so important, and I wholly validate and reiterate and echo the concerns that have been requesting this for a long time. So thank you. That's all.
Thank you. For the record, that speaker is Kathleen Lippett. We'll now hear from the next caller.
This is Truth, and Circus Vargas continues on. The truth about Sandag is that nobody there was elected by the people as a Sandag representative. It's run by Soviet stooge Hassani Krasa and propped up by the federal government. I completely disrupted Sandag and will continue to chip away at it. And I hope everyone will join me in that very fun endeavor. Sandag's advisory board includes Mexico and the U.S. Department of Defense. There's nothing Sandagan going on there. The county's already failed at properly representing the unincorporated areas like they're supposed to, Joel. So vehicle miles travel fees are a great example of that. So adding on another puppet will achieve nothing. Anyone that wants to know what Sandag's really about, just listen to this mashup of their UN Habitat meeting from February.
Build the great binational mega region that must be consolidated post-sustainable development provided by the United Nations 2030 agenda.
We're one economy, the low emission zone, digital transformation, certain levels of poverty and inequality, the goals that the United Nations won for the cities for the horizon of 2030. Guided through the 2030 agenda, creating once again a mechanism that would be in some ways supranational, where we'd have this binational association of government. For us, this is, as the name says, a laboratory. So first test is actually today, the first experiment.
That's right. United Nations Agenda 21, Agenda 2030 plan. The North American Union region revisited. Treason is what us Americans call it. It represents no American. And yeah, the weighted vote keeps the county and the city of San Diego in control of every other city. Yeah, I exposed you guys, and it's on YouTube. Anybody can watch this. And none of our representatives were invited there. Only people from Mexico. Sorry, but it's not hidden. Like I said, YouTube, UN Habitat, and
Chairwoman Vargas, that concludes public comment on this item.
Thank you. Supervisor Anderson.
Thank you, Madam Chair. First of all, thank you so much for joint authoring this letter with me. You know, one of the first things you did when you became chair here, but more importantly at Sandag, is that you focused on inclusion and equity for everybody. And what I'm asking for is that we have that same inclusion for the unincorporated. 500,000 people, in excess of 500,000 people, live in the unincorporated, yet we have 6 cities that have fewer than 50,000 people in them, and they all have a vote. Unincorporated doesn't have a seat at that table. Now, while our board is supposed to represent them, we may not live in the unincorporated, and yet we don't ask people in Del Mar to represent people in Chula Vista. So I think it's important that they at least have an advisory seat that's with somebody who lives in the unincorporated, who actually understands the unincorporated and the challenges. We know, and this board has been very, in fact, we did a board letter together Supervisor Lawson, Reber, and I did to bring internet through Sandag to the unincorporated. But how many of you all knew that we didn't have internet? I did, because that's my district, and we didn't have it. But who's to say the next supervisor is going to be in the unincorporated and actually understand what's going on there? There's no guarantees, and these people deserve a voice. And that's why I'm asking you today to help them have a voice. Now, on the advisory committee, yes, it's true they don't have a vote. But sometimes being in the table is very influential because you get to speak. We have tribal chairs there. They don't have a vote, but they are very influential because they represent their nations at our board meetings. We have Imperial County. They have a voice, but they don't even live in San Diego County. But because we know that they influence what happens here, that we give them a voice. And of course, Mexico's at the table. And again, they're not even in our country, let alone in our county. And yet we know that their influence plays an important role in how we move forward. So why would we ever want to leave 500,000 people and not include them? And I think that this is the definition of inclusion, by allowing them to have a voice independent of ours from people that actually live there. And, you know, we have a great example in LAFCO and how they elect people to LAFCO. They have a seat. The person has to go to all the special districts and get their support in order to be on LAFCO. And I'd like for the county to put that program together so we may present it to Sandag so that they, in a turnkey effort, be able to accept this position. But I've been to many parts of the unincorporated. I represented most of it when I served in the state senate, and I represent a large portion of it now, and you all have some, and Jim having the second, Supervisor Desmond having the second largest portion of it in terms of population. These people deserve a seat at the table, and I thank you all in advance for your good vote.
You're welcome. Thank you, Supervisor Anderson, for leading the efforts, and happy to support. And I do believe that there is, you know, we see from the port and some of the other entities, it's Caltrans, et cetera, they are able to provide opinions and or recommendations, and then we make the final decision. So it works out really well. And anytime that we can increase representation in our unincorporated areas, I think is really important. And I have a small population of unincorporated as well, but happy to support this. So with that, I'm assuming you're making a motion?
Yes, sir. Please, I absolutely make the motion. And I want to just say that your small population, while it's small, it's powerful and strong. So
Exactly.
They're going to have a voice.
Bonita and Spring Valley and Lincoln Acres. So with that, I'm happy to make happy to second the motion. Supervisor Desmond.
I just want to say I happen to represent the largest landmass of the unincorporated area in the entire county. And unfortunately, I'm not back on Sandag, but I happen to represent that district as well.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
The next item on the agenda is item 34, to adopt an ordinance establishing the creation of a workplace justice fund. And so this is I'm going to hand it over to county team for the presentation.
Good afternoon, or good evening, Chairwoman Vargas and members of the board. Within the Office of Labor Standards Enforcement, or as others refer to us as OLSE, our primary focus is to serve as the central location for education and resources for employers and workers, pursue additional enforcement measures to protect workers, and undertake research and data analysis regarding workplace justice matters impacting workers. With this in mind, OLSE quickly adopted this as our overview and foundation of our department. Now, on May 4th, 2021, the board directed the Chief Administrative Officer to create OLSE with 7 fundamental foundations in mind. One of the foundations requested was to explore the creation of a fund that would provide workers seeking justice on a workplace issue with resources and assistance. To fulfill this framework created by the board to develop a workplace justice fund, OLSE worked with our community stakeholders in the Fair Workplace Collaborative, comprised of 21 community stakeholders who met monthly for over the past year. In addition to working monthly with our Fair Workplace Collaborative group, our office also partners and meets monthly with the District Attorney's Workplace Justice Unit to ensure collaborative efforts of enforcement and education and outreach are established between the two departments. And we are honored to have District Attorney Summer Steffen's letter of support of the Workplace Justice Fund ordinance in which your board is considering today. Now, OLSE has developed parameters for the first of its kind Workplace Justice Fund that can both help workers who did everything right but were never paid by their employer, and secondarily operate to protect workers from retaliation who come forward and raise the complaint with OLSE and face retaliation because they made a complaint. Now, why do we need a Workplace Justice Fund? Let's start with the primary function of the Workplace Justice Fund, which is helping workers recover wages after winning their case with the Labor Commissioner and never being paid by their employer. Now, as a frame of reference, when a worker files a wage claim with the Labor Commissioner, it means a worker has alleged they have not been paid for wages owed to them by their employer. Now, the first step after a worker files a complaint is the Labor Commissioner's office holds a settlement conference with the employer. If the claim isn't settled, a Deputy Commissioner holds a hearing. And if the Labor Commissioner decides the employer owes the worker wages and the employer doesn't pay or appeal the decision, that debt becomes a judgment filed in court and remains unpaid until it is satisfied. In general, workers are directed to collect these debts on their own, like any other creditor might, which can be a very large barrier to many workers, especially lower-income workers. The reality for workers who are victims of wage theft is not that simple. First, it may take several years for the worker to even have their case heard and decided by the Labor Commissioner, which is much more than the statutory required 120 days to have a hearing date. And even if the worker does win the case, many workers are never paid by the employer. In San Diego County, since 2017, there are over $13 million of unpaid wage theft judgments impacting nearly 1,000 workers. Now, we know that few workers who win wage judgments are able to collect their money. California issued $32.7 million worth of wage judgments to more than 1,800 employers in the year 2017. 5 years later, 1 in 7 of the debts were recorded as satisfied. An analysis of 5 years of the agency's public data through 2017 through 2021 has revealed that nearly 3/4 of the workers were recorded as receiving no payment. This is the problem faced by nearly 1,000 workers in our county who are the victims of wage theft and have never been paid by their employer, even after prevailing in their case. Now, in developing the Workplace Justice Fund, also engaged with both worker and employer stakeholders and met with other government labor enforcement agencies, including the California Labor Commissioner and the Oregon Bureau of Labor Industries. Also engaged an academic expert of employment law at Harvard Law, and separately the National Employment Law Project. While the State Labor Commissioner's office primarily enforces workers' rights, there's still an unmet need with helping workers actually collect the wages owed to them even after they've prevailed. As I mentioned before, only 1 in 7 employers who were issued court judgments in wage claim cases in 2017 have paid their workers the full amount of those claims even 5 years later. The state directs workers to collect these wages owed to them on their own through a lien, like any other creditor might, and often this leaves constituents further confused at the process of what comes next and without many answers. This innovative program will lend itself in unison and collaboration with the state and other jurisdictions to continue to sustain this new model. This will be a stepping stone in helping address and mitigate the issues at hand, as well as educating constituents through the process on how to collect the wages they are owed. Now, the following slide currently displays unpaid judgments filed by the San Diego Superior Court by the Labor Commissioner throughout our county from the years 2017 through 2022 using the defendant employer's address. Behind every unpaid wage theft judgment is an individual worker who did everything right and was not paid by their employer even after taking the time to file a complaint and wait several years and still was never paid. The question becomes, is there a better way to help workers in our county who are the victims of wage theft while also holding the defendant employers accountable? So what are the Workplace Justice Fund models proposed today? First of the two is the restitution model, which will help victims of wage theft who are unable to collect their judgment from their former employer. This would benefit workers with unpaid wage theft judgments, generally in low-wage occupations in San Diego County. The mechanics of the restitution aspect of the Workplace Justice Fund are described as follows. An eligible employee must be all the following. They were a County of San Diego resident or a worker of an employer doing business in the county. They're a prevailing party in a wage theft case against their employer beginning in May of 2020. And the Labor Commissioner judgment originated from the San Diego Superior Court, and the worker was never able to recover any money from the employer despite multiple attempts. The worker will file a claim with Allstate to request payment of the judgment. Allstate will investigate the claim to determine eligibility criteria is met. The worker will assign the entire judgment to the county. The county will pays up to $3,000 of the judgment, or lower if the judgment is less, to the worker. The county will issue the appropriate 1099 tax form. And then the Office of Revenue and Recovery, the designated collection agency for the County of San Diego and a division of the Auditor and Controller Department, is responsible for the management, collections, and accounting of receivables owed to the county for a variety of programs and services, will attempt to collect the assigned judgment from the employer. Any funds recovered in excess of the amount the county paid the claimant will be returned to the claimant minus the Office of Revenue and Recovery's fee of 35%. If the claimant successfully recovers the full judgment independent of the county, they would be required to pay the county back. It would operate similar to the Oregon Bureau of Labor Industries Fund or the State of California's Car Wash Restitution Fund. Now, the second component of the Workplace Justice Fund is a retaliation model workplace justice fund that would operate as a resource for workers who file a complaint with Allstate and then experience retaliation that reduces their pay. Now, who would benefit? A retaliation fund would help workers who want to report alleged violations regarding an ordinance that Allstate enforces without bearing all of the financial risk of coming forward to report a violation. The National Employment Law Project recently commissioned a study to conduct a survey of 1,000 adults in California's workforce to measure the rates at which workers experience retaliation. Survey responses revealed a high prevalence of workplace violation, low rates of violation reporting, and high rates of employer retaliation. As noted in their letter of support for this item by our partners at the National Employment Law Project, by providing quick and meaningful financial support to workers when they need it most, our retaliation fund can make it easier for workers to report wage theft and pursue their cases until fruition. In doing so, end quote, this fund will help fill the urgent gap in the current enforcement landscape that forces workers to remain silent or risk everything by speaking up, end quote. The ultimate goal of the secondary component of the fund is to protect a worker who files a complaint with Allstate, but the worker is terminated because they filed that complaint. Now, accordingly, the mechanics of the retaliation aspect of the Workplace Justice Fund are described as follows. It applies only to complaints related to ordinances that Allstate enforces. The covered worker must file a complaint with Allstate, and subsequently, the worker suffers an adverse employment action or retaliation for filing the complaint. Allstate will investigate both the original complaint and the retaliation claim. If Allstate substantiates a claim of retaliation, it provides the complainant up to a $4,000 lump sum payment to assist in their transition. The county will issue the appropriate tax forms to the worker. And if Allstate substantiates the allegation of retaliation, Allstate may file a complaint against the employer for the underlying violation of the ordinance and the retaliation committed against the worker because they came forward to Allstate. An employer would receive the opportunity to defend against the complaint, including having the case heard by an independent hearing officer, and subsequently a new trial de novo if the employer appeals the decision of the independent hearing officer. Allstate will further provide educational support to constituents facing retaliation on what other services the county offers and how they may qualify for such programs as CalFresh, CalWorks, the county library's GED and broadband programs, and many more. Today's request is for the board to receive today's presentation relating to the Workplace Justice Fund and request the board consider the introduction of an ordinance creating a Workplace Justice Fund that combines the retaliation restitution models. If the board takes actions as recommended, then on June 13th, 2023, the ordinance will be brought back for consideration and adoption, as well as authorize Allstate to administer the fund, place $100,000 in the fund, and direct the CAO to report back to the board with an update within 120 days, working with the Office of Evaluation, Performance, and Analytics to identify the benefits to families and the potential economic impact to the county, including reporting on future sustainability short, mid, and long-term goals for the program. Chairwoman Vargas and members of the board, this concludes my presentation, subject to your questions.
Thank you. Public comment.
Thank you, Chairwoman Vargas. We have 13 requests to speak on this item, 9 in person and 4 requesting to speak by phone. Also note for the record that we received 95 e-comments, 83 in favor, 3 in opposition, and 3 neutral. I'll also note that we have 1 individual that registered their support but did not wish to address the board. Any members of the public that requested to speak on item 34 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item. As your name is called, please come forward and stand against east wall under the murals until it is your turn to speak. I'd like to invite forward Nate Woolman, Nathaniel Tate, Javier Senatiza, Jesse Garcia, and Norma Penaloza. Also like to invite forward Alor Calderon, Habib Hasbini, and Jorge Viramontes. I've called your name, please come forward. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Good afternoon, board. My name is Nathaniel Tate. I am with the Center on Policy Initiatives, and I am in support of creating this fund. And as a former hospitality worker, I know what it's like to experience wage theft. There was a time where I did experience it. I went to my chef, I went to HR and told them, hey, my hours look wrong, so my paycheck looks wrong. Also, I don't have the right amount of time just for overtime, and they did nothing about it, kind of gave me a warning. And so from there, I just didn't report any wage theft because I didn't want to deal with any retaliation. But unlike 10 years ago, the Office of Labor Standard and Enforcement now exists. And thanks to you all's efforts and you all's leadership, we can now help protect hourly low-wage workers. And so getting the money that they are owed is really important because it helps them to not only pay their bills, but also pay for food. And if they have children, then it makes it that much more important why they need the wages just that they are owed. And as Brandon had pointed out, it's very hard to file a wage theft claim, and it's even harder to actually get the money. And so that is why I urge you all to approve this Workplace Justice Fund with at least $100,000 allocated to start the fund. So let's go ahead and help those workers who have been victimized and unable to get their stolen wages back. Thank you for your time.
Thank you. Next speaker, please.
Good afternoon, Chair Vargas, County Board of Supervisors. My name is Jesse Garcia. I'm a representative of Carpenters Local 619. The Carpenters encourage your support to the adoption of the proposal of the creation of the Workplace Justice Fund. The same way we have safety and security here today because of the presence of law enforcement, thank you. We need that same presence, enforcement on all our county-owned properties and ensure equity for responsible contractors and workers. This item will do just that. The Carpenters are extremely supportive of today's actions and urge your consideration to move this item forward. Thank you.
Thank you. Next speaker, please.
Hola, mi nombre es Norma Peñalosa.
And hello, my name is Norma Peñalosa.
Y soy investigadora de campo en el Fondo de Fideicomiso de Cooperación en Mantenimiento.
Okay, so I'm a field investigator, and this is for the trust of the Corporation of Maintenance that is known as MCTF.
Yes.
Okay.
Gracias por darme el permiso de hablar el día de hoy.
And thank you for allowing me to talk today.
El tema de discusión es muy importante para nuestra organización. Por más de 20 años hemos abogado por los conserjes sin sindicato por el estado de California y el condado de San Diego.
And I think, that talking, is very important, when we can have the talk, because it's very important for the organization that we have for over 20 years, and we have supported, our staff without a union.
La señora Laureana Portela fue una víctima de robo de salario en el 2011 y todavía sigue esperando que se le pague.
Okay. Mrs. Laureana Portelio, she was the victim of robbery of her salary in 2011, and up to today, she's still waiting to get paid for that.
En el 2011, la señora Laureana trabajaba como conserje en Albertsons en Escondido.
Okay, she worked as a staff member in 2011 in Albertsons, the one in Escondido.
El contratista RM Quality Maintenance robó miles de dólares y se rehusaron a pagar la cantidad que se le debía.
And it was MR Quality Maintenance. They stole thousands and thousands of dollars, and they refused to pay the amount of money that was owed.
Y como el caso de ella, conocemos muchos casos iguales de trabajadores.
Okay. And as not only with her case, we also know many cases like hers, you know, of workers that have suffered from that.
El robo de sueldo es un problema grande en la industria de la limpieza.
Okay. Stealing a salary is something that is very common. It's, you know, something that happens in the field of maintenance.
Uno de los retos más grandes que enfrentamos como organización sin fines de lucro es poder asegurar que los fallos se paguen después de recibir una decisión favorable.
And one of the things that we suffer, you know, when we don't have any type of rewards, is this that we're talking about, which is, you know, the lack of not getting our salary correctly.
Hasta el momento conocemos múltiples casos que en total se les debe más de $100,000 de fallos que no se le ha pagado a los trabajadores.
Up to now, we know thousands of cases, you know, that workers have not been paid, and this is like over $100,000 now.
Y estos son solamente casos que se han reportado a la organización de MCTF.
And these cases that I'm talking about are only the ones that have been reported to MCTF.
Por eso sugerimos que apoyen el Fondo de Justicia para los Trabajadores.
Okay. And this is why we really go ahead and we like to tell you that we really would like you to support, you know, this fund for the workers.
Esto dará a la Oficina de Estándares Laborales y Enforzamiento del Condado de San Diego.
This will make, you know, the enforcement of standards for workers here in the County of San Diego.
El poder dar a trabajadores que han recibido fallos a su favor de parte del Comisionado de Labor.
And this is, you know, will give workers the fact that they have been giving, you know, it has been given to their advantage, you know, from the working committee.
Thank you.
Thank you.
And thank you.
Next speaker, please.
Chair Vargas, County Supervisors, good afternoon. My name is Jorge Viramontes. I'm a proud representative for the Carpenters Local 61 here in San Diego. I am here in full support of the workplace justice funding. We need to do what's right for our local workforce. This is the first step for our local workforce. Currently in downtown San Diego, there's 2 job sites where wage theft and worker exploitation is happening. Right over off of 5th Avenue, the ACS Hotel. They brought out-of-state workers and were getting paid cash and being exploited. Over on 16th Street, JPI, subcontract whole wood framing. They still haven't paid 12 of their carpenters, 12 of their workers their wages. This is unacceptable. And that's why we're 100% behind this funding. Hopefully it'll go through, which it will go through. We need this. Why? With my job, I have the opportunity to sit down with the blue-collar worker, with these workers that are getting exploited. I sit down with them in their house. They explain it to me. We need justice like this. We need this funding to get this started because there's nothing more heartbreaking than seeing a grown man almost in tears. If you're going to work hard, you deserve to get paid and not get screwed out of it. Thank you very much, and we're 100% in full support of this. Thank you. Have a good night.
Next speaker, please.
Good evening, Supervisors. My name is Alor Calderon. I'm the Director of the Employer Rights Center. And we're in full support of this Workplace Justice Fund. In your county, there is a wage theft crisis, and I want to concentrate on something you haven't heard so much, which is in the crisis that no wages brings to the families and to the community. We receive thousands of calls a year, and many of those are non-payment of wages. Half of my check unpaid for months. But what they really want to talk about is
how am I going to pay rent now? I always said that I'm going to still have to delay getting the right medication for my family, because unless I get these wages, then the family cannot be healthy. I cannot tell you how many mothers come to the center and want to participate and want to serve in the community because they're thinking that's a way that they can get closer to getting justice at work. There are way too many of these stories and way too many crises happening, family by family, community by community, because there are thousands of employers that haven't had the message from you that in this county, if you submit a claim and if you win your case, you will get that money. And it doesn't happen. Just in 2022, 3,000 families submitted a claim to the Labor Commissioner, just in 1 year. And that's nothing compared to the ones who do not know about the Labor Commissioner or do not know about this, who acquiesce and do nothing. We urge you to take this first step in bringing some justice to these families who not only are hardworking, but do everything right to get those wages that they already deserve. Thank you.
I'd like to invite forward the Speaker in Opposition, Audra. Also a final call for Javier Santiza, Habib Hasbini, and Nate Woolman.
Yeah. I don't know. I think we should really talk about all the workers that had to lose their jobs because of the COVID BS that you guys put down on people. And so it's like, you know, I'm not saying that anybody is more deserving than anyone, but you leave a whole group of people out that you forced out of their jobs into that realm of going, how am I going to pay for my family? How am I going to eat? And they don't have anything. It's like you guys create, it's like there's all of these things created, like you can go to the union if you need help. You can go to the EEOC, you can come over to here and we'll help you out. But you gotta like jump through all these hoops to do it. And instead of like back in the day, if like someone took something from you, you're like now like, okay, Jim, if you want your tie back, you're gonna have to go to the Labor Commission. And you're gonna have to go over here and talk to these people, and they're gonna let you know whether or not you can do something about it. When is like back in the day, people would do what Gonzalez does and just go beat somebody up, right? And just go get it back. But it's like all of this things that we do, it's like you gotta go ask somebody just for permission to like get something that you're deserving of. And it's like, it doesn't make any sense to me why we do that when these people aren't even there to help you. They're the ones telling you, sorry, that's actually, we don't consider that retaliation. Just like the sheriff doesn't consider me being beaten out in the hallway abuse. So it's like we go to these people and we're like, is that? And they're like, no, it isn't. So I'm sorry, there's nothing you can do about it. Like, is that not a problem? Like, is the world not upside down to you? You think that it's right side up? Where like stuff like that happens, it's like you go to the sheriff and you're like, hey, you gonna do something for me? No, I'm sorry. It's not illegal what happened. So that basically means I could go do the exact same thing to Gonzalez, right? And nothing will happen.
Thank you. Now hear from the individuals that requested to speak by phone.
It's truth. If it's true that no one deserves to be screwed out of their hard-earned pay, then can someone please explain the IRS? Oh, man. Here we have an ordinance creating a workplace justice fund that combines the retaliation and restitution models with $100,000 in the fund. Why only $100,000? Who's that going to help exactly? And how can any of you supervisors pretend to care about workplace justice when all of you engaged in injustice with the fraudulent COVID emergency declaration and then demanded that every county worker get the emergency use COVID clot shot that's resulted in countless deaths, and if they didn't, then they lost their jobs. Where was their workplace justice? You guys didn't care about their financial losses. Where's their financial backstop as victims of retaliation or wage theft? Or how about the people who went along to get along and became permanently injured from the clot shots, or worse, are dead now. No, instead it was the county. That's who was the one who took unjust retaliatory measures against public employees. It doesn't matter if they worked as a firefighter, a paramedic, an EMT, or just a regular pencil-pushing, keyboard-typing county minion. Their lives were upended and ruined. So how is anyone to trust that there could ever be workplace justice if the county has anything to do with it? What a sick joke. And I don't know why you guys want to keep giving me a reason to talk about the 3 years ago fraudulent emergency again. You really want to hear Wizard of Oz clips? Because I can find them. But seriously, I see this underfunded and useless workplace justice fund to be complete hypocrisy by the county. Just business as usual. And that's why I have to say no, because I can't stand hypocrisy and lies.
Yes! That's all they got.
Chairwoman Vargas, that concludes public comment on this item.
Thank you. Thank you to all the speakers that joined us today as well. I'm happy to make a motion to support this item, and I want to say thank you to the OLSCE team for all the work and putting this together. Obviously, there's a lot of work to be done in this area as well, but this proposal, I think, finds a new way for workers in our county who did everything right, to be able to, and never got paid by employers, even after prevailing their case, that they have an opportunity to really get justice. And so I think it can really impact have a real positive impact, not only on workers and their lives, but also businesses, and having a conversation with them about what the rules are and ensuring that they are paying folks. There's a lot of data that is out there about exactly what the impact is in our communities, especially when there's loss of wages, and some of the folks today who participate in public comment shared some of those. But I also think it's really important to share that, and why I think the education component is so important is that there are so many victims of wage theft and that have suffered great losses, that because of language and or not understanding the system and or just being scared of retaliation, I think sometimes are afraid to come forth, especially even if the law has been broken. And so the burden is placed on the employees to seek the justice in recovering the wages, and they're often left with a solution. So I am very appreciative of this work, and like I said, I hope that education on worker-place rights should be one of the top priorities with this initiative as well as surrounding and letting businesses know the law surrounding wage theft, and it's imperative. I think it's a first step to reduce violations of workers' rights. And so with that, like I said, I'm happy to make a motion. And then, is there a second? Oh, there you go. We have a second. We have a motion and a second. And Vice Chair Lawson-Mima?
Yeah. First of all, thank you. Thank you for the team for all your work developing this program, but also thank you for all the community partners who are here today. You all advocated for this, you called for this, you identified the huge crisis we face in terms of wage theft in our region and our county. And I'm just very proud that we as a board and we as a county have been able to respond to what you've put out there as a real and urgent need. The idea that someone shows up for work, works hard all day, many days, days in, day out, and then doesn't get paid. It is unjust. It is unjust and unconscionable. It is wrong. And I think we are going to be doing our part here in San Diego County to fight back and to make sure that workers get treated fairly and justly and get paid appropriately for a hard day's work. So,
Vice Chair. Sir, this is your third warning now. This is your third warning. And so you keep disrupting the meeting. You continue to have these outbursts. If you'd like to continue, I need you to please be, conduct yourself in a proper manner. All right, Consuelo, this is your third warning. Please exit the room. Please exit. Consuelo, can you let... All right. Can you make sure? Okay, we're going to take a break. I'm going to ask Consuelo to leave, and also the gentleman with the white hat. And we'll come back. please exit the chambers for the two people.
You're talking about
We resume the meeting. Go ahead, Vice Chair.
Thank you. Just to conclude my comments, I'm very excited to support this item. I think it's a really important step forward of San Diego beginning to lead the state on how to ensure that there's equity and justice for folks who work hard in our region and need to get paid for the work that they do. So thank you for that, and thank you for all of the folks who came here today to raise your voice, but also for all the work that you've given and participated over the last many, many months in driving this forward.
All right, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors who are present voting aye.
Thank you again to everyone and to the team as well for all their work. All right, next item is item 35. Item 35 and FP2 is the Fire Protection District Item 2, Fiscal Year 2023, Third Quarter Operational Plan Status Report and Budget Adjustments. I think we have a presentation. Yes? All right.
Good evening, Chairwoman Vargas and members of the board. I'm here today to give an update on economic conditions with a look at key indicators, including the state budget, an update on fiscal year-to-date performance of the retirement system, budget performance, and operating results through March 31st. And I'm joined today by Amy Thompson, the Health and Human Services Agency Executive Finance Director, who will provide an update on COVID finance spending, including an update on FEMA reimbursements, which may impact the current year operating results and our projected balance sheet for the general fund. We'll start by talking about several economic indicators with our local unemployment. There were 59,400 unemployed as of March, with an unemployment rate of 3.7%, which held steady for the third consecutive month. The unemployment rate has essentially recovered from the pandemic, but as inflation pressure persists, along with the Federal Reserve's response to hike the federal fund rate to control inflation, it's anticipated that the unemployment rate may start to rise as the economy slows. And as Congress and the White House continue failed efforts to reach an agreement on the federal debt ceiling, the risk for further economic uncertainty, including unemployment and market volatility, rise as Treasury comes nearer to the risk of running out of cash as early as next month. Earlier this month, the Fed increased rates by 1/4 point. This was the 10th interest rate hike, resulting in an overall increase of 5 percentage points in a little over a year. As the Fed fund rates rise, interest rates, including mortgage rates, will follow. In the first week of this month, the 30-year fixed rate mortgage was at about 6.4%, which is an increase of 3 percentage points from the first Fed rate hike in March of 2022. So with this, let's take a look at housing activity here in San Diego. So housing affordability, of course, continues to be a significant challenge here in San Diego. And as you can see, the median home price table on the left, the change in home prices has significantly increased over the last few years, peaking in 2022 at $975,000 before declining after interest rates began to rise, hitting a low earlier this year, but prices again are on the uptick due to a lack of homes that are available for sale. That decline in sales activity is depicted in the chart on the right, and as of March, year-over-year local sales activity is about 30% lower than it was last year. The Office of Financial Planning works really closely with our local assessor, recorder, county clerk to monitor the housing market and potential implications to our local property tax base. Looking at our local economy, the inflation rate for San Diego is at 5.3% over the last year, and this increase was influenced significantly by higher prices for shelter, but also food and utilities. The inflation rate has slowly been on a decline since November, but is still high compared to the 2% target of the Fed. The Federal Reserve will continue to monitor inflation and remain strongly committed to bringing it down to the 2% goal, which is evidence as we've seen through the series of hikes over the last several months. The Fed has hinted that it may pause the interest rate increases as soon as its June meeting, but that determination will be made meeting by meeting based on the totality of the incoming data and the implications for the outlook on economic activity and inflation. With the recent release of the revised state budget, we have a better idea of how the state plans to navigate potential economic uncertainty. In January, the proposed state budget reflected a $22 billion deficit. In the May revise, the state budget now reflects an additional $9 billion on top of that, totaling nearly a $32 billion deficit for 23-24. The May revision proposes to resolve the shortfall through a series of spending reductions, trigger cuts, and delays or deferrals of spending that was authorized in earlier years, as well as through internal borrowing and fund shifts. But despite this growing shortfall, the governor's revised budget manages to preserve investments in homelessness, housing, healthcare, and mental health, climate, and public safety. And just for context, about half of the county's revenue historically comes from state and federal sources, and our Office of Economic Development and Governmental Affairs is currently working on a memo that outlines the impacts from the counties to the county from the state budget, and we expect that that report will be out later this week. This slide depicts historical performance of the SD Sarah Fund over the last 10 years. Through April, the fund experienced returns of 7.6%. This is good news. However, we remain cautiously optimistic with 3 months of earnings remaining before we can say with confidence that the fund has met its targeted earnings of 6.5%. We will continue to monitor performance of the fund closely and incorporate final results into our long-term financial planning activities. Before I transition on to updates on the third quarter budget status report, I'd like to invite Amy Thompson, the Executive Finance Director of the Health and Human Services Agency, to briefly provide an update on COVID-19 spending and anticipated reimbursement from FEMA.
Thank you, Ebony. So the county's current spend rate for the COVID-19 response is at about $300,000 per week. This is a decrease of $400,000 from the last report to your board in February when the weekly spend was at $700,000. This reflects both the planned demobilization efforts and decreased need, consistent with the end of the county public health emergency on February 28th, as well as a transition of some costs to available public health grant funding as we work to incorporate certain activities into our ongoing public health operations. The majority of costs reflected on the slide are under T3 and largely for trace activities. Surveillance continues for testing, case counts, hospitalizations, deaths, and vaccinations. Outbreak investigations also continue in high-risk settings. Prior to May 11th, roughly half of our weekly spend costs were being funded through ARPA and the other half through FEMA. With the end of FEMA eligibility on May 11th, ARPA will provide funding for ongoing efforts into the next year as needed. So on the next slide, I will review the current status of FEMA claims. So as you will hear from Ebony in the upcoming third quarter results, FEMA is driving a significant negative fund balance position for the agency. Our third quarter projections assume total costs of $423 million from the beginning of the pandemic through May 11th earlier this month when FEMA eligibility ended. The $423 million includes just over $400 million of costs incurred through fiscal year 21-22, and the estimated remaining balance of $20 million is for the current fiscal year. We have 12 projects estimated at $198 million that have been obligated or approved by FEMA. After accounting for these amounts already approved, a balance of $225 million remains. Our quarter 3 projections assume another $35 million will be obligated in time to record for the current fiscal year 22-23 financial statements, and that the remaining $190 million will be deferred to future years. So this deferral is $89 million higher than what was used to prepare our second quarter results. At that time, we were projecting to defer just over $100 million. One of the biggest changes in assumptions from second quarter is timing of payment for our non-congregate sheltering project. This is one of our largest FEMA claims at over $100 million. Our third quarter projections no longer assume we will receive payment in time to accrue for this current fiscal year. The agency has been coordinating closely with the county's Office of Emergency Services and working with Cal OES and FEMA representatives to try and move the review of this project forward. Also, through our Office of Economic Development and Government Affairs, we have been advocating at the federal level, including a letter signed by the chairwoman. Additionally, we know that the final FEMA closeout could take several years. FEMA withholds 10% for all projects until closeout is complete. So the $190 million projected to defer accounts for this 10% withhold as well. Amounts received in future years will generate fund balance in the year those reimbursements are received. I'll now turn it back over to Ebony to discuss third quarter results overall.
Amy, thank you so much for that important update. The changes in amounts anticipated to be received from FEMA have had a material impact on our projected year-end results in comparison to our last update in the second quarter. In the third quarter, the county is projecting positive results from budget for all funds of $116 million. All of these variances are a small fraction of the county's total budget at 1.2%. Focusing on this slide, the chart shows the anticipated sources of fund balance in the general fund by business group, and as you can see in this chart, all groups reflect an overall positive variance of fund balance, except, as Amy mentioned, the Health and Human Services Agency, which includes the anticipated FEMA deferrals as well as the Innovative Housing Trust Fund. This will be covered by an overall variance within the county general fund, with all business groups staying within their legal appropriation limit. General purpose revenue is expected to be $104 million higher than expected, primarily due to better than assessed value growth and interest earnings, and improvements to these assumptions have been incorporated into next year's recommended budget. In total, projected general fund balance represents only 0.2% of the total budget for the general fund. Outside of the general fund, all other funds combined are projecting $98 million of fund balance, or 3.4% of the total budget. This is primarily due to positive variances in special revenue funds, including the road fund, the library fund, but also the Proposition 172 special revenue fund, as well as positive variances in the Department of Public Works special district funds, as well as internal service funds. In our previous economic updates, we have shared that the unassigned general fund reserve is and projected to remain below the target amount required to be maintained as a reserve by the administrative code. Based on the third quarter results, the county is currently estimated to be below the minimum by $139 million, and we anticipate that the amount below the minimum will be fully restored by amounts of FEMA reimbursement that we will recognize in 23-24. Uses of amounts of the reserve balances below the minimum for purposes that meet the criteria outlined on this slide are permissible with 4 votes of the board. And now, as we look ahead, economic uncertainty is still very much present, and we will continue to monitor the local economic conditions, including the county's pension market return, the San Diego housing activity, inflation and its effect on interest rates, and our local unemployment, along with negotiations over the federal debt ceiling and potential resulting economic impacts if a deal is not reached. As for the county, we will continue to examine the effects of the revised state budget to the county and make recommendations as necessary to mitigate any shortfalls that we may experience because of the state budget deficit in the future. And lastly, we will continue to monitor the FEMA reimbursement to ensure that we are prudently using our general fund reserve. That concludes my presentation, subject to your questions. Thank you for your time.
Thank you. I'm going to go ahead and turn over to public comment. Thank you.
Thank you, Chairwoman Vargas. We have 4 requests to speak on this item, 2 in person and 2 requesting to speak by phone. Also note we did not receive any comments on this item. For the members of the public that requested to speak on item 35 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. Both are in opposition to this item. I'd like to invite forward Alan C. and Audra. You'll have 2 minutes to address the board.
Man, it's like you guys just love blaming stuff on COVID so that you can continue to just spread these funds out because you're not going to be getting any more. And, you know, you could be spending, it's like as we're talking about these employees, you know, and you're helping them, I mean, you've done nothing for the people who have been basically punished with your initiatives and your everything that you've done with COVID. And you throw around all this money. I mean, all of this stuff is manufactured, like the inflation and all of that. Like, it's intentional, and you guys use it. I mean, what you're talking about pausing interest rates. It's like, I mean, so they just, you know, it's like go and pause it. I mean, but that doesn't mean someone's in control of it, right? But you guys always change your budget throughout the year. It's like you have a set price and then you somehow find, you know, millions, if not billions of other dollars of ours to just go and spend on something. But the way you throw around these COVID funds is like, you blame things on COVID that was your fault. And that's still our money that you're spending from the federal government. All the money that comes from the government, the state, it's the people's money. And it's not going to help the people. Like, all these people lost their lives, and you want to just be like, well, this is going to help housing. No, it's not. You guys are creating the problem. And then you use our money to make it worse and say that you're helping. And the people that really need help just get pushed to the side, and they're like, sorry, there's no help for you. Hopefully one day you guys don't have to go through that. Because it's pretty messed up that like all these people come and they want help or even just to be listened to, and you know, like I get beaten out in the hallway for it. That's the kind of help I get when I go and ask the sheriff for help. It's good. It's good.
Thank you. We'll now hear from the individual that requested to speak by phone.
Truth, Ebony, they never run out of cash. The Federal Reserve just prints more. That's what inflation is, funny money. So Nora, my friend, you can't be happy with these adjustments to your We Got You budget. As a budget lover, don't you think the budget should have been perfect the first time around? The County Health and Human Services Agency is still waiting on the $86 million check from FEMA. They got to wait a whole nother year. But it serves them right for doing business with such a corrupt group. Actually, I'm not sure which one's more corrupt or evil. But there's still $17.8 million for the rest of the year, and $115.9 million for all budgetary funds combined. Well, right up until you supervisors waste millions upon millions on a whole bunch of things we the people don't want, which of course is the occurrence at every meeting. $150,000 is being taken from the Criminal Justice Facility Construction Fund and being shifted to Courthouse Construction Professional Revenue Fund. Somebody's pet project is getting the green light. $650,000 for the Jail Commissary Enterprise Fund for more commissary items. Over $3.2 million for the Smuggler's Gulch Improvement Project at 200 River Valley Regional Park. Nora, how did you miss smuggling this money during the first budget round? $3 million for gasoline for the county's cars. I guess climate change is over. Nora, get Sandag on the phone. Let's change it up. Over $6.7 million more for the County Public Health Lab and their potential future virus experiment. $12 million for several major unanticipated legal settlements, including Nathan's dirty deeds, of course. $600,000 to transport more dead bodies, and millions of dollars being shifted around. So put homeless sweeper Meritod's Getting It Done Wrong budget with Nora's We Got You budget. And we have the entangled city and county dictated over with a We Done Got You Wrong financial stranglehold. Isn't that wonderful? So I don't like reading budgets. They're boring. Sorry, Nora. Not my style. But I did. You're welcome.
Thank you. Chairwoman Vargas, that concludes public comment on this item.
Happy to make the motion on this item. Thank you for all the work, and I know it's a lot, so thank you. I'm looking forward to the FEMA reimbursements particularly. Thank you. We have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. The next item on the agenda, thank you everyone for all of your work. We appreciate it. It's item number 36. I'm going to go ahead and turn it over to public comment.
Thank you, Chairwoman Vargas. We have 3 requests to speak on this item, 1 in person and 2 requesting to speak by phone. Also note that we received 1 e-comment in opposition of this item. For the members of the public that requested to speak on item 36 by phone, please dial into the conference line. We'll start with the in-person speaker. The speaker is in opposition. I'd like to invite forward Audra. You'll have 2 minutes to address the board.
Conflicts of interest, always going around, and then you guys get to approve all the conflict of interest codes. But who's holding you accountable to your conflicts of interest? Right? Like, that's the problem. It's like, you guys get to do that kind of stuff, and then the people as your oversight committee, you know, tries to hold you accountable, and it's like, you don't even follow your own conflict of interest codes. So how are you ones to approve the conflict of interest codes for all of these other entities? But it makes sense, because I mean, all of these entities that are created are to usurp the rights of the people under the guise of, we're here to help you. We're here to help you. So great. I feel like just sitting up here because no one's listening and no one does anyway, but you guys love being up there. We want to hear what you guys have to say, huh, Nora? Don't you call us your friends at Sandag? You're like, my friends are here. So excited. Nothing. It's like, it's nobody's here. It's just us. It's like, oh gosh, let's just ignore her. It's so fun. It's like, it's so nice just being here with all of you guys. It's like heart to hearts, you know? Feels good. I feel like you guys are just really here for the people. I do. I feel like you go home at night and you're like, I am going to do everything I can tomorrow to make sure that the people are safe and secure. I'm gonna put them in a 15-minute city and make them drink sewer water. You realize the city's talking about giving people sewer water, right? Why do anything about that? That would be weird. Does that mean we'll be drinking it here? That's so good.
Thank you. We'll now hear from the individual that requested to speak by phone.
This is Truth, and I'm a loner, a rebel, Dottie. Heart to heart or warm handoff is probably more accurate. As usual, I would say because most, if not all of you supervisors have taken part in conflicts of interest multiple times, you are all still very much unethically qualified to vote on these types of items. Nora, I know we disagreed on the number, but it's 2 or 3 today. But approving a new conflict of interest, particularly for the MTS board, I mean, things have been a wreck with naughty, narcissist Nathan approving codes that seem to work for his own benefit. Pretty disgusting. I guess now it's Nora's turn to approve her own future codes. We'll see. If you supervisors want, though, for this item, I could try speaking Arabic this time and see what happens. What do you think? Oh, man. Marhaba. Ismi Truth Habibi. Ana laha tahat ala Arabia. Shukran. But that's the most I can give. But Nora, what do you think about me speaking Arabic? Because on May 16th, your other friend, Misinformation Spear Sean, tried to suggest that I hate Muslims. Of course, he's just like MTS's former Nathan, a lying mythomaniac. And I told him so yesterday, of course. So for the public's knowledge, though, under corrupt state law, the California Political Reform Act, a public official only has a disqualifying conflict of interest in a governmental decision if the decision will have a financial impact on their personal finances or other financial interests. Unfortunately, the Conflict of Interest Code only applies to finances and not conspiratorial or ideological alliances and biases like it should. So that's why these supervisors can legally do what they've done in this regard. But it makes people wonder then, what's the point of these conflict of interest codes?
I'm not sure if any of us can see what all this is supposed to mean. Supposed to mean? Supposed to mean? I think everyone here knows what this is supposed to mean. You've gone over something again and again and again and
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
Okay. I am happy to make a motion on this item. Is there a second? All right. If there's no further discussion, please vote.
Chairwoman Vargas, the motion passes unanimously with all supervisors being present and voting aye.
Okay. With that, at each meeting, I ask my colleagues to provide any brief update, reports, progress, share any pertinent information. Colleagues, do you have any comments, reports? No? Okay. With that, I'm going to go to the next item, which is concludes the business for today. But actually, I'm going to do adjournments. And so let me just go ahead and I have 2 adjournments that I want to do today. And one of them is for Aurora Reyes, was preceded in death by her beloved husband of 57 years, Jose Reyes, who was born August 15, 1923 in Imus, Cavite. Aurora lived in the Philippines until 1965 when Jose's service in the United States Navy brought them to San Diego, where she resided until her death. Aurora Reyes of San Diego passed away peacefully on Easter Sunday, April 9th. She was 95 years old. And Aurora was an active member of St. Charles Catholic Church and San Diego Police Department Southern Division Community Appreciation Luncheon Program, as well as a devoted homemaker. Aurora was the oldest of 5 siblings, and Aurora and Jose continued the tradition of large families by having 5 children of their own: Rose, Rebecca, Rebelina, Reynaldo, and Rodel. She was blessed with 14 grandchildren who fondly remember her kindness and showing her love through her cooking. May she rest in peace. And then the next adjournment is in memory of former Supervisor Gloria Molina. This is one that I wanted to make sure we highlighted her today because it is my honor to adjourn in her memory. Gloria Molina was a groundbreaking Chicana leader in the state and local California politics for more than 30 years. She died on Mother's Day after a 3-year battle with cancer. She was 74. Gloria Molina was an activist turned trailblazing champion for social justice and the embodiment of why representation matters. She was the first Latina elected to our state legislature in 1982, first Latina elected to the Los Angeles City Council in 1987, and the first Latina elected to the Los Angeles County Board of Supervisors in 1991. Prior to her election to public office, she served as a deputy for presidential personnel in the Carter administration and as a deputy director for Department of Health and Human Services for the city and county of San Francisco. Early in her career, she became an advocate for women's health and started the nurse mentoring program to address the nation's shortage of nurses by partnering with local community colleges to boost nursing students. Her legacy is rooted in building healthier and stronger communities and showed us the importance of being at the table. Gloria Molina is the reason why so many young Latinas and women of color found their voice and confidence to be able to be seen, to run for office, and to be fierce advocates for their beliefs and for their communities. There are so many of us who owe her a debt of gratitude and for opening the door to opportunity for so many women in politics and in advocacy. As the first in many respects, she leaves a formidable legacy that we must honor by continuing to break ceilings. And her impact leaves a legacy felt not just in Southern California, but across the state and the country. Que descanse en paz, Gloria Molina. Muchísimas gracias por su liderazgo y por luchar por nuestra comunidad. Su ejemplo nos recuerda que sí se puede. May Gloria Molina rest in power. And with that, I am going to turn it over to the remainder of public speakers for non-agenda public comments.
Thank you, Chairwoman Vargas. We have 8 remaining requests to speak on matters not listed on the agenda, 1 in person and 7 requesting to speak by phone. For those that requested to speak by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speaker. I'd like to invite forward Audra. We'll have 2 minutes to address the board.
So on a serious note, you guys think it's cool to give people sewer water? Like as a pure water initiative with the city, that giving people sewer water is better than groundwater that could be drilled for? No, nothing on that. You You guys are okay with that. See, that's what's so weird. And even you're on Sandag and MTS, Nora, and these people come in and they just need a bathroom, like just to ride the transit. And you guys want us to ride all this transit, right? And people are having urine retention issues, like just your own workers on these buses because they don't have a way to go to the bathroom, let alone the people that come and want to ride this stuff. And you guys are spending $10,000 on a solar compacting trash can that, what happens when the sun's not out? Does it still compact? And you won't even provide bathrooms for people. Even if it's like a porta potty, I mean, you may as well give them Depends, I don't know, something, because it's just pretty messed up to expect these people to work like this, and you want people to ride this type of transit, but you're not even providing anything for them to use it and have it be conducive. I mean, who wants to like have issues going to the bathroom because you're working and they're not providing you any kind of out? And you're just like, well, I need my job, so I gotta just keep holding it. I mean, you guys claim to care, but I mean, for real, it's like $10,000 on a trash can. So $250,000 on 25 trash cans or whatever. And you could spend that on one bathroom. But you're like, we need security, oh my gosh. It's like, yeah, but provide stuff for people. Don't just be all talk, like actually do something for the people instead of making all these people suffer under your hand and your direction because you don't want to provide the things that are, you know, conducive to just living everyday life. I'm sure that you guys go to the bathroom every time you want here. Those people should have the same opportunity.
Thank you. We'll now hear from the individuals that requested to speak by phone.
Paul Henkin. I'm concerned about Sandag and its waste and abuse of public funds. I am concerned about the failed audit, exclusion of dissenters on the board, and of its passing proposals with 4 weighted votes rather than a majority. That is not democratic. It's a public group, not a private club. I'm glad you want to add a rep for the unincorporated area, but I don't expect this to be a solution to the weighted vote problem, since the unincorporated area is so thinly populated. Do the math. Sandag's mission is transportation planning, not city planning, but forcing people into dirty, disgusting, and dangerous buses won't work. Their frequency is not often enough. They move too slowly, and they stop too often. They can't even be trusted with our money. These people aren't much better. I did not get a warm fuzzy the other day when the board reviewed the military equipment use policy, and Tara pointed out that it lacked several details, like the types of weapons and capabilities. This is not acceptable. What is the point of spending our money to create a more or less detailed document if you are not willing to do more than a token objection when things like specificity and clarity are actually admitted? This makes me wonder, will this lack of specificity be used to justify use of force in the future, like failed death?
Now hear from the next caller.
Hey, it's Truth, and I would have loved to come in person today, but I was busy researching because you supervisors put 37 items in the agenda. These agendas need to be shorter, seriously. Now, a message for you, Paul. It's always good when you point out how there's always non-routine items in the consent calendar, all kinds of different items that deserve their own discussion time. Here's a short way to say that. The consent is routinely not routine, which is also why I don't consent to the consent. Now, regarding today's proclamation, I can attest that when Voices for Children, who receive millions of dollars from these supervisors and all kinds of city councils every week, when they said that the supervisors have changed the lives of children forever, they were 100% telling the truth. I wish it was for a positive, but it's not. Now about the county's Recovery Action Fund. It seems like it's being used to dump the last of the American Destruction Plan Act debt dollars. $4,000 blank inflation-causing checks to whichever fool wants to buy into the slave system. Now, something else that needs to be addressed here at BOS is the volume of the video stream. It's way too low, and it's getting lower every month. It needs to be increased immediately. But I do want to give a shout-out to the county camera crew. They've been adjusting the visual height and even capturing people's signs into the shot. Good job. Now, lastly, Jim, on May 18th in the Vista Press, you are warning people about the road to socialism. Well, if you're really against socialism, then why did you say last year that there's nothing wrong with communist Alger Hiss-founded the United Nations CEDAW ordinance when it talks about changing countries' cultures and even school textbooks and creates tribunals? If you believe that buzzwords like equity are false promises used to blame the rich to help the poor, then why do you vote yes for every item in the agenda that uses the word equity in it? And why do you never speak against socialism here in the chambers? Come on. But you voted against the San Diego Housing Commission today, so you can still change. It's okay to join the good side. We have.
And Chairwoman Vargas, that concludes the request for non-agenda public communication this afternoon.
Thank you. We're going to be taking our closed session during tomorrow's board meeting. With that, this session is adjourned.
No, for the record,
thank you.
Item 37, the closed session matters being continued to the Planning and Land Use session of this meeting tomorrow, Wednesday, May 23rd, 2023. The next meeting of the board will begin the budget hearing process, which will start on Monday, June 12th, 2023 at 9 a.m., when the board will receive a presentation on the fiscal years 2023 through 25 recommended operational plan and receive public testimony in all areas of the budget. A second budget hearing is also scheduled for Thursday, June 15th, 2023 at 5:30 p.m. Thank you.